Hi everyone, very good evening to each one of you. Myself, Dr. Vaibhav Jain, and today we will be learning about the anesthesiology. So this is going to be the quick rapid revision for anesthesiology, where we are going to learn about all the important questions that has been asked in your examinations. I'm going to make you understand what is anesthesia and what are the things you should be remembering just before your exam, right? So we will be discussing in the format of a story, right? So we will be starting it off with the introduction, right? Then we will learn about the different types of anesthesias that we are having, right? Then we will learn about the pre-anesthetic checkup, intubation, your anesthesia machine, your anesthesia circuits, your anesthetic agents, oxygen therapy, fluids, and miscellaneous topics, right? So we'll go in the sequence, right? This is my Instagram and Telegram. I would be posting the PDF over there. You can download the PDF from there, right? And you can also download the PDF from the like Meduhub channel also, right? So what is the thing we are having over here? Introduction, we are going to learn what is anesthesia, who discovered anesthesia. Some questions they will be asking you from the fathers of anesthesia. So that is what we are going to focus on first thing. Then we will look about the different types of anesthesia, like we have got general anesthesia, we have got regional anesthesia, we have got local anesthesia, right? Then we will discuss about the pre-anesthetic checkup. What is this pre-anesthetic checkup? क्या होता है pre-anesthetic checkup? Then we will learn about the intubation, how to intubate the patient, how to look for that patient, like what are the monitors we are having. We are having some machines, how we are going to connect our patient to the machine, वो यहाँ पर पढ़ेंगे. फिर देखेंगे anesthesia circuits के बारे में, कितने तरीके के हमारे पास में circuits होते हैं. We are going to learn about them. And then some drugs we will be discussing. What are the IV anesthetic agent, what are the inhalational agents, what are the muscle relaxants we are having. Ultimately we will discuss about the types of oxygen therapies, like we are using nasal cannula, sometimes we are using nasal prongs, sometimes we are using non-rebreathable mask, sometimes we are using what venturi mask. So how we are going to decide that, we will learn in the oxygen therapy. And we will learn about the fluids, type of fluids, like when to give RL, when to give NS, when to give D5, D10, and colloid substances, right? And ultimately we will end up with the miscellaneous topic. This is going to be the scheme of class for today. So let's begin with the history of anesthesiology. Who is the father of anesthesiology? Who is the father of anesthesiology? The first scientist that we are having over here, this is known as W.T.G. Morton beta. This is known as W.T.G. Morton. He is also considered as the father of anesthesiology. Lots of people has tried anesthesia before that, but this was the he was the one who has successfully demonstrated the use of anesthesia, right? For the first time he has successfully demonstrated the anesthesia, right? So he is considered as the father of anesthesia. Father of anesthesia, your answer will be W.T.G. Morton. Remember, another question they will be asking you, who gave the term anesthesia beta? The term anesthesia was given by Oliver Wendell Holmes. The term anesthesia was given by Oliver Wendell Holmes. He was the scientist who was standing there. This is how they have demonstrated the anesthesia, right? He was the scientist who was standing there. This scientist has given what? This has given the name anesthesia. The term anesthesia was given by Oliver Wendell Holmes. Term anesthesia was given by Oliver Wendell Holmes. And how they have demonstrated anesthesia for the first time, they have used what? They have used the ether, and it was an open circuit. They are putting open circuit is something like we are having a structure, jali jaisi structure hogi. You are going to put it on the face, mask like structure will be there. You are going to apply a cloth over there, and then you are going to put the drops of what? Ether. This is how they have given the anesthesia, open anesthesia. We don't do it now, right? This was the first two important scientists that we are having. So what was the day when they have done this particular thing? The day was 18th of October. Sorry, the day was 16th of October 1846. 16th of October 1846, and that is why 16th of October is also celebrated as World Anesthesia Day. World Anesthesia Day, right? This is why this is also celebrated as World Anesthesia Day that we are having. Then who is this another scientist we are having? This is also known as the father of epidemiology. This is nothing but your John Snow. This is your John Snow. He is also considered as the father of epidemiology. Father of epidemiology. What is epidemiology? Epi means among, demi means people, and logi means study. So these are the people who are going to epidemiology means it is not the study of population, it is that is known as demography that you study in PSF, right? Epidemiology means they are going to learn about the disease among the society. This is going to be what? Among the people, what are the diseases we are having? This is going to be epidemiology, beta. Epidemiology is also considered as the father of epidemiology. He started giving importance for the obstetric anesthesia. Anesthesia used in the obstetrics, right? In the ops, anesthesia use was given by this particular John Snow. John Snow was the one who has given the use of anesthesia in the obstetric, right? Then who is this particular scientist? This is your nothing but your Edmund Gaskin Boyle. This is your Edmund Gaskin Boyle. And remember, beta, he has given the Boyle's machine. He has given the Boyle's machine or Boyle's apparatus. He has given what? Boyle's machine or Boyle's apparatus. What was Boyle's law? Yesterday we have seen Boyle's law. That was your Boyle's law was pressure is inversely proportional to volume. That is known as Boyle's law. That is known as Boyle's law. This is known as Boyle's machine, right? Who has given this August? Next scientist that we are having is the who has given the Bayer's block. That is your August Bayer. August Bayer has given the Bayer's block, and he has also given the first anesthesia. He has also given the first spinal anesthesia, beta. Yes, beta, this is going to be, yes, this is going to be enough, right? Along with that, we have covered lots of questions also. Okay, just be with me till the end of the session. You will understand the anesthesiology completely, right? It is very simple subject. Some questions you have to do, you will be doing those questions. I've just tried to cover the most important things in 3 to 4 hours. We can cover only important part only, right? But at this point of time, it is going to be enough, right? So how many types of anesthesias do we have, beta? How many types of anesthesias do we have? So anesthesias, we are having 3 important type of anesthesia. First one is going to be general anesthesia. Second one is going to be regional anesthesia. Third one is going to be local anesthesia. So general anesthesia का मतलब क्या होता है? General anesthesia means we are anesthetizing the complete body. You can appreciate. General anesthesia मतलब complete body is getting anesthetized. Okay, anesthesia मतलब क्या होता है? Absence of sensations will be there. Absence of sensations will be there, right? So in general anesthesia, we are giving anesthesia to the person, and complete body will be, there will be no sensations. There will be no sensations will be there, right? This is going to be general anesthesia. So what are the 2 methods we can use for this general anesthesia? हम लोग general anesthesia कैसे दे सकते हैं बच्चा? We can use 2 things. Either we can use inhalational agents. Inhalational agents, like we can use certain gases. We have got halothane, isoflurane, sevoflurane, desflurane, methoxyflurane. आगे पढ़ेंगे anesthetic agents. So we can use inhalational one. पहला तो inhale करवा दो patient को. दूसरा you can also use IV agents बेटा. दूसरा तरीका क्या है? आप patient को IV agent दे दो, right? You can give anesthesia, general anesthesia via 2 routes. What are those 2 routes? General anesthesia, one is inhalational, another one is IV agent. Okay, second we have got is regional anesthesia. Complete region will be blocked. For example, here the lower part is blocked, here lower part, along with that some upper part is also blocked, right? For example, here we have just blocked one arm of the patient. This is known as regional anesthesia. This is known as regional anesthesia. This regional anesthesia we have further divided into 2 halves, right? What are those 2 types of regional anesthesia? We can use central neuraxial blockade. If you are giving something on the center, if you are giving something on the center, what we have in the center, central nervous system में क्या आता है? We have got brain, we have got spinal cord, right? तो अगर आप यहाँ से कुछ भी दवाई देते हो, this is going to be central neuraxial blockade. Like we have got certain types of anesthesias here, like we have got spinal anesthesia, we have got epidural anesthesia, we have also got caudal anesthesia. These are the examples of what? These are the examples of central neuraxial blockade. Then we have got what? Then we have got peripheral neuraxial blockade. Then we have got what? Peripheral neuraxial blockade. That means now we are giving drugs on the periphery. This is going to be peripheral neuraxial blockade. Like we can give multiple types of blocks. Like we can give sciatic block, we can give femoral block, we can give brachial plexus block, brachial block, right? तो हम जहां से भी बंद करें, फॉर एग्जांपल हियर यू विल बी हैविंग brachial plexus, if I'm going to give a drug here, what is going to happen? Now this information is not going to come below, right? Now this information from my hand is not able to go to my head, and if information is not going to my head, if information is not reaching to my head, how would I get to know what is the thing we are having, right? So I'm not going to sense any information, right, in my brain. This is going to be which anesthesia? This is going to be peripheral neuroaxial, sorry, this is going to be what? Peripheral neuroaxial block and brachial block I can give, right? Then we have got what? Local anesthesia. Local anesthesia on a particular local part of the body, बेटा है ना, कहीं पर भी locally अगर हम use में ले रहे हैं, this is going to be local anesthesia. What are the drugs we are having? We can use infiltration method. We can use infiltration method. We can also apply this topically. We can use infiltration method. We can also give it topically. What is infiltration? Like for example, I want to extract my tooth. Am I going to give general anesthesia to the patient? No. General anesthesia complete body का क्या करना है? What is the thing? रीजनल एनेस्थीसिया देना है? नहीं सर, क्या करना है? लोकली. आई वॉन्ट समथिंग टू हैपन लोकली. आई कैन इन्फिल्ट्रेट द ड्रग अराउंड द नर्व फाइबर्स अराउंड माई tooth, right? This is going to be what? Infiltration anesthesia that we will be using for tooth extraction, right? So basic anesthesia you got to understand, right? How many types of anesthesia? We have got general, we have got regional, we have got local anesthesia, right? These are the types of anesthesias that we are having, right? These are the scientists that we have discussed, right? So this is the basic part, right? What are the features of anesthesia? Remember beta, first of all we are going to do the induction of the patient, right? सबसे पहले patient को pre-oxygenation करना है. You need to pre-oxygenate the patient. You need to give oxygen to the patient. You can do what? You can do induction of the patient. You can do what are the steps? You can do the maintenance of the patient. आप पेशेंट को बेहोश करोगे, उसको मेंटेन करोगे, एंड देन यू विल बी डूइंग व्हाट? रिवर्सल ऑफ द पेशेंट. दीज आर द कंपोनेंट्स ऑफ एनेस्थीसिया, है ना? दीज थ्री आर. हमको क्या करना है? पेशेंट को बुलाना है, पेशेंट को इंड्यूस करना है, पेशेंट को इंडक्शन करना है. आफ्टर इंडक्शन वी नीड टू मेंटेन द पेशेंट सो दैट सर्जन कैन परफॉर्म द सर्जरी, and lastly we have got what? Reversal. Lastly we have got what? Reversal. Or let me make you understand this particular fact in the format of a story. कहानी की तरह पढ़ते हैं. For example, one patient is coming to you. For example, one patient is coming to you with some kind of symptoms, right? Some kind of symptoms patient is having. What are the symptoms? Patient is having pain in the abdomen, right? If patient is having pain in the abdomen, क्या करेंगे? Anesthesia देने से पहले, surgery करने से पहले, for example, surgeon will suspect that this patient is having stone in the gallbladder, right? So this is going to be a case of cholelithiasis, right? This patient is having what? Cholelithiasis. Now what you can do? Surgeon cannot operate directly, right? Surgeon आपको directly operate नहीं करेगा. This surgeon is going to send you. The surgeon is going to send you to the anesthesia department, right? He will be telling you, okay sir, you go to anesthesia department for pre-anesthetic checkup. आप पहले anesthesia का checkup करवाओ, right? And then they will give you the dates, and then you can come to the hospital and I would operate. I will do the cholecystectomy. I will do the cholecystectomy. I can do the surgery, but the thing is you need to get the PAC first, right? So what is this PAC? Pre-anesthetic checkup, right? Before giving anesthesia to any patient or before going to surgery, what we need to do? We need to do what? We need to understand. General anesthesia अगर किसी को देना है, surgery किसी का करना है, so what we need to do? We need to understand the basics of this particular person, right? So what are the things we are going to look for in the pre-anesthetic evaluation? We are going to do the pre-anesthetic evaluation or pre-anesthetic checkup. You understand this? तो सबसे पहले क्या करना है? सर्जरी से पहले दिस पेशेंट विल कम टू अस, राइट? दिस पेशेंट विल गो टू एनेस्थीसिया डिपार्टमेंट. इन एनेस्थीसिया डिपार्टमेंट they are going to take the history from the patient. They are going to do the general physical and systemic examination of the patient, whether the lungs are fine, whether the kidney is fine, whether the liver is fine. So they are going to understand what is the situation of this patient. They are going to do certain testings like CBC, बाकी सारे टेस्ट करने के बाद में they will be doing airway evaluation, whether this patient is we can intubate this patient very nicely or not. तो ये सारी चीजें हम लोग कहाँ करेंगे? All these things will be done in the anesthesia department, right? Once you will understand these things in the anesthesia department, they will be giving the clearance. They will be writing something, and this something will be given to what? This clearance will be given to surgeon. Now surgeon will see this clearance, whether he should operate or he should not operate. If they have given the clearance, if they have written, they will be writing certain things, like they will be writing ASA grading, I will make you understand. They will be writing you Mallam Patti grading, they will be writing you, right? So anesthesia people will be writing, okay, ASA 1, ASA 2, Mallam Patti 2. So surgeon will see this particular keywords and he will understand, okay, this surgery is easy, this surgery is hard, this surgery is typical, this patient is typical, right? So this particular thing you will be, your surgeon will get to understand when this anesthesia people will write this particular things, right? And now what is going to happen in the format of a story? Same story. Now when a patient has completed the PSC, after PSC, this anesthesia people will also tell this particular person the NPO order. ओके सर, यू कम ऑन मंडे, है ना, हम लोग बोलेंगे उसको कि आप मंडे को आ जाओ, रात को ये दवाई खानी है, दिस इज नॉन एज, रात को ये दवाई खानी है, ये खाना नहीं खाना, ये खाना खाना है, 8 बजे के बाद में खाना नहीं खाना. दीज थिंग्स आर नॉन एज व्हाट? दीज थिंग्स आर नॉन एज निल पर ओरल ऑर्डर्स, है ना. तो ये किसका काम है? ये एनेस्थीसियोलॉजिस्ट का काम है. ही इज गोइंग टू गिव यू निल पर ओरल ऑर्डर्स एंड ही इज ऑल्सो गोइंग टू गिव यू प्री एनेस्थेटिक मेडिकेशन चार्ट, like what medications you can continue. Maybe this patient is a hypertensive patient, वो आपसे पूछेगा सर क्या मैं दवाई लेके आऊँ या दवाई नहीं लेके आऊँ, राइट? सो हु इज गोइंग टू टेल दिस थिंग? सर्जन को क्या पता क्या चल रहा है, राइट? सर्जन इज ओनली गोइंग टू डू व्हाट? सर्जरी, राइट? ही इज नॉट गोइंग टू इंटरेक्ट विद द पेशेंट, so he is only going to do surgery. But this anesthesia people will get to know, okay, this patient is on antihypertensive, this patient is on aspirin, this patient might be on different other drugs, right? So you will be able to understand these things. Once you will understand these things, you will be writing this patient, okay sir, आप मंडे को आ जाओ, on a Monday you don't eat this food after 8 p.m. ओके, रात को 10 बजे के बाद में खाना नहीं खाना या खा सकते हो, डिपेंडिंग ऑन द केसेस, राइट? सेकेंड थिंग, दे विल बी टेलिंग यू कितने घंटे की सर्जरी होगी, 6 आवर्स, 2 आवर्स, दिस इज गोइंग टू बी द टाइम पीरियड, डे केयर है, जो भी है, this is going to be the duty of this is the duty of the anesthesiologist who is going to make you understand these things, right? So what are the questions they will be asking you and what is the utilization of this pre-anesthetic evaluation, beta, है ना? प्री एनेस्थेटिक इवेल्युएशन का क्या यूटिलाइजेशन है? फर्स्ट ऑफ ऑल वी आर गोइंग टू आस्क दिस पेशेंट द नेम. Why name is important? नाम क्यों important है? Name is going to tell us about the religion of the person sometimes, right? And religion is going to tell us about the eating habits of the person, right? So this is why this name is important. The age is important because some diseases are more common in age group, right? Age group, older age group, some diseases are more common, whereas some diseases are more common in young people, right? Age group is also important and sex is also important. So basic history, like we every day, every time we are going to see sex, age and name of the person. This is going to be the basic history. Then you will take for the special history. What is the special history you are going to take? You will understand about the drug allergy. Maybe the patient will tell you, sir, I'm allergic to penicillin, don't give me penicillin, right? So we are going to take this. You are also going to take the medication history, whatever drugs this patient is already taking, okay? Because some drugs you will be giving to this particular patient. There might be possibility this patient is taking anti-tubercular drugs, or there might be possibility he is taking anti-HIV drugs, right? Heart therapy is on, right? So this is why it is important to have this medication history. Then we are going to ask for the surgical history of the patient. Surgical history, whether this patient has undergone any kind of surgeries previously, right? This is going to be surgical history. And then we will ask for the anesthesia exposure, whether this patient is already exposed to anesthesia. Yesterday I've given you one question about anesthesia, right? That was a question with rhinodine receptor. I hope you will be able to recall that question, try to answer. And physio we have discussed about that question. So we are going to learn about the anesthesia exposure history, right? So this is going to be the first thing we are going to learn about. This is going to be the history of the patient, beta, history of the patient, right? Second thing we are having is general physical examination. What is this physical examination is including? This is going to include the basic examination like pulse of the patient, BP of the patient, whether there is any kind of cyanosis on the body, cyanosis is there, whether this patient is having what, pallor. This is going to be what? This is going to be your general physical examination that we are having. Then we go for systemic examination when we are going to see about the systems of the patient. What are the systems we are having? We have got CVS, cardiovascular system, we have got respiratory system, we have got central nervous system, we have got GIT, right? All these systems they will be checking whether this patient is having everything fine, right? Before surgery we need to check for all those things. This is the patient is having no problems in the systemic systems, right? Then we will write certain investigations. What are the investigations? Like we will check for the CBC, we will check for the electrolytes of the patient, whether electrolytes are balanced or not, like sodium, potassium. We check for the urea of the patient, and we check for this like we check for the kidney. So we check for creatinine, we check for LFT for the liver, right? Liver function test. Creatinine is going to tell us the story of kidney, whether kidneys are working fine or not, right? These things we are going to look for. This is known as investigations, right? So these investigations they will be writing, and the most important thing is going to be what? Most important thing is going to be what, Bacha? This is going to be airway evaluation of this particular patient. Sir, airway evaluation, why most important? Is to assess the airway, beta, to assess the airway of this particular patient, right? How we can assess the airway? We can write certain gradings. These gradings are known as what? We are going to look for Mallam Patti gradings, beta. We are going to look for Mallam Patti gradings. We are going to look for some other gradings, like we can check the Cormack-Lehine grading, Cormack-Lehine grading, right? We can check for the ASA grading, right? These are the grading system that we need to understand in this airway evaluation of the patient, right? तो अभी हम लोगों ने क्या किया, हमारे पास में एक पेशेंट आया था. A patient is having cholelithiasis. This patient is having stones in the gallbladder. This is the patient of stones, right? इसके gallbladder में stones है, and he want to have surgery. He want to remove those stones. We can do elective surgery. We can do emergency surgery. Right now, I'm just teaching you about the emergency surgery. Sorry, elective surgery. I'm teaching you about the elective surgery. So what is going to happen? Our surgeon will send this patient to anesthesia department. They are going to do PAC. Now, what are the components of PAC? These are the components. We can check for the history. We can check for the general physical examination, systemic examination, investigations. Airway evaluation is the most important part of this PAC. What is the most important part of this PAC? This is the airway evaluation. Now, just try to tell this question. How is the preoperative evaluation of the oral cavity conducted in adult to facilitate endotracheal intubation? What is going to be your answer here? What is going to be your answer? How is the preoperative evaluation of the oral cavity? Preoperative means before the operation, evaluation of oral cavity conducted in adult to facilitate endotracheal intubation, right? So before intubation, what is the thing we are going to see? Try to answer this one. Yes, you are answering me Mallam Patti score. You are answering me Mallam Patti score, right? So this is going to be the Mallam Patti score. We are going to learn to assess the size of the tongue. Mallam Patti score is going to tell us about to assess the size of the tongue, beta. Size of the tongue with respect to oral cavity. So here we are going to assess the size of the tongue with respect to oral cavity. What is this Cormack-Lehine grading? This is the glottic opening. This is the glottic opening. This is the glottic opening under laryngoscopic view. Under laryngoscopic view. So what we can see inside the laryngoscope, what we are able to see inside the laryngoscope, when you are going to put the laryngoscope, what is the thing you can see? This is known as Cormack-Lehine grading. Cormack-Lehine grading, right? This is the A, right? What is this ASA grading? I'm going to make you understand this ASA grading, and this AHA is for the heart. This AHA is for the heart, right? This is for the heart, right? ASA, American Society of Anesthesiologists grading, right? AHA is for the heart. AHA is for the heart. So what is going to be your answer here in this particular case is going to be what? This is going to be the A. This is going to be A, bacha, right? So what is this ASA grading? Let's try to understand. This is going to be your American Society of Anesthesiologists. ASA means American Society of Anesthesiologists. anesthesiologist grading. This is going to be American Society of Anesthesiologists grading, right? This is going to tell us about the physical status of the patient. What we are going to understand with this ASA grading, we can understand about the physical status of the patient, how this patient is, what is the condition of this particular patient, right? So we have got 6 grades. We have got 6 grade. We have got ASA 1, 2, 3, 4, 5, 6. We have got 6 grading system here, right? So ASA 1, American Society of Anesthesiologists 1, this is going to tell us about the physical status of the patient, whether the patient is fit, whether the patient is fine for the surgery, what kind of patient is this. This anesthesia people is going to write what? They are going to write ASA grading. They are going to write on the paper after PAC, they are going to write this patient is ASA 1, ASA 2, ASA 3, like that, okay? So this is going to be the ASA grading, right? So we have got ASA 1. What is ASA 1? Normal healthy patient. If the patient is completely normal and healthy patient, this is going to be what? ASA grade 1, without any organic or biochemical or psychiatric diseases. This is considered as ASA 1. ASA 2 will be including what? Mild systemic diseases. If someone is having mild systemic diseases but there is no significant effect on daily activity, right? For example, this patient is having mild diabetes, maybe the HbA1c is like 7 or 8, right? Controlled hypertension, this patient might be taking the drugs and this is a controlled hypertension. This is considered as ASA 2. The patient will be obese, right? This is also considered as ASA 2, American Society of Anesthesiologists grading 2, right? ASA 3 will be what? Which are 3 is going to be severe systemic disease. ASA 3 is going to be what? Severe systemic disease. For example, this patient is having COPD, patient is having what? Asthma, patient is having what? Angina, right? Or some earlier they had what? Myocardial infarction, right? So they are going to be what? They are going to be ASA grade 3. ASA grade 4 is going to be the a disease is there which is a constant threat to life. A disease is there which is a constant threat to life. For example, this patient might be having congestive heart failure. Heart failure is already there, right? Unstable angina might be there. This patient might have renal failure, acute MI, all these things, respiratory failure. Okay, these are the conditions which are going to be ASA 4. ASA 5 is going to be your moribund patient. Okay, so this patient is, we are not expecting this patient to survive more than 24 hours, right? For example, this patient is having ruptured aneurysm. You understand what is ruptured aneurysm, right? You have this aorta and you will be having the aneurysm, means dilatation of aorta. That might be any kind of aneurysm you can have secular dilatation, you can have any kind of dilatation. This is aorta. If you are having this dilatation in the aorta, this is going to be aneurysm, and it can rupture any point of time. And what this patient is going to die, right? This patient is not going to survive for such a long period of time if you are having this ruptured aneurysm, right? So this is going to be category 5 patient, where we are having the moribund patient. What is category 6? ASA 6 is going to be brain dead patient, and now we are going to do what? Organ harvesting, right? So we have understood about the 6 grades. What are 6 grades? Beta, important question hai. They are going to ask you. ASA 1, normal healthy patient. Just speak with me wherever you are. ASA 1, normal healthy patient. ASA 2, mild systemic disease. ASA 3, severe systemic disease. ASA 4 is going to be a constant threat to life. ASA 5 is moribund patient. ASA 6 is organ harvesting, right? So what are the, we are having 6 gradings. ASA 1 is going to be healthy patient. ASA 1 is going to be healthy patient. ASA grade 2 is going to be mild systemic disease, mild disease, systemic disease. ASA 3 is going to be severe disease, severe disease, right? ASA 4 is going to be constant threat to life, constant threat to life. ASA 5 is a moribund patient, moribund patient which is not expected to survive more than 24 hours. And ASA 6 is organ harvesting. This is a coma patient, brain dead patient, organ harvesting, right? So your anesthesia people will write in this particular manner that this patient is a ASA 1 patient. Then the Surgeon will be very happy. This is a healthy patient. I just need to cut. I need not to worry about anything else. If you are writing ASA 4, then surgeon needs to be like he should be active. He will be thinking like that. Okay, this patient is having some other disease which are constant threat to life. We require more expertise, है ना? तो ये patient resident को नहीं मिलेगा. ये patient directly the senior consultant will come. He will be doing the surgery, right? इस patient healthy patient में you can give this case to resident also, है ना? आप इसको साथ में असिस्ट कर सकते हो, राइट? बट हियर यू रिक्वायर constant like constant threat is there. That means you require what? You require more expertise, right? You require more doctors also, right? This is going to be ASA grade 4, 5 and 6. This is how we will assess this, right? This ASA grading is for the normal healthy patient beta. Sorry, this ASA grading is for the which surgery? Elective surgery. Okay, this ASA grading is for the elective surgery, whereas this ASA grading E, this is for the emergency surgeries, right? We are going to do, if we are writing 1E, this means it is an emergency surgery. 5E, that means it is a emergency surgery. This E means what? This E means emergency surgeries, right? This E means emergency surgeries. We have got two types of surgeries. One is going to be elective one, another one is going to be emergency. Elective में क्या है कि बाद में भी कर लेंगे तो कोई दिक्कत नहीं है. Emergency में क्या है? You need to do it on the sport, right? This is going to be the elective and emergency surgeries we are having. So first thing they will be writing you is about the, okay, first thing they will be writing you is about the ASA grading. Okay, don't worry about PDF. I will upload both the PDF today, है ना? दोनों PDF डाल देंगे आज, ठीक है? Next thing we have got is airway. Next thing we have got is about the airway. What is the airway we are having? This is known as Mallam Patti grading. I told you this Mallam Patti grading is going to be the assessment of oral cavity beta. This is going to be the, this is why we are doing, this is the assessment of oral cavity. This is assessment of oral cavity with respect to the size of tongue. With respect to the size of tongue, or some people are having what? Some people are eating what? Nicotinic products, right? तो जो ये लोग ये चीजें खाते हैं इसकी वजह से there will be fibrosis, so they cannot open their mouth, right? So we are going to assess whether this patient is able to open the mouth or not, right? Only if the patient is able to open the mouth, then only we can enter into the mouth, and then only we can put our endotracheal tube into the trachea, right? So this is how we can understand this particular thing. So before entering into OT, right, हमको पहले ही देखना पड़ेगा पेशेंट का माउथ खुल रहा है कि नहीं खुल रहा है, राइट? Suppose we have started something and this patient is not able to open the mouth, उसका mouth ही नहीं खुल रहा है, you are not able to see the glottic opening, दिक्कत हो जाएगा, right? How you are going to intubate this patient if you are not able to see the glottic opening? तो इन चीज़ों को पहले से ही कवर करके रखना है. And how we are going to assess that? We are having 4 classes बेटा, 4 classes. Remember this class 1 and class 2 are going to be easy intubation. This class 1 and class 2 are going to be easy intubation, whereas this class 3 and class 4 are going to be difficult intubation. They are going to be डिफिकल्ट इंट्यूबेशन. यहाँ पर पेशेंट को इंट्यूबेट करने में दिक्कत आएगी. वाई दिक्कत आएगी? क्यों दिक्कत आएगी? बिकॉज क्लास 1 यू कैन अप्रिशिएट, इन क्लास 1 यू कैन सी ऑल द थिंग्स वेरी नाइसली, right? Class 1, what are the things you can see? Can you appreciate the soft palate? Yes, we can see the soft palate. Can you appreciate the uvula? Yes, we can see the uvula. Can you appreciate the faucious pillar? Right, we can see the faucial pillars also, right? Everything is visible, very nicely visible. This is going to be class 1, that is going to be easy intubation, everything visible, right? Everything is visible. This is going to be class 1. What is class 2? Class 2 will be having what? Class 2 will be having soft palate is visible and hard palate is also visible. Soft palate, uvula and fauces are going to be visible. These are the things which are going to be visible. But what about the pillars? What about the pillars? These pillars are not visible yet. These pillars, faucial pillars, are not going to be visible here. Pillars are going to be not visible here. In class 3, what is going to happen? Only you are going to see what? Soft palate. You are going to see the base of uvula. You are going to see the soft palate and you are going to see the base of uvula. And in class 4, you can only appreciate what? You can only appreciate the hard palate. You can only appreciate the hard palate. Sir, इसको याद कैसे रखना है? Because they are asking questions, I am going to ask you question on the basis of this. We have got the questions. So how you will remember? You can remember the mnemonic, that is going to be push. What is the push mnemonic? The push mnemonic is going to make you understand right? In class 1, everything is going to be visible. This is you need to remember. Class 1 means everything is visible. Malam patti is very important, right? Class 2 is going to be what? What is going to be absent in class 2? You can remember. In class 2, P is going to be absent. So pillar is going to be absent. This is going to be your class 2. In class 3, you will be having only visibility of what? Only visibility of uvula and soft palate. In class 3, you will be having base of uvula is visible and soft palate is visible. This is going to be what? This is going to be class 3. This is going to be class 3. And only hard palate is visible. This is going to be which class? This is going to be class 4. This is going to be the class 4. Okay, this is class 4. Right, so we have got class 1, 2, 3, 4. Right, abhi ek question karo. First of all, just try to answer this question. Right, when assessing a patient before anesthesia, these are your previous year questions. When assessing a patient before anesthesia, the oral cavity should be examined, right? Yes. The image provided below displays the examined cavity. It illustrates what? What is the class it is illustrating? So just try to apply what we have remembered here. Push ko apply karo. What we have remembered, the mnemonic for Malampatti assessment. Earlier they are only asking the Malampatti, what is Malampatti? Now they are giving you the image and they are asking you which class is this. So try to answer what is visible here. Can you appreciate hard palate is visible? Yes, hard palate is visible. Can you appreciate soft palate is visible? Yes, soft palate is also visible, right? Can you appreciate what is not visible over here? This is going to be what class? Can you appreciate what is not visible here? Can you appreciate the base of uvula is visible? If base of uvula and soft palate is visible, let me recall it again. Class 1 is going to be what? Class 1 is going to be everything visible. Class 1 is going to be what, bache? Everything visible. So is it a class 1? No, sir, it's not a class 1. We cannot see the fascial pillars, right? We cannot see the complete base of complete uvula. We cannot see. This is not at all class 1. So class 1 is ruled out. What is about class 2? Class 2 is going to be what? Pillars are not visible. So this is going to be class 2. Yes, sir, class 2 हो सकता है. Pillars तो यहाँ भी नहीं दिख रहे, right? Is it going to be class 3? In class 3, what is going to happen? In class 3, you will be having only two things visible. What are those two things? This is going to be uvula, base of uvula. Uvula में क्या? Base of uvula is visible and soft palate is visible. This is considered as class 3. This is considered as class 3. So is it the class 3? Yes, very good. Your answer is correct. This is the class 3. Because in class 4, only and only hard palate is visible. There will be no visibility of this base of uvula. समझ में आ गया? Right? समझ में आ गया तो ये वाला करो. If you understand this, try to answer this one now. Apply the push that you know. This is going to be which class? Apply the push. Can you appreciate everything is visible? No, it cannot be class 1. What is class 2? Class 2, pillars are not visible. Pillars are not visible. Class 2 में क्या होगा? Pillars are absent. Pillars are not visible. Class 3 will be what? Only base of uvula. Base of uvula is visible. Soft palate is visible. Base of uvula. Can you appreciate base of uvula or soft palate? This is going to be class 3. No, you cannot appreciate. This is not going to be class 3. So it is not class 1, it is not class 2, it is not class 3. Definitely it is class 4, and here you can only appreciate what? Hard palate. Here only you can appreciate the hard palate. Very good, guys. This is going to be class 4. This is going to be the class 4. So this type of grading system is known as Mallampatti grading system. Here we are going to assess the size of the tongue of the patient with respect to the oral cavity so that we can intubate. अगर यही नहीं दिख रहा, how you are going to apply, how you are going to put your tubes inside, है ना? आप अपनी ट्यूब्स को कैसे डालोगे? और अगर आप ट्यूब नहीं डाल पाओगे तो क्या होगा? दिक्कत हो जाएगी. This patient is not able to breathe, right? Another grading, another system we are having, this is known as Cormack-Lehan grading. This Cormack-Lehan grading is the laryngoscopic view of glottic opening, beta. It is the laryngoscopic view of glottic opening. So when you are applying a laryngoscope, when you are having a laryngoscope, and what you can see with the laryngoscope inside this glottis, when you are trying to enter inside the mouth, right? You have the laryngoscope, you are going to take your laryngoscope, you are going to swab the tongue aside, you are going to put it inside, you are going to hold it up, and then you are going to see what? Then you are going to see this particular thing. This is going to be what? This is going to be the thing we are having, right? Epiglottis को उठाओगे आपको क्या दिखेगा नीचे? This is going to be the glottic opening. Here you will be having the glottic opening. These are going to be your vocal cords. These are going to be the vocal cords है ना. यहाँ पर ये arytenoids है, vocal cords है. This thing you already know है ना, ENT में पढ़ा होगा, right? So what is the basic funda? We need to put our tube inside this opening. We need to put our tube inside this opening because this is the opening, larynx की opening. This is the going inside where? ये कहाँ जा रही है? ये ट्रेकिया में जा रही है. This is the opening which is going inside the trachea, right? And this opening we are going to put our tube, endotracheal tube. Endotracheal, endo means inside, tracheal means trachea, right? So we are going to apply this laryngoscope. I am going to hold laryngoscope like that, and I am going to put what? My endotracheal tube. So this is the laryngoscopic view opening, laryngoscopic view of the opening, right? This is going to be known as Cormack-Lehane grading system, right? So we have got again 4 grading system. Remember, class 1 and class 2, grade 1 and grade 2 are easy intubation beta. Grade 1 or grade 2 are easy intubation. You can appreciate the opening. In grade 1 and grade 2, you can appreciate the vocal cord opening. You can directly put your tubes inside. This is grade 1, grade 2. Whereas grade 3 and grade 4 are going to be what? These are going to be your difficult intubation. These are going to be what? Difficult intubation. This is going to be what? Which a difficult intubation, right? So this is going to be difficulty in intubation we have got. This is your grade number 3 and grade number 4 we are having, right? Grade number 3 and grade number 4 we are having. This is the difficult intubation we are having, right? The next we have got is, just try to answer this question. What is the appropriate preoperative fasting recommendation? What is the appropriate preoperative fasting recommendation that we are having? You need to understand this. Try to answer this one. What is the appropriate preoperative fasting recommendation that we are having? So let's try to understand this first. What are these orders? I've told you these are known as NPO orders, nil per oral orders. These are known as what, Viche? Nil per oral orders. What do we call it? We call it NPO orders or nil per oral orders, right? So what are the things we are having in NPO orders? Let's try to understand. What are the things we are discussing till now? We are discussing a patient हमारे पास में आया था सर्जरी के लिए. एक patient आया था, one patient came for surgery. This patient is having what? This patient is having cholelithiasis, and before that we have given what? PAC. After PAC, what is going to happen? These 2 things we have discussed, है ना. एक पेशेंट हमारे लिए सर्जरी के लिए आया था. दिस पेशेंट इज हैविंग कोलेलिथियासिस. हमने प्लान किया कोलेसिस्टेक्टमी करना है इसका, राइट? कोलेसिस्टेक्टमी करना है. नाउ द फर्स्ट थिंग, दिस पेशेंट इज सेंट टू पीएसी. नाउ यू नो व्हाट आर द कंपोनेंट्स ऑफ पीएसी. पीएसी में वो लोग क्या करेंगे, क्या क्या चीजें देखेंगे? यू ऑलरेडी नो अबाउट दिस. नाउ दिस पीपल are also going to write about the ASA grading. They are also going to write about the Cormack, also going to write about the Mallampatti grading, right? So what they are going to give to the surgeon, they are going to give to the surgeon this particular thing. They will be writing you, this patient is a healthy patient. They will be writing like that, ASA 1 and Mallampatti 1, right? That means what? This is a normal healthy patient which can be operated very easily. This is how they will be writing. Anesthesia people will write in the notes, this is a ASA 1 or this is a Mallampatti 1. This is a normal healthy patient, you can easily go for surgery. They will be writing you like that, ASA 5 or ASA 4. let's say this is ASA 4 and Mallampatti 3. This is going to be a difficult to treat patient. You understand this? This patient is having Mallampatti 3. That means he is having very low oral cavity opening, and now you need to have expertise during intubation, right? And ASA 4, that means this patient is having what? ASA 4 means what? अभी इसीलिए important है. These things are important. ASA 4 means what? This patient is having constant threat to life. This patient is having acute MI or respiratory failure or CHF. This is why it is important, right? सो ये सब लिखने के बाद में द एनेस्थीसिया डिपार्टमेंट पीपल विल सेंड योर पेशेंट टू वेयर, इस पेशेंट को कहाँ भेज देंगे, इस पेशेंट को हम लोग भेज देंगे सर्जरी वालों के पास में, राइट। बट सर्जरी वालों के पास में भेजने से पहले वी विल राइट ऑल्सो वन थिंग, व्हाट इज दिस, this is known as NPO orders. What is this NPO orders? This is known as nil per oral order. This is known as nil per oral order. पेशेंट पूछेगा सर सर्जरी के लिए तो आना है, मंडे को आना है, बट संडे को क्या खा के आऊँ, मंडे को खाना खा के आ जाऊँ, मंडे को बिरयानी खा लूँ, बिकॉज आई एम नॉट गोइंग टू, मे बी इट इज़ अ सीरियस सर्जरी, क्या पता कल क्या हो, तो अच्छा खाना खा के आ जाऊँ, राइट। सो दिस इज वॉट यू नीड टू अंडरस्टैंड, राइट। NPO order will be given by the anesthesiologist to the patient before the surgery, है ना, सर्जरी से पहले बताना है क्या खा के आना है, राइट। सो व्हाट आर द थिंग्स दिस पेशेंट कैन हैव if I'm talking about an adult patient. Remember, in adult patient, what is the NPO order we are having? 8 hours before, like in the night time, you can have full fatty meals. आपने जो भी खाना है, आपने जो भी खाना है आप रात को खा लो, full fatty meals you can eat in the night time. 6 hours before, you can have what? Semi solid food. Semi solid food like dalia, khichdi, right? These are the things you can have 6 hours before the surgery, right? And 2 hours before the surgery, you can have what? Clear fluid. Sir, aisa kyun? Why this thing? Because if this patient might be having food in the stomach, right, and we are doing what? Intubation, we are putting laryngoscope, this can activate your gag reflex, this can activate your gag reflex. We are putting endotracheal tube inside the patient, this can activate your gag reflex. What can happen? Your gag reflex will cause what? Reverse peristalsis. You can have vomiting like sensation, you can have increase in abdominal pressure, you can have something coming out, and that thing which will be coming out can go into your lungs. You can have aspiration, you can have aspiration pneumonia, you can have aspiration. This, to prevent this aspiration, what we are doing, we are telling our patient to need not to eat anything 2 hours before, right? 2 hours before, and you can have semi solid food 6 hours before, right? Semi solid 6 hours before. You understand this? This is the NPO order for adult patient. It is going to be the same one. It is going to be the same one. What is the NPO order for children? Remember this, for pediatric patient, the NPO order is going to be what? This patient can have fully fatty meals 8 hours before. Same story. Formula milk, remember, formula milk is going to be stopped when? 6 hours before, right? 6 hours before. Or semi solid milk, semi solid food 6 hours before, it is also same. But remember, this breast milk can be given 4 hours before the surgery. This is the only thing you need to remember. 4 hours before the surgery, this patient can have what? Formula milk, breast milk. This patient can have what? Breast milk 4 hours before the surgery. And 2 hours before the surgery, nothing you can give the clear fluid, right? So what is the question they have asked? Now try to answer this one. 4 hours for solid in adults, this is a right statement or wrong statement? Try to answer this one. Two hours for liquid in adults. 2 hours for liquid in adults, is it right statement? Liquid we can give, liquid means clear fluid, we can give 2 hours before the surgery, yes. Solid for infant 4 hours, no. 2 hours for breast milk, no. It was 4 hours, it was 4 hours. So answer in this particular case is going to be what? This is going to be B. This is going to be B. Very good, very good. This is going to be the B is going to be the answer, right? Then after NPO orders, we are also going to give one more order. This is known as pre-anesthetic order. Pre-anesthetic order means we are going to tell our patient, there might be possibility patient is a smoker, है ना? Patient is a smoker, so there might be some possibilities. So we will be telling our pre-anesthetic order. हम लोग pre-anesthetic order देंगे. In pre-anesthetic order, we are going to tell our patient, okay, sir आपकी 2 महीने बाद में surgery है. Just try to stop smoking as soon as possible, right? तो कितने दिन पहले बंद करना है smoking? 8 weeks before the surgery. This is the normal thing, right? But पता नहीं ऐसा होता है नहीं होता, that's another thing. But yes, we need to stop the smoking as soon as possible, right? This is the smoking one. Second one about the herbal replacement therapies, or about the herbal therapies, or about the HRT. HRT is what? Hormone replacement therapy. This is going to be hormone replacement therapy, which is having high dose of what? High dose of estrogen and high dose of progesterone. Hormone replacement will be having high dose of estrogen and progesterone, whereas OCP will be having low dose of estrogen and progesterone, right? So this is going to be HRT, this is going to be herbal medication. We need to stop 6 to 8 hours prior to surgery, right? 6 to 8 hours prior to surgery, we need to stop this herbal medications, right? Herbal medications, because we don't know what is the component, what is the constituent of all those things, we need to stop it, right? What about TCA? This is going to be your tricyclic antidepressants, which are having a special side effect of like myocarditis. They are going to be what? Cardiotoxic. ये जो दवाइयाँ होती हैं tricyclic antidepressant, they are going to be what? Cardiotoxic, right? We can have toxicity because of them, right? Can anyone tell me what is the drug of choice for this particular TCA toxicity? Try to participate. What is the drug of choice for TCA toxicity? Class, I think, will be 3 hours, 3.5 hours, right? This is going to be the time period, right? TCA toxicity. So we should stop it 3 weeks prior to surgery, beta. 3 weeks prior to surgery. TCA 3 हफ्ते पहले बंद करना है. TCA 3 हफ्ते पहले बंद करना है. T for ticlopidine. Ticlopidine we need to stop. Ticlopidine 13-14 दिन. Ticlopidine 13 से 14 दिन पहले before the surgery. This is going to be 13 to 14 days before the surgery. Clopidogrel we need to stop 5 to 7 days prior to surgery, right? If someone is on the clopidogrel, some people are taking what? Aspirin, some people are taking clopidogrel. Clopidogrel is something which is an antiplatelet drug. It was also your question. It is going to work where? It is going to work on ADP. It is going to work on ADP, right? So this is going to be ADP. Warfarin we need to stop when? Very good, Black. This is going to be sodium bicarbonate, right? Warfarin we need to stop 4 days prior to surgery. 4 days prior to surgery. Lithium 24 to 48 hours prior to surgery. Lithium is something we are going to use in what? Lithium we are going to use in bipolar patient. It is having a very narrow therapeutic index, है ना? इसका ध्यान रखना है. आपको डोज ज़्यादा नहीं करनी है, आपको डोज कम भी नहीं करनी, right? It is very low, you can say narrow therapeutic index will be there. We have got next is going to be heparin. We have got heparin. We can use 12 to 24 hours before the surgery, and unfractionated heparin you can use 6 hours before the surgery, right? 6 hours before the surgery you can use. Some other drugs also you need to remember, like patient is taking oral hypoglycemic agents, है ना? Oral hypoglycemic agent अगर कोई patient ले रहा है, you need to omit the last dose. Omit the last dose. इसको बंद कर देना लास्ट डोज को. क्यों? क्योंकि ये पेशेंट अब कुछ खा के तो आएगा नहीं. This patient will be coming to surgery without eating, so you need to omit the last dose, right? If the surgery is going to be long-term surgery, we can definitely shift our patient to what? We can definitely shift our patient on insulin. Shift the patient on insulin. अगर पेशेंट को D5 भी चल रहा है, DNS डेक्सट्रोज भी चल रहा है, shift the patient on insulin. We can shift our patient on insulin. We can check for this particular thing in the hospital. No need to take the drugs from yourself, right? This is what we are going to tell the patient. If patient is taking any kind of anti-hypertensive drugs, है ना, patient खुद से पहले से anti-hypertensive drugs ले रहे हैं, so we need to continue that drug. We need not to stop that drug. उसको थोड़ा सा पानी दो, एक घूंट पानी के साथ में you can give this drug, right? You need to continue this particular drugs, right? But only exception you need to remember, exception. This is going to be your ACE inhibitor. This is going to be your angiotensin converting enzyme inhibitor. This is going to be your ARB. You need not to give ARB and ACE inhibitors. Apart from that, you can continue other anti-hypertensive drugs. What about this aspirin? You can continue aspirin. Aspirin, which aspirin you can continue? Low dose aspirin. Low dose aspirin you can continue. Low dose aspirin or BB aspirin you can continue, right? What about thyroid? Thyroid medications, like a patient is taking Altrox, right? Altrox or levothyroxine patient is taking, you need to continue that also, है ना? So they will be asking you, इस पे से क्वेश्चन आता है, they will be asking you, these drugs are very important, right? They've asked about these questions. They need to, you need to understand. TCA 3 हफ्ते पहले, TCA 3 weeks before, right? And ticlopidines, this is going to be what? This is going to be, ticlopidine is going to be what? Ticlopidine you need to stop 13-14 days before the surgery. This is going to be the प्री एनेस्थेटिक ऑर्डर. तो हमारे पास पेशेंट आया था, हम लोगों ने उसका पीएससी कर दिया, पीएससी के बाद में आपने उसको एनपीओ ऑर्डर दे दिया, यू हैव गिवन द एनपीओ ऑर्डर, आपने उसको प्री एनेस्थेटिक ऑर्डर भी दे दिया जिसमें आपने ये बता दिया कि कौन सी दवाई लेके आना है, कौन सी नहीं लेके आना है। नाउ दिस पेशेंट विल बी कमिंग ऑन व्हाट डे? नाउ दिस पेशेंट विल बी कमिंग ऑन मंडे, है ना। तो मंडे को आने से पहले एक क्वेश्चन कर लो इस पेशेंट के लिए, व्हाट इज दिस ग्लाइकोपाइरोलेट इज यूज्ड फॉर? आई हैव टॉट यू दिस थिंग इन फिजियोलॉजी आल्सो, है ना, कल पढ़ाया था फिजियोलॉजी में। दिस इज अ क्वेश्चन फ्रॉम एफएमजी, this is your FMG all these are previous year question, but this was a question they have asked in 2022, right? This was a PYQ, previous year question. Try to answer this one. Glycopyrrolate is used as a pre-anesthetic medication. It is used as a pre-anesthetic medication. What is the use of this glycopyrrolate? First of all, tell me, is it a cholinergic drug or is it an anticholinergic drug? We have discussed about the cholinergic. We have discussed about the cholinergic drug. Cholinergic and anticholinergic. Cholinergic and anticholinergic, right? Yesterday we have discussed about the cholinergic drugs and anticholinergic drugs, right? These cholinergics are going to do what? It is going to activate your M3 receptor. Remember GQ type of subunit, right? GQ is going to cause what? Contraction in the salivary gland, leading to what? Leading to increase in salivation. Increase in salivation. During intubation, do you want more salivation? No, I want my patient to have dry mouth, right? How can I get the dry mouth? I can give my patient some anticholinergic drugs. It is going to cause what? It is going to cause inhibition of this M3 receptor, and when you have the inhibition of this M3 receptor, you will be having decrease in salivation. Yes or no? And this decrease in salivation is going to cause what? Dry mouth. And this dry mouth is going to help me in the intubation. It will be preventing what? It will be preventing aspiration. This will be preventing the aspiration. This is going to help this patient to prevent the aspiration. We are going to give a drug, and this is going to be what? This is going to reduce the secretions. So remember, this is a pre-anesthetic agent. Pre-anesthetic मतलब एनेस्थीसिया देने से पहले हम लोग कुछ दवाइयाँ लगाएंगे। तो हम लोगों ने क्या किया? हम लोगों ने एक पेशेंट लिया, उस पेशेंट को हम लोगों ने बहुत सारी चीज़ें बता दी, उस पेशेंट को हम लोगों ने पीएससी कर दिया। पीएससी के बाद में उस पेशेंट को हमने एनपीओ ऑर्डर दे दिया, उस पेशेंट को प्री एनेस्थेटिक medications का ऑर्डर दे दिया, right? Now this patient is going to come to us, and when this patient is going to come to us, pre-anesthetic order दे दिया. Now this patient is going to come to us. Now we are going to give this some drug. What are these drugs? These are known as pre-anesthetic medications, right? These are known as pre-anesthetic medications, or you can simply remember, instead of anesthetics you can remember pre-operative medications. So now before operation, जब patient आपके पास में आ जाएगा, नाउ दिस पेशेंट इज कमिंग ऑन मंडे, ये पेशेंट मंडे को आ रहा है, और मंडे को जब ये पेशेंट आ रहा है बेटा, तो आते ही पहले क्या होगा? इसको घबराहट होगी. दिस पेशेंट विल बी हैविंग एंजाइटी, राइट? दिस पेशेंट विल बी हैविंग व्हाट? दिस पेशेंट विल बी हैविंग टेंशंस, राइट? तो इन सब को कैसे टैकल करना है, इन सब चीज़ों को कैसे ट्रीट करना है, यू नीड टू अंडरस्टैंड. यू नीड टू गिव सर्टेन ड्रग्स बिफोर ऑपरेशन. जैसे पेशेंट आएगा, अपन उसको लेटा देंगे, उसको कुछ ना कुछ दवाइयाँ देंगे. इन द मॉर्निंग वी विल बी मेकिंग आवर पेशेंट रेडी टिल द टाइम ओटी इज गेटिंग रेडी, है ना. तो हम लोग हमारे पेशेंट को भी रेडी करेंगे. सो हाउ वी आर गोइंग टू गिव, व्हाट आर द ड्रग्स वी आर गोइंग टू गिव? फर्स्ट ड्रग्स आर गोइंग टू बी योर एंजियोलाइटिक्स. दिस पेशेंट माइट बी हैविंग लॉट्स ऑफ एंजाइटी, so you will be taking care of this anxiety by what? You will be giving this patient benzodiazepines, right? This benzodiazepines are the drugs like you are having diazepam, you can have what? Diazepam, clonazepam. These are the drugs which are going to do what? They are going to decrease the tension by increasing the GABA, है ना. ये GABA facilitatory drugs है. They are going to increase what? GABA. And GABA is what? GABA is a inhibitory neurotransmitter. तो ब्रेन के अंदर अगर GABA बढ़ गया, तो क्या ब्रेन डिप्रेस हो जाएगा? हाँ, ब्रेन डिप्रेस हो जाएगा, टेंशन कम हो जाएगा. दिस इज व्हाट इज गोइंग टू बी योर एनेक्सियोलाइटिक ड्रग्स, राइट? सेकेंड ड्रग वी विल बी गिविंग टू दिस पेशेंट इज गोइंग टू बी एंटी एमेटिक. एमेसिस मीन्स, एमेसिस का मतलब क्या होता है? एमेसिस का मतलब होता है वॉमिटिंग. एमेसिस का मतलब होता है वॉमिटिंग. सो यहाँ पर इस पेशेंट को मैं कौन सी दवाई देना चाहूँगा? आई वॉन्ट टू गिव दिस पेशेंट एंटी emetic drug. This anti-emetic drug is going to do what? It is going to decrease the vomiting sensation. अगर किसी को vomiting sensation होगा तो क्या होगा? Again aspiration का risk बढ़ेगा. So what I want to do, I want to decrease the risk of aspiration. I want to give this patient anti-emetic drugs. What are the anti-emetics we are having? We are having 5-HT3 inhibitors. These are going to be the drugs. We can also use prokinetic drugs like metoclopramide. This metoclopramide is going to increase the movements in your GIT. ये आपके पास मूवमेंट्स को बढ़ा देगा, आपकी मूवमेंट्स को बढ़ा देगा, आपका जीआईटी क्या हो जाएगा? एम्प्टी हो जाएगा, राइट? अगर जीआईटी एम्प्टी हो गया तो कहाँ से रिटर्न आएगा? कुछ भी रिटर्न नहीं आएगा, राइट? सो दिस इज गोइंग टू इंक्रीज द मूवमेंट. वी हैव गॉट व्हाट? 5-HT3 blockers. These are going to be drugs like your Ondem, ondansetron. This is going to block the 5-HT3 receptor, which is responsible for activation of vomiting center. And vomiting center का activation नहीं होगा तो क्या vomiting होगा? नहीं होगा, right? So we can give this 5-HT3 blocker, first thing. Second thing, you can give what? You can give the drugs which are going to be prokinetic drugs. These drugs are going to be prokinetic like metoclopramide, and they are going to increase what? Movements of GIT. They are going to increase what? Movements in the GIT. Then you can give some drugs which are going to be antacids. These are going to be your PPI, pantoprazole, rabeprazole, omeprazole. They are going to inhibit the proton pump, leading to what? Decrease in the acid secretion. Decrease in the acid secretion. We don't want acid. We don't want acid right now. We want to do surgery, right? So that particular case, we don't want acid in this patient, right? These are going to be anti-sialogogus drugs. These are the drugs which are which we are using, which we have already discussed. This is the anticholinergic group of drugs. This is going to be what? Glycopyrrolate. Glycopyrrolate. And this is your previous year question also. Last to last exam, they have asked about this glycopyrrolate, right? And you will be giving some antibiotics to this patient. These antibiotics are going to be your broad spectrum antibiotics. These antibiotics are going to be your broad spectrum antibiotics, right? And this should be given 1 hour prior to the surgery, beta. 1 hour prior to the surgery. Why 1 hour prior to the surgery? So that it will not react with the other drugs, है ना? हम लोग बहुत सारी दवाइयाँ देंगे, ग्लाइकोपायरोलेट, हमको कैसे पता चलेगा ये एंटीबायोटिक की वजह से हुआ? सो वी विल बी चेकिंग दिस पेशेंट, ड्रग एलर्जी चेक करके हम लोग इस पेशेंट को कोई ब्रॉड स्पेक्ट्रम एंटीबायोटिक दे देंगे. दिस इज गोइंग टू बी गिवन, दिस एंटीबायोटिक शुड बी गिवन 1 hour prior to the incision, right? 1 hour prior to the surgery or prior to the incision, right? Incision. So this is going to take care of the gram negative and gram positive bacteria both, right? Broad spectrum है तो दोनों का ध्यान रख लेगी. This is going to be the given 1 hour prior to the incision or surgery, right? You can also remember incision or surgery, right? This is going to be the antibiotic we will be using, right? So these drugs are known as pre-anesthetic, pre-operative medications, है ना? Anesthesia medication start, anesthesia देने से पहले we are going to give, operation करने से पहले we are going to give some medications. anesthesia के बाद में तो इनकी ज़रूरत नहीं है, anxiolytic की ज़रूरत नहीं है, anesthesia दे दिया उसी के लिए तो ये सब कर रहे हैं. So this is going to be pre-operative. This is also considered as pre-anesthetic medications, right? Once you give this pre-anesthetic medications to the patient, what is going to happen? This patient is going to have what now? Now we will be giving our anesthesia to the patient. Before that, try to answer this one. What is the preferred drug for pre-operative antibiotic prophylaxis in a patient who is about to undergo cardiac surgery? This is your exam question. What is the preferred drug for pre-operative antibiotic prophylaxis in a patient who is about to undergo cardiac surgery? Cardiac surgery वाले patient में आप क्या देना चाहोगे? This is what they want to know. Is it going to be penicillin G? Is it going to be erythromycin? Is it going to be azithromycin or cefazolins? What would you like to give to our patient? Yes, we would like to give cefazolin, right? Why cefazolin? Because this is a broad spectrum antibiotic. This is a cephalosporin. Remember, we can give what? We can give drugs like ceftriaxone. आप 1 gram injection लगा दो ceftriaxone. This is going to be third generation cephalosporin. These cephalosporins are going to be what? Broad spectrum. These cephalosporins are going to be what बच्चे? Broad spectrum. So you will be using what? Cefazolin. समझ में आया ये? This is going to be pre-operative medications. Then we have got what? अभी पेशेंट कहाँ पर है हमारे पास में एक पेशेंट आया था सर्जरी करवाने के लिए, है ना, उसको पेट में दर्द था। उस पेशेंट को हम लोगों ने क्या किया, एनेस्थीसिया वालों के पास में भेज दिया, कुछ दवाई लिख के, और बोला कि आपको स्टोन है, आपको सर्जरी करवाना पड़ेगा, राइट। दिस पेशेंट वेंट टू व्हाट? एनेस्थीसिया पीपल, दे हैव डन द पीएसी, प्री एनेस्थेटिक चेकअप, they have written the nil per oral order, they have written the प्री एनेस्थेटिक ऑर्डर ऑल्सो, दे हैव टेल द पेशेंट कौन सी दवाई लेके आना है, कौन सा नहीं लेके आना है। दे हैव ऑल्सो गिवन द प्री ऑपरेटिव मेडिकेशंस, दे हैव ऑल्सो गिवन द प्री ऑपरेटिव मेडिकेशंस। ऑन द मंडे दिस पेशेंट इज कमिंग फॉर द सर्जरी. Now this patient has already taken the pre-operative medication, he is lying down on the stretcher right now, right? He is going into the OT. In the OT we will be doing what? First thing, before surgery we will be giving this particular patient anesthesia. Before giving the anesthesia, let's try to understand, we need to intubate our patient, right? We need to intubate our patient because anesthesia is going to give what? Anesthesia is going to stop the sensations of the body. But when you are giving general anesthesia, remember bacha, when you are giving general anesthesia, you will also use what? Muscle relaxant. You will also use what? Muscle relaxant. What is going to be happening? This general anesthesia is going to cause what? It is going to cause what? Loss of movements, loss of sensations will be there, right? And this muscle relaxant is going to cause what? Stoppage of the movements also, right? So your lungs will be stopped, and remember, if your lungs will be stopped, how you are going to give oxygenation to the complete body? नहीं दे पाओगे. And I told you yesterday also, oxygen and glucose are the two OG that you require, right? ये OG, ये दो OG जो है, these are the important things we are having, oxygen and glucose. Without them we cannot survive, right? And अगर आपके lungs बंद हो गए, oxygen नहीं मिला, right, how you are going to survive? You are not going to survive, right? So what is going to happen? We are giving this muscle relaxant, so we need to intubate this patient so that we can give oxygen from outside. We can connect our patient to the machine, right? And we can connect our patient to the machine, first thing. Second thing, we can give the inhalational drugs also directly. That is why we require what? We require intubation of the patient, or we require certain airway devices also for that. So what is this? Intubation is done with the help of the device. This device is known as what, bacha? This is known as laryngoscope. This device is known as laryngoscope. उस device का क्या नाम है? Device का नाम है laryngoscope, right? And we have got certain types of airway devices. We have got two types of airway devices basically. We will discuss about the airway devices later. Okay, first let's talk about the 5 important types of laryngoscopes that we are having, right? So what are the different types of laryngoscopes that we are having? Just try to identify this particular one. Look at this particular one and identify. This device is known as laryngoscope, है ना? एक एक करके आइडेंटिफाई करते हैं. लेट्स ट्राई टू अंडरस्टैंड. अगर इसका इमेज आ गया एग्जाम के अंदर, हाउ यू आर गोइंग टू अंडरस्टैंड दिस? व्हाट इज दिस laryngoscope that we are having? This is the first laryngoscope that we are having. Laryngo means larynx. Scope means to visualize. So this is a device which is helping you to visualize what? Larynx. This is a device which is helping you to visualize the larynx, right? So first device that we are having in front of us, this is going to be what? Which kind of laryngoscope is this? Is it Macintosh? Is it Miller's, or is it something else? Can you appreciate a curved blade over here? Can you appreciate? This is a curved blade laryngoscope. एक तो सीधा होता है, एक टेढ़ा होता है. This is going to be a curved blade laryngoscope. This is going to be curved blade laryngoscope that we are having. And this curved blade laryngoscope, here you will be having what? This is going to be source of light will be there. Here you will be having certain sources of light will be there, right? This is having the sources of light. This is a curved blade laryngoscope. This particular thing is known as what? Handle. This is known as handle, right? Apart from this handle, beta, this is also going to have this what? Extra lever will be there. This extra lever will be there. This extra lever that we are having, this is going to be making the difference beta here, right? Yes, it is not it is not Macintosh. It is going to be what? It is going to be McCoy laryngoscope. This is going to be McCoy laryngoscope. This is going to be McCoy laryngoscope, beta. दिस इज गोइंग टू बी मैकोय लेरिंगोस्कोप. मैकोय लेरिंगोस्कोप है ना. इसके अंदर आपको ये एक्स्ट्रा लिवर मिल रहा है. रिमेंबर दिस इज नॉट मैकिनटोश. इसको कर्व्ड ब्लेड देख के मैकिनटोश मार्क नहीं करना है, क्वेश्चन गलत हो जाएगा. दिस इज योर मैकोय लेरिंगोस्कोप. मैकोय है ना. मैकिनटोश में क्या होगा? ओनली कर्व्ड ब्लेड विल बी देयर, है ना. यहाँ पर एक्स्ट्रा लिवर नहीं होगा. इफ यू डू नॉट हैव दिस एक्स्ट्रा लिवर, दिस इज गोइंग टू बी विच लेरिंगोस्कोप? This is going to be your curved blade laryngoscope that we are using in adult patient. This is going to be your curved blade laryngoscope. This is going to be your Macintosh is going to be the curved blade laryngoscope that we are having, and we are generally using this laryngoscope in the adult patient. Adult patient में कौन सा use में लेंगे? McCoy और Macintosh. This is what we are going to use, right? What is the straight blade? यहाँ पर अलग अलग नंबर से आता है. This is going to be your straight blade. This is going to be your straight blade laryngoscope that we are having. You are finding in children's. We are going to use this particular thing for the children. This is going to be a straight blade laryngoscope. This is also known as Miller's laryngoscope. Miller's laryngoscope. ये जो straight blade है इसका दूसरा नाम क्या है बेटा? दिस इज नोन एज मिलर्स लेरिंगोस्कोप. डबल एल आ रहा है, देखो डबल एल सीधा सीधा दिख रहा है. दिस इज गोइंग टू बी स्ट्रेट ब्लेड. ऐसे याद रख लो, डबल एल इज गोइंग टू बी स्ट्रेट, राइट. सो दिस इज गोइंग टू बी स्ट्रेट ब्लेड लेरिंगोस्कोप. वेयरएज मैकोय में सी आ रहा है. मैकोय विल बी हैविंग सी. यू कैन रिमेंबर सी फॉर सी. दिस इज गोइंग टू बी कर्व्ड ब्लेड. दिस इज ऑल्सो गोइंग टू बी सी. दिस इज गोइंग टू बी कर्व्ड ब्लेड, right. McCoy and Macintosh, both of them are having the C, right. McCoy and Macintosh, both of them are having the C. You can remember the C, right. This is going to be Macintosh. This is going to be Macintosh. This is going to be having extra liver. You can remember ये while liver जैसा लग रहा है, right. So this is going to be extra liver. You can remember like that, right. Whereas in Miller's you are having double lines, straight double lines you will be having. So you can easily remember this is going to be what? Miller's laryngoscope. This is going to be your Miller's laryngoscope. Then we have got what? Then we have got this particular one. इसमें क्या टीवी में सब कुछ नजर आ रहा है? You are going to see all those things on a TV. This is going to be what? Video laryngoscopy. This is known as what picture? Video laryngoscope. This is going to be video laryngoscope that we are having. Video laryngoscope we are having. This is your video laryngoscope. And then we have got what? Then we have got the flexible one. This is going to be your fiber optic laryngoscope. Fiber optic laryngoscope. सर इसका मतलब क्या है? इसका यूटिलाइजेशन क्या है? इन सब laryngoscopes का यूटिलाइजेशन क्या है? We just want to see inside. We just want to see inside. हमको सिर्फ देखना है इससे. Larynx को देखना है. We just want to see the larynx. Laryngoscope means larynx को देखने के लिए जो चीजें यूज में आती है. These are known as laryngoscope. And the ultimate purpose of this laryngoscope is to visualize the glottic opening. और आपको अगर एक बार ग्लोटिक का ओपनिंग दिख गया, इफ यू गेट टू अंडरस्टैंड दिस ग्लोटिक ओपनिंग, आपको एक बार ये वोकल कॉर्ड्स दिख गए, आपको एक बार ये ग्लोटिक ओपनिंग दिख गया, यू कैन डायरेक्टली पुट योर ट्यूब्स इनसाइड, राइट. यू कैन पुट योर विच ट्यूब्स? यू कैन पुट योर एंडोट्रेकियल ट्यूब्स, राइट बच्चा. यू कैन पुट योर एंडोट्रेकियल ट्यूब्स इनसाइड. You can put your ET tubes inside and you can ventilate. You can connect this tube to the machine. You can ventilate your patient, right. So this is the basic understanding that we are having, है ना. ठीक है, समझ में आया laryngoscopes? How many types of laryngoscopes do we have? We have got this 5 important ones. इसमें क्वेश्चन में गड़बड़ नहीं करना है. ये क्वेश्चन तुम्हारे पास में आया हुआ एग्जाम में. ये अगर एक्स्ट्रा लीवर दे दिया तो ये मैकिनटॉश नहीं है. कर्व्ड ब्लेड नहीं देखना है सिर्फ, राइट. Don't just look at the curved blade. You need to focus here also. This is the extra lever. It is going to become what? ये मैकोय बन गया, ये मैकिनटॉश नहीं है, राइट. मैकिनटॉश में सिर्फ क्या होगा? कर्व्ड ब्लेड होगा, एक्स्ट्रा लिवर नहीं होगा, तब इसको मैकिनटॉश बोलेंगे. दिस इज द मोस्ट कॉमन यूज्ड इन द अडल्ट्स, राइट. दिस इज द मोस्ट कॉमन वन यूज्ड इन द अडल्ट्स. दिस इज अ स्ट्रेट ब्लेड laryngoscopy that we are using in the children. डबल एल से याद रहेगा, स्ट्रेट ब्लेड. Okay, ये laryngoscopes, right. These are the laryngoscopes. Apart from laryngoscopes, we have got what? अब लेरिंगोस्कोप से हम लोगों ने क्या कर लिया, एक पेशेंट आया था हमारे पास सर्जरी के लिए, उसका हम लोगों ने सारा काम वाम करके, वी हैव सीन द पीएसी, वी हैव डन द एवरीथिंग, राइट. दिस पेशेंट इज लाइंग डाउन ऑन द ओटी टेबल राइट नाउ, एंड नाउ यू आर लुकिंग फॉर द लेरिंगोस्कोप. आप देख लोगे एडल्ट पेशेंट है, कौन सा लेरिंगोस्कोप यूज में लोगे, मैकिनटॉश. यू आर गोइंग टू यूज मैकिनटॉश. आप मैकिनटॉश लगा के देख रहे हो, यू आर फाइंडिंग द कॉर्मेक लेहान ग्रेडिंग, वो आप लोगों ने देख लिया था. दिस इज अ ग्रेड 1 पेशेंट. ओके, इजी इंट्यूबेशन है, आपको आराम से ग्लोटिस का ओपनिंग दिख गया. अब क्या करना है, अब एंडोट्रेकियल ट्यूब डालना है. सो बिफोर पुटिंग द एंडोट्रेकियल ट्यूब, लेट्स ट्राई टू अंडरस्टैंड कितने प्रकार के एंडोट्रेकियल ट्यूब्स होते हैं, राइट. वी हैव गॉट हाउ मेनी टाइप्स ऑफ एयरवे डिवाइसेस. चलो सीखते हैं वो हाउ मेनी टाइप्स ऑफ एयरवे डिवाइसेस वी आर हैविंग. सो वी आर हैविंग अ ग्लोटिक ओपनिंग बेटा. फर्स्ट ऑफ ऑल यू नीड टू अंडरस्टैंड वी हैव गॉट some glotic opening, और इस glotic opening, for example this is the glotic opening we are having, और इस glotic opening के ऊपर जो devices काम करती है, these are known as supraglottic airway devices. इसके नीचे जो काम करेंगे उसको बोलेंगे infraglottic airway devices. Infraglottic airway devices, right. So we have got what, supraglottic airway devices, we have got infraglottic airway devices, right. So these are going to be the airway devices we are having. Like for example this is going to be your lungs, right. This is how you will be having the lungs. These are going to be your lungs, right. इसके lungs के ऊपर जो भी डिवाइस काम करेगी इस ग्लोटिक ओपनिंग के ऊपर वाली, दे आर नोन एज सुप्राग्लोटिक एयरवे डिवाइसेस. इसके नीचे जो भी काम करेगी दे आर नोन एज इंफ्राग्लोटिक एयरवे डिवाइसेस. सो वी हैव डिवाइडेड दिस पर्टिकुलर थिंग इनटू टू हाफ्स. दीज आर गोइंग टू बी योर सुप्राग्लोटिक एयरवे डिवाइसेस एंड इंफ्राग्लोटिक airway devices. Let's try to understand what are the different types of devices we are having. So I'm just trying to make a division over here. This is going to be supraglottic airway devices. This is going to be your infraglottic airway devices. और कुछ devices इनकी help करेगी. These are known as what? Adjuncts. These are known as what? Which are? These are known as adjuncts. Adjuncts. ठीक है. तो क्या क्या होती है supraglottic airway devices? We have got LMA, laryngeal mask airway. We have got laryngeal mask airway. We have got LMAs. We have got LMAs. Multiple classes of LMAs we are having, but we will understand them very easily. ठीक है. दूसरा होता है infraglottic airway devices. These are going to be your endotracheal tubes, है ना. endotracheal tubes. तो इंफ्राग्लोटिक मतलब ग्लोटिस से नीचे तो सिर्फ एक ही चीज जाएगी जो आपके यहाँ तक कैराइना के थोड़ा ऊपर तक जाएगी. दिस इज गोइंग टू बी व्हाट, दिस इज गोइंग टू बी योर ET tube. This is going to be endotracheal tubes. And then we have got what, adjuncts. Two types of adjuncts you have to remember. One is going to be adjuncts. क्या है, इनका मदद करने के लिए, इनकी मदद करने के लिए we have got two things. So we have got adjuncts, right. So they can go through what, they can go through the mouth. These are known as oropharyngeal devices. These are going to be what, this is going to be like Goodell's airway we are having. Goodell's airway devices we are having. And they can go through the nasal part. This is going to be NP devices we are having. Nasopharyngeal devices. These are going to be your nasopharyngeal tubes, right. So we have got this particular thing. इसी को, ये क्लासिफिकेशन हम लोगों ने पढ़ लिया है, इसी को हम लोगों को खोल के पढ़ना है, राइट. सो व्हाट यू नीड टू अंडरस्टैंड, to intubate any patient you require the first thing that is going to be the laryngoscope. आपको intubate करना है, किसी भी पेशेंट की सर्जरी करनी है, जनरल एनेस्थीसिया देना है, तो आपको सबसे पहले उस पेशेंट को क्या करना पड़ेगा, you need to intubate that patient, right. How you are going to do the intubation? With the help of laryngoscope. You are going to put that laryngoscope. Now you can use three types of devices we have got. First one is supraglottic airway devices. ये यहाँ तक जाएगी, glottic के above तक अगर कोई device है, this is going to be supraglottic. These are the LMAs. I'll show you what are the LMAs, right. And then you have what, infraglottic airway devices. These are going to be your endotracheal tubes. And then we have got what, adjuncts. These are going to be oropharyngeal adjuncts. These are going to be nasopharyngeal adjuncts, right. So let's begin with the laryngoscope. We have done with the laryngoscope. Now we are going to discuss about these devices. Give me your answer. This is the one we are using most commonly in India, right. This is the one we are using very commonly in India. What is this particular device we are having? What is your answer for this particular one? So we need to identify the given instrument over here. This is an instrument, this is a supraglottic device, this is an infraglottic device. Or let's try to understand first what are these devices. If you are not able to recall, let's try to understand. So we have got two types of devices. We have got supraglottic, we have got infraglottic airway devices. These are the supraglottic, these are the infraglottic devices, right? Glottic के above वाले supraglottic airway devices will be there, right? So we will be beginning with the supraglottic devices first. These are going to be your laryngeal mask airways बेटा. सबसे पहले जो हम पढ़ेंगे, this is known as laryngeal mask airways. Laryngeal mask airways. तो एक चीज तो क्लियर है, they are not going below the glottic, they are not going below the glottis. So first one we have got is going to be your classical LMA that we are having. First one we have got is what? Classical LMAs that we are having. Remember beta, it will be having what? It will be having a single opening will be there. एक single opening होगा. कैसे identify करोगे? It will be having a single opening will be there, single opening, and this particular thing which is coming out, this is known as, इसका नाम होता है पायलट बलून. दिस इज नॉन एज पायलट बलून. दिस इज नॉन एज पायलट बलून. So you have got this classical device, classical LMA. This is also known as classical LMA. This classical LMA will be having what? Single opening will be there, and this particular pilot balloon will be there. This is known as single. This is known as classical airway device that we are having. The another one that we are having, can you identify this particular one? Try to identify. They are easy to insert. आपको आराम से insert हो जाएगा, and this is not requiring what? इसके लिए आपको पहले से कोई ग्रेडिंग वगैरह करने की ज़रूरत नहीं है. जो सप्लाई इट इज़ गोइंग टू गेट इनसाइड, है ना, आराम से चला जाएगा. बट इसमें दिक्कत क्या थी? देयर इज़ ओनली वन ओपनिंग फॉर द लंग वेंटिलेशन. सिर्फ एक ही ओपनिंग है फॉर द लंग वेंटिलेशन. तो आपको स्टमक वाला जो पार्ट है उसमें प्रॉब्लम होता है, राइट? दिस इज गोइंग टू बी द फर्स्ट क्लासिकल LMA, फर्स्ट जनरेशन क्लासिकल LMA दैट वी आर हैविंग. तो अभी हम लोगों ने क्या किया? हम लोगों ने थोड़ा एडवांसमेंट किया. दिस इज योर फास्ट ट्रैक LMA. दिस इज नॉन एज फास्ट ट्रैक LMA. दिस इज नॉन एज फास्ट ट्रैक LMA, राइट? यहाँ पर आपको याद रखना है, हियर यू विल बी हैविंग द हैंडल अगेन. क्या यहाँ पर एक्स्ट्रा हैंडल दिख रहा है? This is going to have extra handle here, and this particular part you can appreciate. This part is what? This part is also curved. This part is also curved. So if you find the curved part, if you find the extra handle, and you will also notice that there are going to be two opening. There are going to be two opening will be there. Here you will be having two opening. When you are going to see, you will find the two openings will be there. This is going to be what? This is going to be your fast track device. This is going to be what? This is going to be your fast track device we are having, and this is again your pilot balloon. This is going to be the pilot balloon that we are having. So तीन चीजें याद रखनी है fast track के लिए. It is going to be curved. It is going to have a handle. It is going to have two openings. These two are the two devices we are having, right? The next one we are having is going to be your ProSeal LMA. ProSeal LMA में क्या याद रखना है? Again you can appreciate there are going to be two important openings. यहाँ पर भी कितनी opening है बच्चा? Two openings are going to be there. But the important thing is it a curved one or is it a straight one? Remember beta, this is going to be a straight one. This is going to be a straight one. This is going to be a straight one. Can you appreciate this pilot balloon? Yes, we have got this pilot balloon is also there. This pilot balloon is also there. This is known as what? This is known as LMA ProSeal. This is known as LMA ProSeal. This is known as LMA ProSeal, which we have got what? Straight. This is a straight one, and we have got what? Pilot balloon over there, right? So this is going to be LMA ProSeal है, right? So we have got three things. We have got classical, we have got fast track, we have got ProSeal. तीनों समझ में आया? Classical, fast track और ProSeal. Classical single opening, fast track you will be having curved end, you will be having extra handle, you will be having double opening. This is going to be fast track. ProSeal क्या होगा? Pro वाला जो होगा ये सीधा होगा, double opening होगा, and this is going to be what? Double opening will be there, and this is going to be straight one with the pilot balloon, right? Now you have got this again, this particular one. What is this one? These are the 6 important airway devices you need to remember. 3 we have already covered. This one is what? Can you appreciate the pilot balloon? Let's try to identify. Pilot balloon is there. Yes sir, pilot balloon is present, right? This is going to be what? This is going to have important things. ट्यूब्स कितना है, ओपनिंग के लिए ट्यूब्स कितना है, यू आर हैविंग डबल ओपनिंग, 2 openings will be there. Is it straight or curved? Is it a straight or curved? No sir, it is curved. This one is curved, this one is curved one. So it is going to have 2 opening, it is going to have pilot balloon, it is also curved, it is also curved LMA that we are having. But the important thing is going to be what, how you are going to differentiate. This is going to have this particular thing. Okay, this is going to have this particular thing. What is this particular thing we are having? This is known as fixation tab. This is known as fixation tab, and this fixation tab is going to help for the integrate byte block also. It is going to help in the byte block also, and this particular fixation tab we are having is also going to help you out, right? So this is going to be what, this is going to be the supreme LMA. This is going to be the LMA supreme. This is going to be LMA supreme. This is known as what, Bache? This is known as LMA supreme. This one is igel, this one is igel. Okay, can you appreciate? Do you find the pilot balloon over here? Pilot balloon is going to be absent. Pilot balloon is going to be absent. This is known as igel, and this is what we are using commonly. This is your igel. This is your igel. And lastly, we have got what? Lastly, we have got, this is your LMA ambu. These are going to be like colorful. These are going to be your colorful one, right? And this is going to have what? This is also colorful, but remember here you are finding what? Pilot balloon. If colorful with pilot balloon, this is going to be what? This is going to be LMA ambu. LMA ambu, है ना? तो identify हो गए सारे, 6 के 6 identify कर लोगे. What are the first one? What is the first one? Single opening pilot balloon. This is going to be classical LMA. Double opening curved handle will be there, right? And again with that double opening will be there. This is going to be what? Fast track. Curved will be fast track. Here also it is going to be curved, but what is going to be different? Here you will be having fixation tape, you will be having byte block. This is going to be LMA supreme. This is going to be LMA supreme, right? igel will not have pilot balloon. If you are finding igel like something with the pilot balloon, this is going to be LMA ambu. Lastly, we have left with the pro seal. This is going to be what? LMA pro seal. This pro one is going to be the straight one with the pilot balloon with double opening, and it is going to be the straight one. It is going to be the straight one. These are the 6 LMA devices that we have seen. Now you can easily identify which one is this. This is your LMA igel. This is your LMA igel, right? This is not your LMA igel that we are having. It is a laryngeal mask airway. It is a laryngeal mask airway device that we are having. The next one we have got is this particular one. Identify the given instrument in the particular list. Which one is this? Simply try to identify which one is this. Can you appreciate this particular one is having what? Fixation tab. This particular one is having what? Fixation tab. And if this particular one is having fixation tab, this is curved one, this is having double opening, fixation tab, curved one, pilot balloon is positive, it is present. This is going to be what? This is going to be your LMA. Yes, your LMA. Very good. This is going to be your LMA supreme. This is going to be your LMA supreme. LMA supreme will be there. Okay, so identify the given instrument. This is going to be a laryngeal mask airway. Which one? This is going to be LMA supreme. LMA supreme, right? Where can the device in Murphy's eyes be observed? In which device you will be finding Murphy's eyes? Murphy's eyes is a feature of which device? Murphy eye is a feature of which device, beta? Murphy's eyes is a feature of which device? So let's try to understand these devices. These questions we have already done. This is going to be laryngeal mask airways, right? So we have discussed about the laryngoscope. We have discussed about the laryngoscope. First thing we have discussed about is the laryngoscope. 5 types of laryngoscopes we have seen. Then we have discussed about the supraglottic airway devices. These are your laryngeal mask airways. Now we will discuss about the infraglottic airway devices. These are going to be your endotracheal tubes, right? So what are these endotracheal tubes? Let's try to understand them. So this is your endotracheal tube that we are having. This is an endotracheal tube. Remember, the CT tube can be cuffed tube, it can be uncuffed tube also. We can have cuffed tube, we can have uncuffed tube. What is the purpose of this cuffing? ये cuffing का purpose क्या है? What is the purpose of this cuffing? It is not going to यूटिलाइज फॉर द फिक्सेशन पर्पस. इसकी वजह से अगर ज़्यादा प्रेशर लगा दिया तो दिक्कत हो जाएगा, राइट? यू विल बी हैविंग एडिमा, यू विल बी हैविंग अदर प्रॉब्लम्स, राइट? वहाँ ब्रोंकोस्पाज्म हो सकता है, राइट? सो इट इज़ नॉट फॉर द फिक्सेशन पर्पस, दिस इज यूज्ड फॉर द पर्पस टू प्रिवेंट एस्पिरेशन समटाइम्स. It is used to prevent the aspiration. This is what is the purpose of this cuffing, right? So we have got this bevel end. This is going to be the end, like pointed end will be there. Apart from that, you are also having another opening, ताकि अगर if this part is going to get closed, for example this part is going to get closed, suppose this is a tube we are having. Suppose if this part is closed, they will be having another opening over here. This another opening is known as what? This another opening is known as what? This opening is known as Murphy's eye. This opening is known as Murphy's eye. तो अगर ये वाला हिस्सा बंद भी हो जाए, अगर ये वाला हिस्सा बंद भी हो जाए तो इस पेशेंट को ऑक्सीजनेशन मिलता रहे. दैट इज वाई वी आर हैविंग व्हाट? Murphy's eye. This is the use of this particular Murphy's eye to give oxygen. To give oxygen even if the bevel end is going to get closed, right? तो इसका function हो गया Murphy's eye का. Cuff का function I have already told you. Then you have this guide. These guides are the markings that we are having. These are the markings for entry, है ना? ये अंदर जाने के बाद में these are going to be the markings for vocal cord guide, right? We need to understand whenever we are entering into our lungs, है ना? ये lungs के अंदर जब भी entry करेंगे, here you will be having what? Here you will be having कैराइना. यहाँ पर क्या होता है? दिस पार्ट इज नॉन एज कैराइना. तो इससे ऊपर रखना है. अगर आपने इसको कैराइना पे रख दिया, व्हाट इज गोइंग टू हैपन? या कैराइना से नीचे ले गए तो क्या होगा? सिंगल लंग वेंटिलेशन विल बी देयर. इधर वाले में तो ऑक्सीजन जाएगी ही नहीं, राइट? सो यू नीड टू कीप इट समवॉट अबाउ द कैराइना. इसको कैराइना से ऊपर रखना है, राइट? सो वी विल बी हैविंग दिस वोकल कोड गाइड्स, राइट? Then you have this number. This is the number. Like for example, this is a tube with a internal diameter of like 8, right? This is a tube with a ID 8, right? This is going to have what? Radio markers will be there so that we can identify any foreign bodies in the body, right? कोई भी फॉरेन बॉडी आइडेंटिफाई करने के लिए आप क्या करते हो? यू कैन डू व्हाट? एक्सरे. क्या नहीं करते हो? दैट इज गोइंग टू बी एमआरआई, राइट? एमआरआई नहीं करना है, एक्सरे करना है. फर्स्ट लाइन इज गोइंग टू बी एक्सरे, राइट? सो दिस इज गोइंग टू बी द थिंग. यू हैव गॉट दिस पायलट बलून, राइट? दिस इज द पायलट बलून वी आर हैविंग. दिस इज द पायलट बलून वी आर हैविंग. एंड देन वी हैव गॉट द adapter. This adapter, remember, is going to be the universal connector. This is going to be your universal connector, right? Remember the size in the males we are going to use somewhat 23 centimeter, right? For females we are going to use what? Somewhat 21 centimeter. We can calculate that also in the children's also, right? We have got some formulas for calculation. This is how we can calculate the size of the ET tube that we are going to use, right? This is going to be the basic thing we are having. How we are going to intubate? This is a tube you are going to put. You are going to put your laryngoscope inside the mouth of the patient, right? And you are going to identify the glottic opening, and then you are going to put this ET tube, right? Resistance of the tube shown below is primarily because of what? So remember this resistance, the most important factor that we are having is going to be what? Diameter of the tube is going to be the very important factor that we are going to have, right? Diameter of the tube is the most important factor that we are having. Resistance of the tube is going to be based on diameter of the tube. Diameter is going to be very important, beta, right? उसके बाद में what is this particular device is known as? What is this device that we are having in front of us? What is this device? This is your armored endotracheal tube, ring Adair Alvin tube, endotracheal tubes equipped with bronchial blocker, or is it double lumen endotracheal tube? What is this particular tube we are having in front of us? So this is going to be your ET tube we are having. Murphy's eyes you will be finding in the endotracheal tube. So try to answer this one also. So let me make you understand what are the different kind of tubes that we are having and what are the utilization of all these different kind of tubes, right? So let's begin with the first one that we are having. This is going to be your RAE tubes, or also known as ring Adair Elvin tubes. These are going to be your ring. These are going to be your ring Adair and Elvin tubes. This is going to be your ring Adair Elvin tubes. These are your ring Adair and Elvin tubes. Remember, we are going to use this particular tubes. They are going to be of two types. We are having south facing, we are having north facing. So remember, if both the end are facing the same direction here, both the ends are facing the same direction, this is going to be what? This is going to be south facing tube. This is going to be south facing tube. And you can also remember, you can see the map. In the map you will be finding what? North is always in the superior position. North is हमेशा, north कहाँ होता है? ऊपर होता है north, है ना? south कहाँ होता है? नीचे होता है. तो याद रखना, ये जो pointing है, this mouth is going to come below. This is going to come like that. This is known as RAE tube. This is known as what? RAE tube, है ना? This is going to be what? RAE tube. This is going to be utilized like that. Okay, this is going to be the RAE tube, right? Another one we are having, this is your south facing RAE tube. The another one we are having is this particular one. यहाँ पर देखो, both the things are going in the opposite direction. Both the things are going in the opposite direction. So this is going to be not a south facing tube. This is going to be a north facing tube. You can also remember, north मैंने बताया था मैप के ऊपर, मैप के अंदर north ऊपर होता है. So remember, this is going to go upper. This is going to go in the upward direction, or and you can also remember it is coming from the nose. You can put it on the nose. Can you appreciate it is going in the nose also? So this is going to be what? This is going to be north facing tube. This is going to be north facing RAE tube. This is going to be north facing RAE tube, right? So we have got what? We have got south facing, we have got north facing RAE tubes. You can simply remember, अगर ऊपर की तरफ जा रहा है, this is going to be north facing. अगर नीचे की तरफ आ रहा है, this is going to be what? South facing RAE tubes, right? So this is what is important, right? One is if both of them are in the same direction, this is south facing. If both of them are going in the opposite direction, this is going to be what? North facing. North is going to be upward, south is going to be the downward, right? These are the pre-formed ET tubes that we are having. Second one we are having is going to be this particular one, beta. This particular one is known as red rubber tube. ये कब यूज में लेना है? रेड रबर ट्यूब. रेड रबर ट्यूब यू आर यूजिंग when you are doing what? Cautery. When you are doing what? Some kind of cautery. Cautery से क्या होगा? ट्यूब जल जाएगा, right? So you are going to use CO2 laser surgeries. You are doing, maybe you are removing some vocal nodules, maybe you are doing anything, right? CO2 surgery you are doing, CO2 laser surgery, या फिर something cautery you are using. At this particular point of time, you are going to use what? Red rubber tube. These are the tubes you are going to use whenever you are using what? Fire or something. This is the tube which is going to be helpful. Then we have got this kink resistance flexometallic tube. These are known as flexometallic tube. These are going to be your flexometallic tubes. Why we are using this flexometallic tubes? Because they are going to be kink resistant beta. इनमें क्या नहीं होगा? ये मुड़ेंगी नहीं. इनके अंदर we are having a metal will be there. You can appreciate a metal lining will be there inside. So that is what is going to cause what? Kink resistance. For example, this is a normal one, right? नॉर्मल वन क्या हो जाएगा? ये किंक हो जाएगा. अगर किंकिंग हो गया इसका, तो क्या ऑक्सीजनेशन होगा पेशेंट को? नहीं होगा. और अगर ऑक्सीजनेशन नहीं हुआ पेशेंट को, तो क्या पेशेंट जिंदा रहेगा? नहीं रहेगा, पेशेंट मर जाएगा. सो वी नीड टू मेक आवर पेशेंट अलाइव, एंड वी नीड टू, इफ वी आर परफॉर्मिंग एनी सर्जरी इन द डाउनवर्ड डायरेक्शन, है ना, उल्टा लेटा रखा है पेशेंट को, कुछ ऐसी सर्जरी कर रहे हैं, तो उस केस में हम डेफिनेटली वी आर गोइंग टू यूज व्हाट? वी आर गोइंग टू यूज किंक रेजिस्टेंट ट्यूब्स, एंड दीज आर द kink resistant tubes that we are having, these are also known as flexometallic tubes. These are also known as flexometallic tubes, right? Kink resistant. The next one we have got, these are the double lumen tubes. You can appreciate the double lumen over here. These are the double lumen we are having, and this was the question also. We have got this double lumen tube, right? This double lumen, this is your double lumen tube. Double lumen tube. Okay, when we are going to prefer this double lumen tube, suppose we are doing some surgeries on the lung and we want to ventilate a single lung, right? So if we want to ventilate a single lung, when we are going to use this particular, when we want to ventilate a single lung, this is the time we are going to do what? We are going to use this particular type of tubes. This is going to be double lumen tube. This is going to be what? Double lumen tube for ventilating single lung or while performing lung surgery. Lung surgery. While performing single lung surgery, more appropriately. So we want to intubate our one lung and we want to give oxygenation to our one lung. This is going to be what? When you are ventilating a single lung, you will be giving this one lung surgery, right? The next one we are having, this is a boogie that we are having. This is going to be the thing we are going to put inside our ET tubes, and so that it will be becoming kink resistant for the time being, and we can easily insert this particular tube into the patient's mouth, right? So we are going to put this boogie or stylet inside that particular thing. This thing is known as stylet. We just need to understand these are known as boogie and stylet. Then we can easily remove it out, right? After intubation, after successful intubation, we can remove it out. These are the boogie and stylet that we are having. These are the basic of things that we are having, right? So we have discussed about what? We have discussed about the supraglottic airway devices. We have discussed about the infraglottic airway devices, right? We have discussed about the endotracheal tube. We have discussed about the laryngeal mask airways. Now we will be discussing about the adjuncts which are going to be helping in intubation. These are the things which are going to do what? These are the things which are going to do what? They are going to be helping in the intubation, helping in the intubation. So we are having what? We are having adjuncts. Let's begin with the adjuncts that we are having. So these are the two important adjuncts that we are having. One is going to be oropharyngeal, another one is going to be nasopharyngeal adjuncts that we are having. So we have got what? Oropharyngeal adjuncts. We have got oropharyngeal adjuncts. We have also got what? Nasopharyngeal adjuncts. This oropharyngeal adjuncts device, this is known as what? This is known as Goodell's airway. What is another name for this particular one? This is known as Goodell's airway. Goodell's airway. This device is known as Goodell's airway device, right? So we are going to put this particular thing in the mouth of the patient, right? Remember that this tip, remember beta, this tip should be facing what? This tip should be facing the roof of mouth, है ना? So whenever you are going to put this particular tube, remember this tip should be facing the roof of mouth, and then when you are going to inject this, what is going to happen? Then you can remove, then you can turn it around, है ना? आप जब इसको एक बार डाल दोगे उसके बाद में you can turn it around, right? This is going to be what? This is going to be the this is going to be the Goodell's airway that we are having. This is the Goodell's airway, right? इसका size कैसे लेना है? The size you will be taking, the another question they have asked is from the angle of the mouth to the angle of the mandible, right? So the size you will be taking from the angle of mouth to the angle of mandible. So size you will be taking from the angle of mouth to the angle of mandible. This is going to be what? This is known as Goodell's airway. From the angle of the mouth to the angle of the mandible, you are going to take the size. This is known as Goodell's airway, right? This is going to be your oropharyngeal device that we are having, we are going to put it inside the roof. The tip should be facing the roof, and then you are going to turn it around, right? 180 degree you are going to turn it. This is going to be your Goodell's airway devices. Then we have got what? Nasopharyngeal adjuncts. These are going to be the nasopharyngeal devices that we are having. These are the nasopharyngeal devices. You are going to apply it from the nose. You are going to give it from the nose, and you are going to check the size. How you are going to check the size? Remember the tip. You will be checking the size from the tip of the nose to the tip of the ear lobule. From the tip of the nose to the tip of the ear lobule, you will be making it understand. This is going to be the size for nasopharyngeal adjuncts devices. This is going to be the size for nasopharyngeal adjuncts devices, right? जब आप राइल्स ट्यूब डालते हो, how you are going to check the size for राइल्स ट्यूब? How you are going to check the size for राइल्स ट्यूब? From where to where? From where to where? कब तक कहाँ तक लेना है? Just try to answer me. Right, this is going to be your Goodell's airway. This is going to be your nasopharyngeal adjuncts, right? So these are the all airway devices that we are having. किसी भी patient को intubate करने के लिए whatever things we require, we have discussed about all of them, right? We have learned about the 5 types of laryngoscope. कितने तरीके के laryngoscopes पढ़े? 5 types of laryngoscope. Then we have discussed about the laryngeal mask airway of 6 types. We have learned about certain types of endotracheal tubes. These are infraglottic airway devices. Then we have discussed about the 2 types of important adjuncts. One is going to be oropharyngeal, another one is going to be your nasopharyngeal adjuncts. We have discussed about all these things, right? Now the next we are having what, Bachche? Next thing, now the patient is where? Where is our patient? Our patient is lying down on the OT table. Remember, हमने पेशेंट लिटा रखा है ओटी टेबल पे. पेशेंट हैज एंटर्ड इनटू द रूम, राइट? उसको सारा दवाई वगैरह देके वी हैव पुट आवर पेशेंट ऑन द ओटी टेबल. नाउ व्हाट आर द थिंग्स वी आर गोइंग टू डू? We are going to intubate our patient, right? First of all, tell me what is the correct statement, what is the false statement here, what is the correct statement? You need to tell me, right? Which of the following statement is false regarding intubation, right? Which statement is false regarding intubation? So what is the statement which is going to be false here? What is the statement which is going to be false over here? First statement, let's see about the first statement that we are having. Morning sniffing position, flexion of the neck. Is it a true statement? While intubation, we need to have the morning sniffing position, right? Patient should be having the morning sniffing position. It is also known as the barking dog position, like that. This is going to be flexion of neck should be there. This is going to be, yes, a true statement, right? We check for the we check for the distance also, right? So that is going to be the true statement, right? We will extend the neck, right? We will do the flexion of the neck, right? Basically, we will be doing the flexion of the neck. Second thing, introduce the laryngoscope from the right hand. Yes, but it is not the right statement. We are going to take the laryngoscope. For example, I am writing from my right hand. I am going to take my laryngoscope in the left hand. I am going to put it from the left hand, non-dominant, right? And then I am going to put my endotracheal tube from my right hand. I am going to put. This is going to be the funda, right? Push the tongue away and see the epiglottis and then visualize the glottic opening. Yes, this is also a true statement. We are going to pushing the tongue away. We are going to see the epiglottis and then visualize the glottic opening. This is what is the basic thing we are doing. Introduce the ET tube and inflate the cuff. This is also a true statement we are having. Checking for the bilateral breath sound and chest rise. We are going to see whether the lungs are inflating or not. This is what we are going to check. This is also a true statement. And then we are going to do what? Fixation of the ET tube. This is also a true statement. So what is going to be the false statement here? This is going to be this particular statement is false in this particular case, right? So next one, we have got another question. What is the specific action? What is the specific action being demonstrated in the provided image? कौन सा action हो रहा है यहाँ पर? What is the specific action being demonstrated in the provided image, beta? This is your head tilt and chin lift. This is your head tilt and chin lift. We are tilting the head, we are lifting the chin. This is going to be your head tilt and chin lift movement, right? The next one we are having, this movement, right? What is the specific action being done in the provided image below? Now you are not tilting the head and lifting the chin. This movement is known as what? Jaw thrust. This movement is known as what? Jaw thrust. You are putting the pressure on the jaw. This is known as jaw thrust. This is known as jaw thrust. It was your head tilt. Remember, the hand is here. This is your head tilt and chin lift. This is your head tilt and chin lift, right? So we have got this head tilt and chin lift movement. When we are going to do this, we are going to do this to visualize the glottic opening. Okay, आप head tilt और chin lift कब करोगे? You are going to do this to visualize the glottic opening. If glottis is not visible, you are going to do that, right? But you are going to do this jaw thrust in which patients? In the patients you cannot do what? Head tilt and chin lift you cannot do in which patients? Like patient who are having trauma, who are having what? Who are having instability of the cervical spine. You are going to do what? You are going to do what? Jaw thrust movement. Only jaw thrust movement you can do, right? What is this particular maneuver that we are having? You are going to put pressure on the cricoid cartilage. This maneuver is known as what? This maneuver is known as Slick's maneuver. This maneuver is known as Slick's maneuver. Why you are going to do that? To prevent the aspiration. You are going to put pressure on the cricoid cartilage. Like that you will be putting the pressure on the cricoid cartilage to avoid the aspiration. Slick's maneuver to prevent the aspiration. Push the cricoid cartilage and it is going to collapse what? Esophagus also, right? So if your esophagus is collapsed, your cricoid cartilage is collapsed, what is going to happen? You will be having problem with the aspiration, right? And that is what we want in this particular case, right? So now we will be discussing about the next thing. This is going to be the monitor, right? So what we have done till now, we have kept our patient since the beginning. Let me just summarize. We have kept our patient for some surgery, right? And now this patient is in the OT, and in the OT he is going to have what? Now you are doing the intubation. Now you know how to intubate your patient. You have the laryngoscope, you put your laryngoscope, you put your ET tube, and now your patient is intubated. Now you need to connect your patient to what? Now you need to connect your patient to monitor, right? Your patient will be finding what? Certain monitors over there, right? So let's try to understand what are the monitors we are having. Let's try to understand this. Okay, before that, let's just take a break for like 10 to 15 minutes and then we will continue, है ना? 10 minutes का एक छोटा सा break लेते हैं and then we will continue. All right. Am I audible? All right. So now the next thing we are going to discuss is about the monitor. Okay. So how we are going to connect our patient to monitor and what are the different kind of monitors that we are having? Let's try to understand about them. Right. So let's try to learn about all the different kind of monitors that we are having. So for monitor, remember we should be having 5 mandatory monitors we are having, right? So how many mandatory monitors should be having in the OT? In the OT setup, you will be having 5 mandatory monitors, and there should be a presence of anesthesiologists, right? This is what is the standard guideline that we are having. There should be presence of one anesthesiologist, right? So these are the standard protocol that we are having. This is going to be the monitors, right? So 5 mandatory monitors should be there. So what are those 5 mandatory monitors, beta? First one we have got is going to be your ECG monitor. First one we have got is your ECG. ECG में कौन सी लीड देखनी है? We need to look for lead number 2. We need to look for lead number 5, right? So this lead number 2 is going to tell us about the arrhythmias, right? Abnormal rhythms are not there. So this is going to be told to us by the lead number 2, whereas this lead number 5 is going to tell us about the MI component, whether the patient is landing up into MI or not, right? This is going to be lead number 5. Then we have got SpO2. This is the pulse oximeter that we are having. SpO2 is for the understanding of the oxygen saturation, right? So this is going to be the pulse oximeter that we have got, right? It is based on a law, specific law. This law is known as Beer-Lambert law. The name of the law is Beer-Lambert law, and it is based on the law of plethysmography. It is based on which law? It is based on the law of plethysmography, right? Third mandatory monitor that you are having is going to be this capnography. This capnography is the third important thing, which is going to tell us about the CO2 output, and EtCO2 is going to be measured by EtCO2 is measured by this capnography. We'll look about them, right? And then you have got NIBP, non-invasive BP monitoring. Non-invasive BP monitoring should be there. So we are going to look for the BP of the patient. And lastly, we have got what? Temperature monitoring, right? For temperature monitoring, we can use pulmonary artery catheter. That was the Swan-Ganj catheter. That is the most sensitive one, but we cannot use in every condition. So we can also use lower 1/3 of esophageal temperature. We can understand this is the most common method, right? This is important method, right? So these are the 5 mandatory monitors we are having. We should be having a ECG machine. We should be having SpO2, right? ECG, these leads should be there, right? Second thing is about the SpO2. SpO2 should be there. Okay, SpO2 should be there. Third thing is about the EtCO2. Entitled CO2 is going to be shown with the help of these graphs, right? Normal EtCO2 is 35 to 45 mm of Hg, right? Next one we have got is BP monitor. These are the BP monitoring we are having for the identification of BP of the patient, systolic, diastolic. And then we have got the temperature monitoring of the patient. So these are the 5 mandatory monitors that we are having. What is this EtCO2? EtCO2 is expired CO2. EtCO2 is expired CO2. How much amount of CO2 you are expiring through your lungs, right? This is going to be your expired CO2 that we are having. This is known as EtCO2. This is known as EtCO2. The next one we are having, what is the most frequently employed method for monitoring of the level of anesthesia? So how we can understand the depth of anesthesia? For identification of this depth of anesthesia, we are going to do which testing? Try to answer now. So what is this particular test that is happening in front of you? Level of anesthesia or depth of anesthesia. Remember, this depth of anesthesia could be understood with the help of this BIS monitor. This BIS monitor, right? This BIS monitor is going to tell us about the depth of anesthesia, right? So what are the different monitors we are having? These are known as desired monitors. These are known as desired monitors. Mandatory, we are having mandatory monitors. These are your desired monitors. So what are the desired monitors we are having? First one that we are having in the list, this is your BIS. This is your BIS. BIS is known as bispectral index. Bispectral index beta. And it is going to tell us about the depth of anesthesia. डेप्थ ऑफ एनेस्थीसिया का मतलब क्या हुआ? अगर ये जीरो आ रहा है, इसके अंदर वैल्यूज होंगी 0 to 100. इफ द वैल्यू इज कमिंग आउट टू बी जीरो, दैट मीन्स दिस पेशेंट इज इन द कोमा, इसका दिमाग काम नहीं कर रहा, कोमा में, राइट. इफ द वैल्यू इज कमिंग 100, this means this patient is fully awake, this patient is fully awake. If the value is coming as 100, this patient is fully awake. If the value is coming as 40 to 60, this patient is going to be in the maintenance range, right. Now this patient is somewhat in the anesthesia. If this value is going down towards the zero, what we can do, we can decrease the dose, right. If this value is going towards 60 or towards 100, that means this patient is about to wake up, we can increase the dose of anesthesia. So this is going to be BIS index, which is going to tell us about the depth of anesthesia, kitna anesthesia, right. Another thing we have got is the neuromuscular monitoring, right. What are the components of anesthesia? Anesthesia की वजह से क्या होगा, sensations कम हो जाएंगे. Loss of sensation is known as what? Anesthesia. You will be having loss of consciousness will be there, amnesia can be there, right. But what about muscle relaxation? No beta, muscle relaxation is not a property of anesthesia. So you need to give what? You need to give muscle relaxant from outside, right. You need to relax the muscle of the patient. Why to relax the muscle? क्योंकि muscle क्या है, ऑटोमेटिकली काम करेगा. आप कट लगाओगे, पेशेंट ने मुक्का मार दिया, क्या होगा, दिक्कत हो जाएगी, राइट. सो दिस थिंग कैन हैपन, राइट. सो मसल रिलैक्सेशन, बेसिकली muscle relaxation is required, and for muscle relaxant we are going to use some drugs, right. And this particular thing we are having in front of us, this is your neuromuscular monitoring. This is known as neuromuscular monitoring. This is known as neuromuscular monitoring, which is going to assess the nerve and muscle conduction, whether the muscle is working or not, right. Your nerves are coming and sending the signals to the muscle, and these muscles are working or not, right. So how we are going to assess, and which is the most common nerve that we are going to assess? Most common nerve, beta, this is your previous year question. This is going to be your ulnar nerve. Ulnar nerve is the most common nerve that we are going to assess for neuromuscular monitoring. And what is the most common reflex that we are going to do? This is going to be your train of 4 reflex. Train of 4 reflex, where you are going to give 4 stimulus. Okay, train of 4 reflex or train of 4 response you are going to check, right. You are going to give 4 stimulus on this particular nerve. This is going to be your ulnar nerve, and you will be checking for the reflex whether the muscles are contracting or not. If muscles are contracting after this reflex, that means you have not given the enough adequate anesthesia, adequate muscle relaxant. You need to repeat the dose, right. If this muscle is not moving, that means your muscle relaxant is adequate, right. This is how we are going to check for the neuromuscular monitoring, right. This is the NMR, neuromuscular monitoring we are having. This is your central venous catheter. This is your central venous catheter, beta. Catheter, this is your central venous catheter that we are having, right. And this particular one is known as Swan-Gange catheter. This is known as Swan-Gange catheter, and this is the particular one you are going to utilize for pulmonary. This is also known as pulmonary artery catheter. Pulmonary artery catheter, which is what you are going to use for what purpose? That is what you are going to use for the temperature monitoring. This is what you can use for the temperature monitoring, beta. Temperature monitoring के लिए you can use this particular one. For temperature monitoring, you can also use this Swan-Gange catheter, right. So these are the four monitors. These are your desirable monitors that we are having, right. So first one we have got is BIS. BIS is going to understand about the depth of anesthesia. This is the BIS monitor that we are having, very, very important. This is going to be neuromuscular monitoring. You can easily understand which nerve is being stimulated. This is going to be your ulnar nerve, right. Third one we have got is going to be central venous catheter, and lastly we have got is multiple ports are there. There are ports for what? Thermistor, right. There are ports for thermistor, there are ports for balloon, distal port, you are having proximal port. So this is going to be the temperature monitor. This can be used for the temperature purpose also. This is your Swan-Gange catheter. This is your pulmonary artery catheter. Okay, ये 4 catheter हम लोगों ने देखे, important one, right. 5 mandatory monitors that we are having. These are going to be what? mandatory monitor. 5 mandatory monitor are going to be your temperature monitoring, your BP monitoring, your ECG monitoring, your capnography, and lastly we have got this particular SpO2 monitoring, right? These are the 5 mandatory monitors we are having: NIBP, BP monitoring, temperature monitoring, ECG, SpO2, BP, temperature, and this particular one we are having. These are the 5 monitors we are having, right? Now moving on to next, what is the most effective approach? What is the most effective approach for verifying the accuracy of intubation during laryngoscopy? What is the most appropriate approach, beta? क्या होगा यहाँ आंसर? What is going to be your answer? What is the most effective approach for verifying the accuracy of intubation during laryngoscopy? What is the best method we are having? What is the best method? What is going to be your answer? Verifying the accuracy of intubation during laryngoscopy, after laryngoscopy, how you are going to assess this? The best method overall is going to be what? This is definitely going to be what? Checking the levels of EtCO2, and EtCO2 levels you will be checking on which monitor? This is going to be known as capnography. This is going to be known as capnography. This is going to be known as capnography, right? Answer in this case will be capnography. What is the most effective way to verify the placement of endotracheal tube in a 30-year-old male patient who has been intubated for surgery by a final year resident? Same thing they want to know. What is the same thing they want to know? Are you going to do any chest x-ray, or you are looking for chest rise, or you are going to understand about the EtCO2 values? What you are going to do here? You are going to look for what? You are going to look for EtCO2 values. EtCO2 is the best thing we are having. EtCO2 is the best thing that we are having. This is going to be the capnography. Same story, right? So let's try to understand what is this capnography and what is the thing we are going to say. So in capnography you are going to check the levels of EtCO2. It should be normally somewhat around 35 to 45 mm of Hg, right? This is going to be 35 to 45 mm of Hg. This is the normal end-tidal CO2 that is going to come out from your lungs, है ना? ये आपके lungs में से जो CO2 बाहर आ रहा है, that is going to be 35 to 45 mm of Hg should be there, right? This is the graphical representation. This is going to be the respiratory baseline. This type of graphs you will be finding. So once you are connecting your patient, you are intubating your patient, you are putting the laryngoscope, you are finding the glottic opening, removing the tongue and all those things, entering into the glottic opening. You are going to put your endotracheal tube. You have put your endotracheal tubes in the trachea, right? You have checked for all those things, and now you are assessing what? Now you are fixing the tube. Now this connector will be connected to the machines, and in the monitor you will be finding what? This type of graphs will be there. And this type of graphs is going to tell us about what? This type of graph means what? You will be having EtCO2 is coming, right? If the pressure is coming somewhat around 35 to 45 mm of Hg, this means it is a normal placement of the tube also, right? ये सही जगह पे tube गया है, right? So this is the respiratory baseline we are having. Baseline should be 0 mm of Hg. Then you will be having a expiratory stroke. Because of expiration, what is going to happen? CO2 is going to come out. अगर CO2 बाहर आएगा तो क्या ये बढ़ेगा? ग्राफ बढ़ेगा? Yes, this is going to be increased. This is going to be the increase, right? This is the EtCO2 value which is increasing, right? Then you will be having what? Plateau phase will be there, alveolar plateau will be there, and then you will be having what? Inspiration. Because of inspiration, what is going to happen? Now you are having ऑक्सीजनेशन. ऑक्सीजन की वजह से क्या होगा? EtCO2 का वैल्यू कम हो जाएगा, राइट? सो दिस इज द ग्राफ विच इज हैपनिंग, विच इज गोइंग ऑन. दिस इज गोइंग टू बी द ग्राफ वी आर गोइंग टू सी, right? At what point you are going to measure EtCO2? This is the point where you are going to measure the EtCO2. This is also known as at the end of phase 3. At the end of phase 3 you are going to measure what? EtCO2. This is going to be the point, whereas this phase 2 is going to tell us about the expiration. What is the phase which is going to tell us about the inspiration? This is going to be phase 0. This is going to be inspiratory phase. Inspiration will be there. This is going to be the inspiratory phase, right? Why this CO2 is formed? Simple understanding, because of catabolism and anabolism. or you can simply call it because of metabolism. More the metabolism, more CO2 production will be there. Metabolism is sum of catabolism plus anabolism, right? All the reactions which are happening in the body are going to make what? CO2. In fact, the glucose that you are eating yesterday, I told you, is going to ultimately make what? CO2 plus H2. So this is the CO2 which is formed. It should come out. What is the way to come out? It is going to come out, right? So let's try to understand this EtCO2. This is a normal capnographic graph that we are having. This is the expiration followed by plateau phase. Then you will be having inspiration. The same story is going on. This is a normal graph that we are having, right? Now what can happen? You can have capnographic pattern. The capnographic patterns that you can have. This means normal intubation, right? This means normal intubation. When you see this type of graph, that means this is a normal intubation. Normal intubation, right? That is why these lines are okay, right? Everything is fine, right? But sometimes you can have what? Partial, sometimes you can have this graph, this type of graph. These are known as shark fin pattern. This pattern is known as what? This pattern is known as shark fin pattern. This pattern is known as shark fin pattern. This pattern you will be finding when you will be having partial obstruction of the airway. There might be some bronchial asthma or any kind of bronchospasm will lead to what? Shark fin pattern. Shark fin pattern. This pattern is known as curare notch. This notch that you are finding, this curare notch is telling us about the return of spontaneous ventilation. Return of spontaneous ventilation. That means now this patient has started to breathe himself, right? You have intubated some patient, but he has started to wake up. He started to use his own efforts instead of machine. This is going to be telling us about this dip. This dip is known as curare notch, and this curare notch is going to tell us about what? This is going to tell us about the return of spontaneous ventilation. We look on the monitor. We find there is a dip. There is a dip on this plateau phase. This is going to be what? This is known as curare notch. इस notch को क्या बोलेंगे? Curare notch. And this graph above the baseline, can you appreciate this graph is above the baseline? There is some space, okay? Zero will be here. There is some space, and the graph above the baseline is going to suggestive of, this is your graph above the baseline. It is suggestive of CO2 rebreathing, beta. CO2 rebreathing. It is suggestive of CO2 rebreathing, and when you are going to have CO2 rebreathing, whenever there is going to be exhaustion of soda lime, right? So there will be soda lime exhaustion, or there might be some problem with the circuit issue, right? So there is some kind of circuit issue is going to be there. This is going to produce what? This is going to produce this particular type of graph. The graph will be above the baseline. The graph will be above the baseline. Graph will be there, okay? Now you can start this. I'm glad you liked micro. All right. What is the parameter being assessed by the devices depicted in the provided image? What is the thing it is going to assess? This thing is going to assess what? This machine is known as what? This is the machine you have used during the COVID-19. This is known as what, bache? This is known as pulse oximeter, bacha. This is known as pulse oximeter, right? And this pulse oximeter is based on which law? We have discussed about this law. This is based on a law of plethysmography. Law of plethysmography. This is based on law of plethysmography or Beer-Lambert law. Beer-Lambert law. This is based on plethysmography or Beer-Lambert law. You want to shout out? Hello, Soham. Right, I can see your comments. Right. So this is based on Beer-Lambert law and law of plethysmography. This is based on Beer-Lambert law or law of plethysmography. Right. What is going to be the thing? Here you are going to see the saturation of oxygen. Here you are going to see the saturation of oxygen, beta. what you are going to see? You are going to see the saturation of oxygen. What is saturation of oxygen? For example, what is FiO2? What is FiO2? What is FiO2? FiO2 क्या होता है? FiO2 is the fraction of inspired oxygen. For example, we are having air outside. तो क्या आप 100% ऑक्सीजन लेते हो? नहीं, 100% तो एनवायरमेंट में ही नहीं है. अगर 100% एनवायरमेंट में नहीं है, हाउ यू आर गोइंग टू टेक द 100% ऑफ ऑक्सीजन, राइट? It's not possible, right? So this is known as fraction of inspired oxygen. Environment में कितना है? 21%. And this is what you are inhaling, right? This is what you are inhaling. You are inhaling what? You are inhaling air. This is the tidal volume. Tidal volume 500 ml, that is the air, right? In that particular air, 21% will be oxygen, right? Remaining will be other gases which are not going to go to your lungs, right? So you can also write it 0.21 is going to be what? FiO2. 21% you can also write it like divided by 100 is going to be 0.21 FiO2, right? This is going to tell us about the saturation of oxygen, how much oxygen is saturated in the blood. It is based on these two important laws. This is going to be telling us about the oxygen saturation, right? This is going to be A is going to be the answer in this particular case. This is known as pulse oximetry, which is going to tell us about the oxygen saturation. ये दो चीजों पे काम करेगा, Beer-Lambert law and law of plethysmography. So it is only going to assess the blood which is pulsating, है ना? You are going to apply that device on the hand. How it is going to assess your blood? It is going to assess only the blood which is pulsating. Which blood will be pulsating, arterial or venous? Arterial blood will be pulsating. Second thing, it will be passing some lights will be there. You have seen this, right? Some light will be passing, and this light will be going to the like you can say hemoglobin, and it is going to come back, right? So it is going to assess the level of hemoglobin, right? And hemoglobin is going to tell us about the level of oxygenation in the patient also, right? So this is how we are going to assess this particular machine. This is based on law of plethysmography and law of Beer-Lambert, right? Now another question, you have got a 40-year-old patient is undergoing some kind of surgery. This patient is under some kind of anesthetic agent, right? कोई ना कोई anesthetic agent लिया है. During his surgery, suddenly his EtCO2 values are alarmingly high. They have reached the value of 100 mm of Hg. Normal value was 45 to 35 to 45. Along with that, there is high temperature of the body, right? What could be the possible reason for this particular scenario except your answer? What is going to be your answer here? This is a patient who is having what? Alarmingly high EtCO2. ये EtCO2 क्या हो गया? ये बहुत ज़्यादा बढ़ गया, double, triple, 4 times it is increasing, right? Very high EtCO2. That means what is happening? More metabolism in the body. EtCO2 ज़्यादा हो गया मतलब मेटाबॉलिज्म क्या हो गया? बॉडी के अंदर बढ़ गया. और ये मेटाबॉलिज्म कब बढ़ता है? After taking any kind of anesthetic agent, there is going to be a disease. What is your diagnosis for that disease? That is going to be malignant. कल पढ़ा था फिजियो में. You have studied this in the physiology. This is known as malignant hyperthermia बच्चे. This is known as malignant hyperthermia. This is known as malignant hyperthermia, where you will be having what? Mutation in RYR or DHPR gene. When you will be having mutation in RYR gene, and this RYR is going to bind with the dihydropyridine receptor. Ryanodine receptor is going to bind with the dihydropyridine receptor, going to increase what? Open what? Sarcoplasmic reticulum, and sarcoplasmic reticulum is the storage house for calcium. And remember, now you know the three function of calcium. In the vessel it is going to cause vasoconstriction, in the muscle it is going to cause muscle contraction, and in the cells it is going to cause what? Exocytosis. So it is going to cause vasoconstriction leading to increase in the BP. Muscle contraction, power of the muscle will be increased. You will be having more metabolism, more contractions, more contraction, more metabolism, and lots of exocytosis will be there. This is also going to be problematic, right? This particular disease is known as malignant hyperthermia. This is the life-threatening condition, right, which is happening because of mutation in which gene? Mutation in ryanodine receptor mutation. And this mutation is going to have what? This mutation is going to be happening because of what? Because of all inhalational agents, beta. All the inhalational agents and succinylcholine. These are the things which are going to cause this. Examiner don't want to ask you about succinylcholine. He want to ask you about accept. This is a very important question, and you remember succinylcholine, you directly mark the answer succinylcholine. You need to read the option carefully, right? You want to know what is not going to be the answer. So halothane is not going to be the answer. Halothane is going to do this, right? Succinylcholine is also going to do this. Isoflurane can also precipitate this. What is not going to precipitate? This is going to be the IV agent propofol, right? I'm going to teach you what are the IV agents. So this IV agent propofol is not going to do this, right? So answer in this case is going to become what? This is going to be answer number C is going to be the answer. Propofol is going to be the answer, right? And what is going to happen in this particular patient? You will be having contraction. So this is emergency anesthetic emergency that we are having. What you need to do, you need to treat this patient, you need to give what? IV sodium dantrolene. What is the drug you will be giving? IV sodium dantrolene you will be giving, right? This is going to be IV sodium dantrolene, right? The next one, we have got a 46-year-old chronic smoker comes to the emergency department with a history of difficulty in breathing and fever for 1 day, right? Which of the following pin index number of cylinder is to be used to connect the face mask in this particular patient? तो आपको क्या करना है? What you need to understand, what is the thing we are having in this particular question? A chronic smoker is coming to the emergency department with the history of difficulty in breathing. So this patient is having what? Shortness of breath, and this is the most common symptom. Lots of patients are coming to you in the hospital, right? You are sitting in the emergency department. Lots of patients are coming to you with this particular thing. Shortness of breath is there, right? It might be due to anxiety also. It might be due to other things also, like heart failure patient also going to have this, ARDS patient, lung patient, pneumonia patient. This is a common symptom which is going to come to you, right? Apart from that, this patient is having what? Fever from last 1 day. Which of the following pin index number of cylinder would you like to use to connect to this particular patient? So this patient is having what? Basically this patient is having some types of hypoxia, right? This patient is having shortness of breath. This patient is having dyspnea, right? And for this dyspnea, what you will be doing, you will be using some kind of oxygen therapy you would like to give to this particular patient. And what is the pin index for oxygen? This is what they want to know. Which cylinder you will like to use over here? The cylinder you will like to use over here is going to be oxygen cylinder, right? And oxygen you would like to give to this patient. What is the pin index for oxygen? My simple question is that, what is the pin index for oxygen? So the pin index for oxygen is going to be your 2 and 5. 2 and 5 is going to be the pin index for oxygen. We will understand how to remember this pin index. How to remember this pin index, we will understand, right? Another question, which color combination is commonly associated with the nitrous oxide cylinder? कौन सा कलर होगा यहाँ पर? नाइट्रस ऑक्साइड सिलेंडर का कलर कैसा होता है? Nitrous oxide cylinder का color कैसा होगा? So let's try to understand these things first. We have got some machines. This machine is known as what? This machine is known as anesthesia machine. Machine का नाम क्या है? Anesthesia machine, right? What is the use of this anesthesia machine? We are going to connect what we have till now. We have understood our patient is lying on the OT itself right now, है ना? ये patient तुम्हारा अभी भी OT के अंदर है. This patient is having what? This patient is you have connected this patient with the endotracheal tube. आपने intubation कर दिया, आपने tubes डाल दी. You have put in the tubes. Now you need to connect your tubes to the anesthesia machine. आपने monitors पढ़ लिए, वहाँ पर कुछ monitor लगे हुए हैं. Now you know about the monitors. What are the mandatory monitor? What are the desired monitors? Now you know about the monitoring, right? Now what you need to do, you need to connect your patient to the machine, right? So anesthesia machine is a device which is going to, or you call it what? Anesthesia workstation, you call it what? Anesthesia circuit machine that we are having, right? So you will be using this machine to decrease the pressure. First thing, you will be having this machine to decrease the pressure of cylinders that we are going to use, है ना? हमने ऑक्सीजन देना है पेशेंट को. अब ऑक्सीजन सिलेंडर का प्रेशर तो बहुत ज़्यादा होता है, 2000 psi, right? If you directly connect your cylinder to the person, what is going to happen? Lungs फट जाएंगे. You will be having more work, right? सारा काम खराब हो जाएगा. पेशेंट को मशीन से डायरेक्ट कनेक्ट कर दिया, पेशेंट को डायरेक्ट सिलेंडर से कनेक्ट कर दिया, मर जाएगा पेशेंट, राइट? सो टू डिक्रीज द प्रेशर ऑफ द सिलेंडर, एंड सेकेंड थिंग, टू मिक्स द गैसेज in known concentration. gases in known concentration, whatever is desired. These are the two function of this machine, this anesthesia machine. Earlier we used to have that Boyle's apparatus, right? Boyle's machine. This is a modification of that Boyle's machine, right? It is very advanced one we are having. It has got three parts. These are the three parts. What are the three parts we are having? We have got high pressure system, we have got intermediate pressure system, we have got low pressure system. We have got high pressure system. I can write it here. So we have got high pressure system, we have got intermediate pressure system, we have got intermediate pressure system, and we have got low pressure system, low pressure system. अब देखो जो सिलेंडर है, फॉर एग्जांपल आई एम टॉकिंग अबाउट ऑक्सीजन सिलेंडर, दिस इज गोइंग टू हैव 2000 psi. So I cannot connect directly 2000 psi to my patient. If I directly connect this oxygen cylinder to my patient, the lungs of my patient will get ruptured. So what I need to do, I need to connect this 2000 psi to anesthesia machine, right? And it will be having three parts: high pressure, intermediate pressure, and low pressure system. So first function is to convert this high pressure into low pressure, which is breathable. तो इस सिलेंडर से ऑक्सीजन को ब्रीदेबल फॉर्म में बनाना, दिस इज द फर्स्ट थिंग दैट दिस मशीन इज गोइंग टू डू. Second thing, it will be doing what? It will be having certain vaporizers also. You can appreciate these are the vaporizers we are having here, yellow color, blue color, these are the vaporizers. So what is going to be there? These anesthetic agents are coming in the market in the form of liquid. ये अगर वेपर के फॉर्म में आते तो कोई भी छिड़क के क्या हो जाता, एनेस्थीसिया लगा लेता, कोई भी छिड़क लेता, राइट? सो दे आर कमिंग इन द फॉर्म ऑफ लिक्विड एंड दे रिक्वायर स्पेशल वेपराइजर्स, है ना? तो ये वेपराइजर के अंदर व्हेन यू आर गोइंग टू पुट हेलोथीन, सिवोफ्लोरिन, तब जाके ये वेपराइज क्या करेगा, ये गैसेस बनाएगा, एंड दिस गैसेस विल बी इनहेल्ड बाय द पर्सन, right? Whatever person we want to give this particular drugs, this patient will be inhaling what? This patient will be inhaling the gases, this patient will be inhaling the gases, right? So to mix the known gases in the known concentration, this is the first function, this is the second function, to decrease the pressure of the cylinder, right? We have got three parts of this anesthesia machine. What are the three parts we have got? We have got high pressure system. अब हाई प्रेशर सिस्टम के अंदर क्या आता है? हाई प्रेशर सिस्टम विल बी हैविंग व्हाट? High pressure system will be having PIS. What is this PIS? This is known as pin index safety system. This is known as pin index safety system. Why we require this safety system? अगर तुम्हारा मन करे तो तुम क्या करो, ऑक्सीजन की जगह आज नाइट्रस ऑक्साइड लगा देते, राइट? तो क्या हो जाएगा, पेशेंट बचेगा क्या ऑक्सीजन की जगह? अगर तुमने किसी को नाइट्रस ऑक्साइड दे दिया या साइक्लोप्रोपेन दे दिया या कुछ और दे दिया, प्रॉब्लम हो जाएगी, राइट? सो वी हैव गॉट दिस पर्टिकुलर फर्स्ट PIS system, pin index safety system. Why we have this system? To prevent the incorrect attachment, to prevent the incorrect attachment of cylinder. This is we are using to prevent the incorrect attachment of cylinder, right? तो इसके लिए हमारे पास में क्या होता है, पिन इंडेक्स सिस्टम होता है, राइट? What is this pin index system? This pin index system will be mnemonic बताता हूँ. What is the thing we are having? You just write down the number 1, 5, 2, 5 and 3, 5. These are going to be the 1, 2 and 3, 5. Remember beta, air is going to be a single thing. A for 1 you can remember. Air will be having pin index of 1, 5. Oxygen will be having two molecules. You can remember O2. O2 will be 2, 5. And this N2O will be 2 plus 1. This is going to be 2 plus 1. This is going to have what? Pin index of 3, 5. Then we have got some CO2. C is looking like 6. Can I make a 6 out of C? Yes, it is looking like 6. So we can make 1, 6. We can make CO2 if it is a more concentration. This is going to be what? 2, 6. And then we have got what? Then we have got C for cyclopropane. Cyclopropane is going to have what number? This is going to be 3, 6. This is going to be 3, 6. Cyclopropane, this is also starting with the C. तो इस C वालों में तीनों में 6 कर देना. This is going to be 6. And then you can write 1, 2 and 3 based on the concentration of the carbon dioxide. It can be 1, 6, it can be 2, 6, it can be 3, 6. And then lastly we have got the pin index of Antonox. What is Antonox? Antonox is nothing. It is a combination of N2O and oxygen. It is a combination of N2O and oxygen. This is going to be Antonox, right? This is going to be Antonox. And what is the pin index? You can simply remember 1, 2, 3, 4, 5, 6, 7. So 7 is going to be the pin index for this particular one, right? This pin index question, we are not going to make it wrong, right? A simple question है, बड़ा ही आसान है, इसको हम आसानी से कर लेंगे. This is going to be the pin index thing we are having, right? Then we have got this particular one, Santri color. Then we have got the color of the cylinder. Let's try to understand the color of the cylinder, right? So what are the color of the cylinder? We have got air. Air will be having black body and black and white shoulders will be there. This is going to be the air cylinder that we are having. Black and white shoulders will be there. This is going to be what? Black body, white shoulder. This is going to be what? Black body, white shoulder is going to be what? This is going to be oxygen. This is going to be oxygen, right? Black body, white shoulder is going to be oxygen. Nitrous oxide will be, this is your question, this is going to be the blue cylinder, blue cylinder. Carbon dioxide, bina kaam ki, that is going to be gray color cylinder. Cyclopropane is going to be orange cylinder. Cyclopropane is like citrus, right? Citrus is going to be orange in color. Cyclopropane, C4C, citrus is going to be orange in color, right? And Antonox is a combination of N2O and oxygen. So it will be having what? N2O is going to be blue body and oxygen is going to be blue and white shoulders will be there. So blue and white quarters with blue body. This is going to be what? This is going to be Antonox. These are the color of the cylinder. You need to remember the color of the cylinder and pin index of the cylinder. Very, very simple. Pin index. Air is going to be first 5. Oxygen is going to be 2, 5. N2O is going to be 3, 5. CO2 1, 6, 2, 6, 3, 6 and 7. These are going to be the color, right? So what is this particular thing? You can appreciate this particular thing. This is known as pin index system. This is known as pin index system. Okay, this is going to be what? This is which cylinder we are having? This is going to be N2O. This is going to be 3, 5. This is going to be having 3, 5. You cannot attach another cylinder over here, right? This is your cyclopropane that we have got, which is going to be 3, 6, right? These are your normal cylinders that we are having, blue cylinder and black and white cylinder that we are having, right? So this all things are going to come under the high pressure system. तो हाई प्रेशर सिस्टम में मशीन के अंदर क्या जुड़ेगा बेटा? दिस इज गोइंग टू बी हाई प्रेशर सिस्टम में हमारे पास में मशीन के अंदर जुड़ेंगे सिलेंडर्स. मतलब क्या है, फंक्शन क्या है इस मशीन का? फर्स्ट फंक्शन इज टू डिक्रीज द प्रेशर, सेकेंड फंक्शन इज टू mix the gases in the known concentration. Simple funda. Then we have got intermediate pressure system. This intermediate pressure system will be having pressure somewhat around. यहाँ पर pressure कितना था? यहाँ पर pressure बहुत ज़्यादा था. अगर if I talk about normal oxygen cylinder, this is going to be 2000 psi. Normal oxygen cylinder is going to be what? 2000 psi, right? So this is going to be high pressure over there. In intermediate pressure system, you will be having pressure somewhat around 55 to 60 psi only. 55 to 60 psi only. And here also you will be finding one more system. This is known as DIS. This is known as DIS. What is this? Diameter index safety system. This is known as diameter index safety system. This is known as diameter index safety system. यहाँ पर क्या याद रखना है? You will be finding a emergency oxygen flush. Here you will be having emergency oxygen flush, which is responsible for release of 35 to 70 liter of oxygen at 55 to 60 psi. At 55 to 60 psi कितना ऑक्सीजन बाहर आएगा? This is going to be 35 to 70 liter of oxygen, right? Flow valve control will be there. Flow control valve will be there, right? These are going to be your color coded valves, and this is going to be the DIS system. What is this DIS system? Diameter index safety system. You cannot plug this blue color wire. You went to hospital area or hospital, you will be finding what? These color pipelines will be there. You see on the above, you will find some pipelines, right? In pipelines, which is the gases which are running. Now you can understand this white pipeline will be having which gas? White pipeline will be having which gas? White is going to be important, right beta? White is going to be important. This is going to be oxygen is going to be in the white pipeline. Vacuum V is looking like Y. Can I make a Y out of V? Yes. So vacuum will be in the yellow pipeline. Vacuum will be in the yellow pipeline. Yellow pipeline in the vacuum. Air is going to be not utilizable here. This is going to be in the black pipeline. Air is going to be on the black pipeline. And nitrous oxide N2O. And for Neela, this is going to be blue. Blue is going to be what? Nitrous oxide will be in the blue pipeline. So now you already know about these two things. White is going to be air, blue is going to be what, nitrous oxide. This black one we are going to have what, air, black one we are going to have what, air, and lastly we have got yellow. Yellow is going to be what, yellow is going to be vacuum. Yellow is going to be vacuum, right? So these are going to be diameter index safety system. You cannot plug another wire. It's like C type charger, B type charger है ना, तो आप दूसरा चार्जर दूसरे फोन में नहीं लगा सकते. दिस इज व्हाट इज द थिंग. अदरवाइज व्हाट वी कैन डू व्हाट, यहाँ पर इसको पेशेंट को जा तो रही, जाते जाते इसको थोड़ा नाइट्रस ऑक्साइड दे दो ऑक्सीजन की जगह, राइट. सो दिस इज व्हाट पीपल कैन डू, राइट. तो इसीलिए हमारे पास में क्या है, डायमीटर इंडेक्स सेफ्टी सिस्टम है. व्हाट इज द थिंग वी आर हैविंग बच्चे इन द लो प्रेशर सिस्टम. इसके अंदर क्या आएगा, इसके अंदर आएगा फ्लो मीटर. आपसे क्वेश्चन कहाँ से पूछा जाता है, फ्लो कंट्रोल वॉल्व इज अ पार्ट ऑफ, फ्लो कंट्रोल वॉल्व इज अ पार्ट ऑफ intermediate pressure system. Flow meter is a part of, flow meter is a part of, okay, flow meter is a part of low pressure system. It is a part of low pressure system we are having, right. So we have got certain vaporizers. What are the vaporizers we are having? So this yellow color vaporizer, you can understand yellow क्या होता है, सूरज. Yellow is going to be sun. So you can remember sun is going to be yellow, and this sun is going to have what, sevoflurane. This is going to be the vaporizer of sevoflurane. This is going to be the vaporizer for sevoflurane. This purple one is going to be for what, this is for the isoflurane. These are the drugs we are having, है ना. लाल वाला, रेड वाला is going to be important one, halothane. This is going to be dangerous one, important one. This is going to be halothane, रेड वाला halothane. And this blue वाला, can you appreciate this blue वाला अलग सा लग रहा है, ये तीनों तो फिर भी एक जैसे सर. This one is appearing different, right. This one is appearing different, right. So this is a desflurane. This is the vaporizer for desflurane बेटा, desflurane. वेपराइजर का फंक्शन क्या होता है, लिक्विड जो भी आपने इसके अंदर एनेस्थेटिक एजेंट डाला है उनको ये वेपर के अंदर कन्वर्ट करेगा. इट इज गोइंग टू कन्वर्ट द liquid things that you are putting, liquid anesthetic agent, they will be converted into vapor, and now machine will be putting this vapor. मशीन का फंक्शन क्या होता है, एनेस्थीसिया मशीन इस वेपर को और ऑक्सीजन और सारी गैसेस को साथ में मिला के क्या करेगी, पेशेंट को डिलीवर कर देगी. दिस इज व्हाट इज गोइंग टू बी द basic funda. Remember, all these vaporizers are normal vaporizers and these are the inhalational agents that we are having. यही वो दवाइयाँ हैं जो हम यूज़ में लेते हैं किसी को बेहोश करने के लिए. These are your sevoflurane, these are your isoflurane, halothane and desflurane. And this desflurane beta, this desflurane is going to be stored in a very special vaporizer. This is known as Tech 6 vaporizer. This is your previous year question. This is going to be utilizing what, Tech 6 vaporizers. कौन से vaporizer है ये, Tech 6 vaporizer, a special vaporizer for desflurane. Okay, so blue one is going to be what, desflurane, red one is going to be halothane, purple is going to be what, purple is going to be isoflurane, and yellow is going to be what, yellow is going to be sevoflurane. This is what you need to remember about the low pressure system. So we have got high pressure system, low pressure system, intermediate pressure system. Okay, just try to answer this question. Blue pipeline supply carry which gases? Blue pipeline supply carry which gases beta? Your answer in this case will be this is going to supply which gases? This is going to supply nitrous oxide. Very good. This is going to supply the nitrous oxide. Blue is for the nitrous oxide. For oxygen you are going to have white color. For air you are going to have black color. And for vacuum you are going to have yellow color, right. So these are going to be the pipeline and these are going to be the anesthesia machine. Now anesthesia machine का फंक्शन समझ में आ गया. इसका फंक्शन क्या होता है, इसका फंक्शन होता है सिलेंडर के प्रेशर को कम करना और गैसेस को मिक्स करना इन द नोन कंसंट्रेशन, राइट. अब एनेस्थीसिया मशीन है, पेशेंट है, इंट्यूबेटेड पेशेंट है, दोनों को कनेक्ट कैसे करोगे? For connections you require some kind of circuits, right. You require some kind of circuits. How many types of circuits we do have? We have open circuit, we have semi-closed circuit. Semi-closed in turn is going to be what, two types, open semi-closed, closed semi-closed, right. So this is going to be the thing. And then we have got what, closed circuits, right. So we have got open circuit, we have got semi-closed, we have got closed circuit. Open circuit, like we are using chloroforms, we are using chloroform, or we were using ether, है ना. कपड़ा डाला, कपड़े के ऊपर दवाई डाला, धीरे धीरे दवाई डाला, what is going to happen? This is going to be a open circuit. Semi closed are going to be your semi closed, the one you need to remember are going to be your Mapleson circuit. Mapleson circuit. And closed you will be having, closed will be having circle system. Circle system will be there, and they are non-portable beta. They are non-portable, and they are costly also. Whereas this Mapleson circuit, what is the benefit? The benefit, they are portable. हम इनको लेके घूम सकते हैं. They are portable, and these are going to be what? These are going to be cheap as compared to the closed one. They are going to be cheap as compared to the closed one, right? So we need to learn about the semi-closed circuit, right? Semi-closed or also known as Mapleson circuit. कितने Mapleson circuit हमने पढ़ने? हमने पढ़ने 6 Mapleson circuit. What are those 6 Mapleson circuits? We have got A, B, C, D, E. We have got A, B, C, D, E, right? So Mapleson A is going to be what? A से याद रखो, the way I'm teaching you, just remember like that, it will be easy for you. So A is going to be alone. A वाला हमेशा अकेला रहेगा. अकेला रहेगा तो क्या करेगा? मैगी बना के खाएगा. अकेला रहेगा तो खुद से मैगी बनाएगा. स्पॉन्टेनियस मतलब खुद से. So A is going to be spontaneous. For a spontaneous ventilation, spontaneous and controlled ventilation are two types of ventilation बेटा. Spontaneous में पेशेंट खुद से सांस ले रहा है, तो हम लोगों को मशीन से कनेक्ट तो कर देंगे, बट पेशेंट खुद से सांस लेगा. दिस इज नॉन एज स्पॉन्टेनियस वेंटिलेशन. व्हाट इज कंट्रोल्ड वेंटिलेशन? यानी अब हम सेट कर रहे हैं, वी आर सेटिंग द टेम्पो, वी आर सेटिंग एवरीथिंग, टाइडल वॉल्यूम हम लोग सेट कर रहे हैं. दिस इज नॉन एज व्हाट वेंटिलेशन? दिस इज नॉन एज कंट्रोल्ड वेंटिलेशन, है ना. So we have got A circuit. A circuit is alone circuit. It is going to be spontaneous ventilation. और अकेला आदमी क्या करेगा? मैगी बना के खाएगा. This is how you can remember. This is also known as McGill circuit. Okay, this is also known as McGill circuit. Then we have done the modification of this McGill circuit. This modification of this A circuit is known as modified Mapleson A, and this is also known as, what is another name for this circuit? This is also known as लेक्स सर्किट. लेक्स सर्किट ऑल्सो नोन एज कोएक्सियल मेपल्सन सर्किट. इसका दूसरा नाम क्या है बेटा? कोएक्सियल मेपल्सन सर्किट. दिस इज गोइंग टू बी द मेपल्सन सर्किट ए दैट वी आर हैविंग, है ना. इसी को बोलते हैं मेपल्सन सर्किट. अभी बताता हूँ, राइट. देन वी हैव गॉट बी एंड सी आर ऑफ नॉट मच यूज, सो वी आर नॉट गोइंग टू लर्न अबाउट देम, राइट. देन वी नीड टू रिमेंबर अबाउट मेपल्सन डी. मेपल्सन डी इज गोइंग टू बी डिपेंडेंट बेटा. ए वाला अलोन था, डी वाला डिपेंडेंट होगा, है ना. Dependent, this is going to be the dependent circuit, and this is going to be used for controlled ventilation. Controlled ventilation के लिए हम लोग इसको काम में लेंगे, and this is going to be this is going to be dependent, so this is going to be utilizing what? This is also known as Bain circuit. Bain circuit, इसका modification को क्या बोलते हैं? The modification of this particular thing is known as Bain circuit, and this circuit you will be utilizing each every day. This is going to be the Bain circuit, most commonly used circuit in the adult patient. This is your Bain circuit. How you will understand, how you will differentiate between Bain circuit and McGill circuit? This is going to be the differentiator, right? Remember, here you are finding two tubes. Here you are finding two. यहाँ पर कितनी ट्यूब्स मिलेंगी आपको? 2 ट्यूब्स मिलेंगी. Okay, this is Mapleson D. This is also utilized for the controlled ventilation. This can be also utilized for the spontaneous ventilation. तो ये दोनों में काम में आ जाता है ना. ये दोनों में काम में आ जाता है, spontaneous ventilation और controlled ventilation में. So this is also known as universal circuit, and this is what we are using every now and then, right? So this is also known as universal circuit. This is your Bain circuit that you will be finding in your hospitals, right? So दोनों मिल सकते हैं, but this is the most commonly used circuit that we are using, right? This is a Bain, this is your Bain circuit, also known as coaxial Mapleson D circuit. उसके बाद में आया Mapleson E. Mapleson E was a useless, bagless, valveless. Mapleson E was useless circuit. It was bagless circuit. It was valveless circuit. This is going to be your Mapleson E. इसके अंदर ना तो बैग था. दिस इज गोइंग टू बी बैगलेस, वॉल्वलेस, राइट. सो दिस इज गोइंग टू बी यूजलेस सर्किट. तो हमने क्या किया? इसका मॉडिफिकेशन किया. हु हैज डन द मॉडिफिकेशन? जैक्सन एंड रीव्स मॉडिफिकेशन. ओके, JRM. दिस इज गोइंग टू बी JRM, जैक्सन रीव्स मॉडिफिकेशन ऑफ आयर्स टी पीस. इसका नाम था आयर्स टी पीस. ओके, इसका मॉडिफिकेशन किया जैक्सन एंड रीव्स से. and this is what is known as JRM circuit that we are having, and this JRM circuit is going to be the circuit of choice in pediatrics. Okay, it is going to be the circuit of choice in pediatrics. Choice in pediatric patient, be it your spontaneous ventilation हो या फिर controlled ventilation हो, दोनों में कौन सा यूज में लेंगे? यू कैन यूज व्हाट? दिस पर्टिकुलर सर्किट. दिस इज गोइंग टू बी जैक्सन रीज मॉडिफिकेशन ऑफ आयर्स टीपीस, है ना. यहाँ तक तो वो लोग पहले क्वेश्चन पूछ ही रहे थे, but right now they've started asking question on the identification of this diagram also, right? So what you need to understand, which is they will give you just diagram and then you need to identify, is it Mapleson A, is it Mapleson B, is it going to be Mapleson C or D, right? So just remember this patient, this is the patient end, this is going to be the patient end, and just remember this APL valve, right? ये APL valve और patient को याद रख लो. This is going to be adjustable pressure valves that we are having. इसको हम घुमा सकते हैं, we can adjust it, we can increase the pressure, we can decrease the pressure also, है ना. यहाँ से fresh gas अंदर जाएगी. This is going to be fresh gas flow inlet. This is going to be the pump that we are having, है ना. इसको हम लोग press कर सकते हैं, right? This is going to be APL valve. ये ऐसे ढक्कन जैसा होता है घुमाने का. You can turn it, you can increase the pressure, you can decrease the pressure. This is going to be patient end. ओके, अब कैसे याद करना है? द निमोनिक इज गोइंग टू बी एडजंक्ट. फर्स्ट रिमेंबर एडजंक्ट, राइट. अगर ये दोनों एक साथ है, अगर ये दोनों एक साथ है, पेशेंट एंड दिस APL valve दे आर टुगेदर, दिस इज नोन एज एडजंक्ट. इसको बोलेंगे मेपल्सन ए एडजंक्ट, राइट. दिस इज गोइंग टू बी एडजंक्ट. दूसरा देखो, अगर APL valve और ये फ्रेश गैस फ्लो और ये पेशेंट एंड तीनों साथ में, दिस इज गोइंग टू बी व्हाट? दिस इज गोइंग टू बी नोन एज both. If both the things are together, this is known as Mapleson B. B से याद रखो, both fresh gas flow and APL valve, both of them are together, this particular thing, this is known as what? Both Mapleson B. Mapleson C में क्या होगा? C for absence of corrugation. ये जो corrugation है, ये जो लाइनें बनी हुई है, ये सब में होंगी, किस में नहीं होंगी? C में नहीं होंगी. So C will be having absence of corrugations will be there. Absence of corrugations will be there बच्चा, है ना. C के अंदर corrugations नहीं होंगे. D के अंदर क्या होगा? D के अंदर दूर होगा. D for distant, D for दूर, D for distance. This fresh gas flow will be here, this patient will be here, this APL is going to be away from the patient end, right? patient से दूर होगा, this is going to be distant. and E वाले में क्या होगा? this is going to have what? this is going to be valveless. यहाँ पर तो ये valve ही नहीं मिलेगा, बैग ही नहीं मिलेगा. this is going to be bagless. ये तो आराम से पहचान जाओगे, bagless. And lastly we have got F. This is going to be what? This is going to be Mapleson F. यहाँ पर क्या होगा? ये valveless होगा. This is going to be valveless. Can you appreciate the valve? No, you cannot appreciate the valve. This is going to be a valveless circuit, है ना. आसान, right? So we have got adjunct. अगर ये दोनों चीजें पास में, अगर ये fresh APL is near the patient end, this is going to be adjunct. APL fresh gas flow, both of them are together, this is going to be both. C will be having absence of corrugations. D will be having this valve will be distant. E में क्या होगा? There will be no valve, there will be no bag, right? And lastly F is going to have what? No valve will be there and bag will be there. This is going to be Mapleson circuits, right? These are the semi-closed circuits that we are having. Now you need to answer my questions. A 5-year-old child is spontaneously breathing, right, and is undergoing minor elective surgical procedures. Which of the following circuit can be the circuit of choice here? Your answer. The answer in this case will be what? Just try to understand. A 5-year-old child. यहीं से क्वेश्चन हो जाता है. Everything will be wrong, everything will be wrong. The answer will be Jackson's Rees. Jackson Rees, because we are talking about what patient? We are talking about a pediatric patient, right? A 9-year-old patient is presented to surgical emergency with acute abdomen and was posted for emergency surgeries. The anesthetist decided to give him general anesthesia. Which of the Mapleson circuit would be best for spontaneous ventilation in adult patient? Simple understanding. You need to look for this particular word. If you find this word, your answer will be what? अकेले में क्या दोगे? Mapleson A दोगे. This is going to be the Mapleson A. The next we have got a 4-year child came to the emergency. Option, no need to read the question. 4-year-old child, right? And they are asking about the ideal anesthetic circuit. These two terms you can remember. 4-year-old child, ideal anesthetic circuit. Anytime you find circuit in the baby, this is going to be what? This is going to be जैक्सन रीज सर्किट है ना, बाकी पढ़ने की ज़रूरत ही नहीं है. बीट योर स्पॉन्टेनियस वेंटिलेशन, ये सब कंफ्यूज करने की कोशिश करेंगे आपको. स्पॉन्टेनियस, कंट्रोल्ड वेंटिलेशन, फ्रेश गैस फ्लो दे देंगे, मिनट वेंटिलेशन दे देंगे. नो नीड टू वरी अबाउट दैट. Just look at the age of the patient. It is very important for the child one, right? This is going to be the thing. Another question: a 25-year-old patient was posted for exploratory laparotomy due to an abdominal injury. An anesthetist decided to give him controlled anesthesia. Now, controlled anesthesia, which of the following circuit is going to be most effective for controlled ventilation? Control के लिए क्या हो जाएगा बेटा आंसर? कंट्रोल के लिए मिपल्सन डी, ऑल्सो नोन एज बेन सर्किट. दिस इज ऑल्सो द यूनिवर्सल सर्किट, है ना, यही पढ़ा है हम लोगों ने, राइट? व्हाट इज दिस पर्टिकुलर सर्किट? दिस इज योर क्वेश्चन. द पेशेंट इज presented for radical hysterectomy under general anesthesia. The anesthetist attaches this patient to the following breathing system. What is the name of this breathing system that is shown below? Is it your Humphrey, Lack, Ban, or McGill? Yes, this is going to be your definitely Bain circuit. You can appreciate two pipes. Two pipes are there, right? There are going to be two pipes. Okay, this is for the humidification of the gases, right? This is for the temperature maintenance also. We have kept these two pipes and they are very good for us, right? So now we are done with the connection of the patient. What we have learned till now, let me just summarize. A patient has came to us for some kind of surgery, right? Patient has came to us for some kind of surgery, that is your cholelithiasis, right? We have sent our patient to anesthesia department for the PAC. After PAC, this patient has advised something. We have given the drugs to this patient. We have done the anesthetic scoring of this particular patient. All these things we have done. Now we have called our patient for the surgery, and this patient is coming to the surgery. We have given the pre-anesthetic medication to the patient. We have done what? We have done our intubation in the patient. Right after intubation, we have connected our patient. We have done the laryngoscopy, all the endotracheal tube, everything. Patient is lying on the bed right now. Okay, we are waiting for the surgeon. But before waiting for the surgeon, we need to do what? Anesthesia. We need to give anesthesia to this patient. And to give anesthesia, we need to connect this patient to what? We need to connect this patient to anesthesia machine, right? What is the anesthesia machine we are having? It is going to connect what? Cylinders, high pressure, intermediate pressure, low pressure will be there, right? And when we are going to connect our anesthesia machine, intubated patient is also there. We require what? For the connection, we require what? We require circuit, right? This is the circuit which is going to help you in the connections of the patient. Okay, connection of the patient with the machine. Now the patient is connected to the machine. Now you can start your anesthesia, right? Now you can start your anesthesia from the machine, and now you can sedate your patient. But before starting anesthesia, you should know what kind of drugs we are having in the anesthesiology. What are the drugs we are using? We can give multiple drugs, right? You will be inducing your patient. Now you will be doing what? Now you will be doing induction in this particular patient. This patient is lying down. He has seen all the monitors, all the pipelines he has seen in the OT room, right? He has seen there are white pipelines, yellow pipelines, there are some monitor, 5 mandatory monitor. You have applied what? This monitoring, Swan-Ganj catheter, everything you have done, right? Now it is time to give the induction of the patient. Now it is the time to give the drugs to the patient. You will be inducing the patient, then you will be maintaining the patient. आप उसको इंड्यूस करोगे, फिर आप उसको मेंटेन करोगे, फिर आप उसको रिवर्स करोगे, राइट? these are the steps of anesthesia. आप उसको इंड्यूस करो, मेंटेन करो और रिवर्स करो. मेंटेनेंस till the time you will be having the surgery, and then you will be doing what? Then you will be doing what? Reversal of this particular patient, right? So let's begin with the induction. Before induction, let's try to understand what are the anesthetic agents that we are having, what are the drugs we are having, so that we can make our patient unconscious, right? So we have got general anesthesia, regional anesthesia, local anesthesia. This is what we have already seen. Now we will discuss about the drugs utilized in the general anesthesia, drugs utilized in the regional anesthesia, drugs utilized in the local anesthesia also, right? So in general anesthesia, beta, we are going to use what? Inhalational agents. We are going to use what? IV agents. So what are the inhalational agents we are having? We are having what? Halothane. We have what? Isoflurane. We have got sevoflurane. We have got we have got desflurane. We have also got methoxyflurane. We have also got enflurane, right? these are your fluoride compounds, है ना, इनमें सब में फ्लोरीन फ्लोरीन आ रहा है, these are your fluorine compounds. So we have got inhalational agents. These are the agents which we are going to inhale, we are going to give to our patient for inhalational purpose, right? Then we have got IV agents. These are going to be your opioids and non-opioids. IV agents can be opioids, they can be non-opioids, right? IV agents can be opioids, they can be non-opioids. So what are the opioids we are having? What are the opioids you can use? This is going to be your morphine. We can use fentanyl. We can use remifentanil. We can use sufentanil, alfentanil, remifentanil. So these are going to be the compounds we can use as a opioid. Then apart from opioid, we have got what? Non-opioids also. We have got non-opioids also. What are the non-opioids that you know? These are going to be your propofol. These are going to be your etomidate. We have got thiopentone, barbiturate, right? We have got thiopentone. We have got ketamine. We have got propofol, etomidate, thiopentone, and ketamine. For local anesthetic uses, we will be using two group of drugs. One is going to be amide, bacha. Another one is going to be esters. One is going to be amide, another one is going to be the esters, right? What are the amides that you know? Amides are going to be drugs like lignocaine, xylocaine, bupivacaine. याद रखना अमाइड के अंदर बेटा आई आता है, अमाइड विल बी हैविंग आई, सो दे विल बी हैविंग डबल आई इन द नेम, whereas esters are going to be like cocaine, single I things will be there, like we have cocaine, we have got procaine, we have got benzocaine, right? So these are going to be what? These are going to be esters. Okay, amide में क्या आएगा? Amide में lignocaine, you will be having what? Bupivacaine, you will be having dibucaine, right? These are going to be what? Amide. These are going to be what? Esters, and these are utilized for the regional anesthesia as well as your local anesthetic effect also, right? For example, I want to remove the tooth extraction, right? What I would be doing, I would be applying what? Xylocaine or lignocaine around this particular area, right? For the infiltration anesthesia, right? This is what I've told you. देखो क्या पढ़ाया था? जनरल एनेस्थीसिया कंप्लीट बॉडी एनेस्थेटाइज कर देगा, इनहेलेशनल और आईवी. Regional में complete region, if you want to give the drugs on the central part, this is going to be central neuraxial blockade. You can give what? Sciatic block, you can give what? Not sciatic, you can give what? Spinal anesthesia, you can give what? Epidural anesthesia, right? You can give what? Caudal anesthesia. This is going to be central neuraxial blockade. Peripheral में you can give sciatic block, you can give femoral block, you can give brachial block. In local, we have discussed about the topical, like appliance of something. For example, I want to cannulate, I can apply something here. This is going to be eutectic mixture of local anesthetic amla we are having, and a eutectic mixture of amla that you can apply, right? Next thing, we have got infiltration anesthesia, where you will be using the drugs will be same. These are the drugs you will be using, right? These are the drugs you will be using. You will be using these drugs and you will be applying this thing around the lesion, right? Then we have got muscle relaxants. These muscle relaxants can be depolarizing muscle relaxant. This can be non-depolarizing muscle relaxant. Depolarizing means muscle has a quality, it requires specific stimulus. If you give more stimulus, it will not work. So these are going to be your drugs like acetylcholine is responsible. So the drugs like succinylcholine is going to be the muscle relaxant we are having. Then we have got what? Drugs like curonium and curare. Group of drugs. These are the drugs which are going to do what? These are the drugs which are going to be muscle relaxant. तो इनको क्या करते थे? एरो के आगे लगाया and we just shoot it on the animals that we are having. So what is going to happen? The animal will be having muscle relaxation properties. Second thing, it is going to release what? Histamine, and this histamine has got two functions: vasodilatation, bronchoconstriction. So this animal cannot run, first thing. Second thing, he will be having what? Bronchoconstriction, leading to death of this particular animal, right? That is what we were using in the earlier time, right, to kill those animals, right? So now let's begin with the inhalational agents first. The first inhalational agent that we have got, right? I'm starting it off from the point here, right? The first inhalational agent, first we will discuss about the general anesthesia. Here we will discuss about the inhalational agent. So the first one that we have got is the halothane. What are the important points about halothane? Remember, this halothane is contraindicated in what? In the hepatic surgeries, in the neurosurgeries, because it has a risk for causing what? Autoimmune hepatitis. It can cause what? Autoimmune hepatitis करा सकता है. H4 halothane is associated with autoimmune hepatitis, right? What is the color of the vaporizer? This is going to be red. मैंने बोला था खतरा, right? This is going to be red in color. Second thing, in neurosurgery, why we are not doing neurosurgery? Because it can increase ICP और intracranial tension को बढ़ा देगा. Intracranial pressure और tension को बढ़ा देगा, leading to what? Problems during neurosurgery, right? In respiratory surgeries, can you use this? Yes, it is the agent of choice because it is a very good bronchodilator. It is a very good bronchodilator. So this is going to be the agent of choice in the cases of what? In the cases of respiratory surgery, we can use this. Then iso, hello के बाद में iso, hello, iso, Civodis, same sequence we are going to discuss. ISO is going to show you, it is going to be a irritant, it is going to show you coronary steal phenomena. Which phenomena? Coronary steal phenomena or reverse Robin Hood phenomena, right? Next thing is going to be sevoflurane. Sevoflurane is going to be a nephrotoxic compound, right? It is going to make a nephrotoxic compound A. So we are going to avoid this particular thing in the cases of kidney problems, right? If someone is having kidney problems, we are going to avoid what? Sevoflurane. We are going to avoid what? Sevoflurane, because sevo is going to make some nephrotoxic compound. Sweet smell will be there. It is going to be agent of choice in the children's. It is a good bronchodilator. So agent of choice in the cases of children, है ना. हम चिल्ड्रन में इंजेक्शन लगाते ही नहीं है, हम लोग क्या करते हैं? सीवोफ्लोरिन लगाया, वो ऑटोमेटिकली इट इज गोइंग टू हैव sweet smell, so this patient will undergo anesthesia, right? So it is the agent of choice in children. Second thing, it is going to cause treatment modality in the cases of asthma also. So we can use in the patient who is already having asthma, हम उसको pungent कुछ भी नहीं देंगे, right? So in the asthma patient, it is going to cause what? Bronchodilation. Lastly, we have got is the desflurane. This desflurane is going to be what? It is going to be irritant. It is going to be irritant. It is going to be used in the obese patient. इसका ये बॉडी में अच्छी तरीके से घुल मिल जाएगा, right? So this is going to be used in the cases of obese patient. It is the agent of maintenance agent of choice. This is going to be the maintenance agent of choice. Whereas the sevo is going to be the induction agent of choice, as well as we can use it for the maintenance also. But this desflurane, we have got this desflurane is the maintenance agent of choice. We don't get desflurane very commonly. We don't use desflurane very commonly. थोड़ा costly होता है, मिलता नहीं है, ठीक है. The next thing we have got is what is the preferred method for inducing anesthesia through inhalational in children. These are your previous year questions. Solve along with me the previous year questions that you are having. Then your answer will be what? Yeah, this is going to be what? Sevoflurane. Sevoflurane will be having what? Sweet smell will be there. Sweet smell will be there. It is the agent of choice in this particular cases, right? In children also, it is going to be the agent of choice, right? The next one we have got, which of the following options listed below can be utilized for the purpose of inducing anesthesia, sustaining it, and safely performing endotracheal intubation? So what can be used for endotracheal intubation? What can be used for sustaining and inducing the anesthesia? Yes, this is again going to be what? Sevoflurane. Sevoflurane. Halothane we can also use, but halothane is generally not so good for us, right? So now the best in the options we have got is sevoflurane, which is going to be induction, which is going to be good for induction, which is going to be good for maintenance also, right? Which of the following options is not options below is not employed for initiating anesthesia in pediatric patient? Pediatric patient में किससे anesthesia नहीं करेंगे? Remember, this desflurane is going to be a irritant beta. It is going to be irritant. It will be having what? It will be having pungent smell. It will be having pungent smell, right? It is a irritant, right? So pediatric patient, we can give halothane. It will be having good smell. It is a bronchodilator also, right? Sevoflurane, you already know about it. This is a good smell bronchodilator. It is going to be good, sweet smell will be there. What about nitrous oxide? Is also going to have good smell, but we need to give other gases also with that. This alone cannot be sufficient for anesthesia, but yes, we can use it. Which one we cannot use is going to be what? Desflurane. This is going to be desflurane, right? Which anesthesia agent from the options provided is known to cause toxicity of the liver? These are your previous year questions. ऐसे क्वेश्चन पूछे गए हैं, right? अभी पढ़ा है तो आसान लग रहा है, but when you solve this question without reading, it's going to become what? It is going to become what? It is going to become what? Just a minute. All right. The next one we have got is IV anesthetic agent beta. Next one we have got is IV anesthetic agent. That's इसका answer. The last one, toxicity of liver is seen with what? Halothane. H for halothane, it is going to be hepatotoxic. It is going to cause what? Autoimmune hepatitis. It is going to cause what? Autoimmune hepatitis, right? The next agent we are going to see is the IV agents. तो हम लोगों ने क्या पढ़ लिया? हम लोगों ने पढ़ लिया haloisoCODES. These are the inhalational agents. Now we are going to discuss about the IV inhalational agent. General anesthesia मतलब पूरी body anesthetized हो गई, right? So now we are going to discuss about the IV agents. We have got two classes in the IV agents. We have got opioids. We have got non-opioids, है ना? तो opioids में morphine, fentanyl, remifentanil, sufentanil, L-fentanyl पढ़ेंगे. नॉन ओपियोइड में प्रोपोफोल, इटोमिडेट, थायोपेंटोन, कीटामीन पढ़ेंगे. सो लेट्स बिगिन विद द IV agents. So we have got two types of IV agents. We have got opioids. These are going to be your morphine, fentanyl, remifentanil, fentanyl. These are utilized for what purpose? They are utilized for the analgesia purpose. ये IV anesthetic agent है, तो क्या ये complete body को anesthetize कर देंगे? Yes, they can also cause what? Complete body anesthesia. But what are the one we are going to use? These are going to be the opioid one. This we are going to use for the analgesia purpose, है ना? कौन से purpose के लिए use में लेंगे? That is important for the analgesia. Analgesia मतलब they are going to be utilized generally for the pain killing property. ठीक है? They are going to be CVS stable. Remember, very important statement about this particular one. They will be asking you which of the following. They will be giving you some condition. How they are going to ask you question? कोई भी condition दे देंगे CVS, right? And then they will be asking you which of the following drug can be utilized. One of them is going to be from this particular one, right? The only two things you have to remember about the side effect of this anesthesia, this opioids. One side effect you need to always remember is going to be respiratory depression. Second side effect you always need to remember is going to be constipation. In fact, we use some drugs like loperamide is what? They are the drugs which are going to be what? These are opioid derivatives. So always remember, opioid is going to do what? मॉर्फिन अगर कोई बंदा खा रहा है उसको क्या होगा? दो दिक्कतें होंगी, रेस्पिरेटरी डिप्रेशन एंड कॉन्स्टिपेशन. सीवियर respiratory depression can also happen. Constipation is also going to happen. This is going to be what? This is going to be a patient of opioid poisoning. Opioid poisoning ले लो, opioid toxicity ले लो, opioid overdose ले लो. Same thing will be having the same funda. But remember, they are going to be what? They are going to be cardiovascular stable. So these are the drugs which are going to be CVS stable, but they are respiratory depressant. नॉन ओपियोइड में हम लोग क्या पढ़ेंगे? थायोपेंटोन, प्रोपोफोल, इटोमिडेट और कीटामीन. ये सारी चीजें पढ़ेंगे. लेट्स बिगिन विद द फर्स्ट वन इन द लिस्ट दैट वी हैव गॉट. दिस इज गोइंग टू बी नथिंग बट योर barbiturate. This is going to be what? This is going to be thiopentone बच्चे. This is going to be thiopentone. Then we have got propofol. Then we have got etomidate. Then we have got ketamine. Then we have got what? Ketamine. सो थायोपेंटोन के बारे में क्या चीज़ याद रखनी है? इट इज ऑल्सो कंसिडर्ड एज द थायोपेंटोन एंड स्कोपोलामीन आर कंसिडर्ड एज द ट्रूथ सीरम। आपने मूवीज में देखा होगा, जैसे ही आप इसका इंजेक्शन लगाते हो पेशेंट का कॉग्निशन डाउन हो जाता है। अगर पेशेंट का कॉग्निशन डाउन हो जाएगा तो क्या पेशेंट से कुछ भी पूछ सकते हो? यस, यू कैन आस्क एनीथिंग टू द पेशेंट, ही विल बी आंसरिंग यू एवरीथिंग। दैट इज व्हाई इट इज नोन एज द ट्रूथ सीरम, है ना, स्कोपोलामीन एंड दिस पर्टिकुलर वन, राइट, कल पढ़ाया था मैंने, राइट। सेकेंड थिंग वी हैव गॉट इज अबाउट द, it is going to be a yellow color powder. It is going to be fastest one, that is going to have 11 to 14 second. अगर किसी से कुछ भी जानकारी निकलवानी है, आपने कोई चोर पकड़ लिया, you have got someone, maybe there is a terrorist, right, you must have seen in the movies, आपको इंजेक्शन लगाते हो और वो पेशेंट सारा ट्रूथ बोलने लगता है। वाई? बिकॉज दिस पेशेंट इज हैविंग डिक्रीज इन द कॉग्निशन। दिस थिंग इज नॉन एज व्हाट? now this thing is used for the narco analysis in the cases of truth serum. This is known as truth serum बेटा, ठीक है। बट याद रखना है दिस इज कॉन्ट्राइंडिकेटेड इन द पोर्फायरिया एंड ब्रोंकियल अस्थमा, है ना। propofol, this thiopentone is contraindicated in the porphyria and bronchial asthma. Second one we have got is going to be your propofol. This propofol is going to be made up of what? It is made up of EGS, you need to remember eggs, है ना। तो E4 you need to remember about the egg lecithin, it will be having egg lecithin. G4 it will be having glycerol, and S4 it will be having what? Soybean, it will be having soybean, right. It is going to be milky white in color, and it is going to be agent of choice in multiple cases like malignant hyperthermia will be there, antiemetics will be there, neurosurgery will be there, liver kidney day care, everywhere it is going to be agent of choice in day care surgery. So what you need to remember, where it is not the agent of choice, कहाँ नहीं देना है इसको, ये याद कर लो। This is going to be what? In the cases of shock, if a patient is coming with the shock, that means decrease in the perfusion. If someone is having decrease in perfusion, you are not going to apply which drug? आप कौन सी दवाई नहीं दोगे, कौन सा IV anesthetic agent नहीं दोगे? This is going to be the important one. This is going to be the agent of choice in multiple cases, but it is not going to be used in the cases of shock, है ना। malignant hyperthermia में you are not going to use any inhalational agent, आप कोई भी inhalational agent नहीं दे सकते, आप succinylcholine नहीं दे सकते, right. So you will be using what? You will be using propofol as a drug of choice, right. This is going to be the thing. Remember this etomidate that we have got, this etomidate is going to be cardiovascular stable. एक और चीज पढ़ाई थी इससे पहले, cardiovascular stable, these are going to be your opioids, right. Another from non opioids we have got what? Etomidate, which is going to be cardiovascular stable. This is also going to be milky white solution. तो milky white दो हो गए, these two are milky white, this is going to be yellow powder, right. So this is going to be CVS stable. It is contraindicated in adrenal suppression. अगर किसी को adrenal suppression है तो कौन सा ड्रग नहीं देना है? This is going to be what? Etomidate. Etomidate is cardiovascular stable, but you would be avoiding this drug in the cases of adrenal suppression. Ketamine is a drug which you will be using. It is going to cause what? It is the best bronchodilator IV. Best bronchodilator IV is going to be what? Ketamine. It is going to be a sympathomimetic drug. Sympathomimetic means it is going to activate your alpha 1, alpha 2, beta 1, beta 2, beta 3 receptor, right. All this receptor activity will be increased. I've taught you yesterday in, we have discussed about all those things. It is going to be agent of choice in the cases of shock. It is a sympathomimetic. Definitely we require this type of action. In bronchial asthma, it is going to cause bronchodilation. Analgesia, it is going to cause what kind of amnesia? This type of amnesia is known as what? Dissociative amnesia. Dissociative amnesia is going to be there, right. But remember, it is contraindicated in which cases? Hypertension. It is a sympathomimetic thing. If it is a sympathomimetic thing, we are not going to use this particular thing in the cases of hypertension, in the cases of epilepsy, in the cases of glaucoma, right. So these are about the IV agents that we are having. These are the important IV agents that we are having, right. Now question we have got, which of the following intravenous anesthetic agent does not result in myocardial depression? Which one was the CVS stable? Which one was the CVS stable? CVS stable कौन सा था बच्चे? Cardiovascular stable. CVS stable IV. IV में opioid में all the opioids are going to be CVS stable. Morphine सब CVS stable है, right? In this particular option, we do not have morphine vagera, so we need to identify about non-opioid. And in the non-opioid class, remember, etomidate is the most serious stable. Etomidate is the most cardiovascular stable. These are the questions they have asked, right? So this is going to be the answer. Etomidate is going to be the answer. Another one, which of the following agent does not cause pain when injected? Okay, which is the one which is not going to cause pain when injected? पेन कब कौन से नहीं होगा? Painless is going to be what? This is going to be ketamine, bacha. This is going to be ketamine. Ketamine is going to be the painless one. Ketamine is going to be the painless one that we are having, and this ketamine is going to cause what? Dissociative anesthesia. It is going to cause what? Dissociative anesthesia, right? बाकी सारे हम लोगों ने पढ़ लिए, राइट? विच ऑफ द फॉलोइंग इज एन एब्सोल्यूट कॉन्ट्राइंडिकेशन टू यूज ऑफ मॉर्फिन? मॉर्फिन कब नहीं देना? एब्सोल्यूट कॉन्ट्राइंडिकेशन. दिस इज अ ट्रिकी क्वेश्चन बेटा, है ना? इट इज गोइंग टू इंक्रीज व्हाट? इट इज गोइंग टू इंक्रीज intracranial tension, बच्चे. It is going to increase the intracranial tension. It is going to increase the intracranial pressure also. Lots of intracranial pressure will be increased. So you are not going to give this particular one in the cases of head injury, है ना? head injury में इसको बिल्कुल भी नहीं देना है, right? That respiratory depression is going to be a thing which can be seen in the cases of, like, if you are having bronchial asthma, we can look about it, but this head injury we are not going to use this particular thing, right? This is going to increase lots and lots of pressure, right? This is going to be head injury. For a patient with cardiac disease, which of the following induction agent would be most suitable? Cardiac disease, again, your answer will be what? If they want to ask you a question about cardiac disease, your answer will be what? Your answer will be etomidate again. Your answer will be etomidate again. Etomidate, right? For daycare anesthesia, what is the preferred intravenous induction agent? Daycare anesthesia, preferred intravenous induction agent. This is going to be what? For daycare surgery, always remember daycare anesthesia, daycare surgery, always answer will be what? Propofol. The only thing you need to remember, in the cases of shock, this propofol is contraindicated, right? In the cases of shock, this propofol is contraindicated, and in the shock patient, agent of choice is going to become what? Sympathomimetic one. This is going to be ketamine. This is going to be ketamine. If they are asking about shock along with CVS stable, CVS stable is going to be what? This is going to be etomidate, beta. This is going to be etomidate. Okay, this is going to be etomidate. Which inducing agent is likely accountable for the patient's hallucinations and vivid dreams during the recuperation phase following anesthesia? कौन से में आएंगे? Dissociative anesthesia वाला. This is going to be what? This is going to be your ketamine, beta. This is going to be your ketamine. Ketamine is going to be answer in this particular case, right? Next question, next thing we have got is the local anesthesia. So we have discussed about the basics of these particular anesthesia. Opioids, morphine, fentanyl, sufentanil, remifentanil, important ones. Non-opioids, we are having propofol, etomidate, thiopental, and your ketamine, right? Now we will be discussing about the local anesthesia. We have got what? Amide and esters. So let's discuss about the amides and esters that we are having. So we have got amides, we have got esters. So what is the difference between these two, and what is this local anesthesia, how this is going to work? Remember, this local anesthesia is going to stop the transmission of impulses locally. Yesterday I told you about all the systems, right? Last class we have discussed about the physiology, how this impulse is going to travel through different alpha, beta, gamma, delta fibers, right? These are the fibers which are going to take the information to the spinal cord, and from the spinal cord this information will go to the thalamus. From the thalamus this information will go to the somatosensory cortex. Now what we are doing, how this information is traveling, we are blocking this information somewhere in between, right? Suppose this is a neuron, right? We are having traveling of the impulses. I am going to block this impulse somewhere in between. What is going to happen? Your brain is not going to understand what is happening, right? So stop the transmission of the impulses locally by inhibiting which channels the current is transmitted. What is the current in our body? This is sodium. So this sodium inhibition we are going to do, this is going to cause what? Transmission impulse, transmission is going to be stopped, right? This is going to act on which channels? This is going to be acting on voltage gated sodium channel. These are going to be your voltage gated sodium channels, and these are going to be open type of sodium channels that we are having. Remember, when we are giving this particular thing, local anesthesia with adrenaline, their activity will be increased and they will be avoiding the what? They will be avoiding the toxicity also, right? If you give this local anesthesia alone, like cocaine or lignocaine alone, this is not going to work very well, right? This is going to work for like 60 minutes, right? 30 minutes, 40 minutes. But if you add on what adrenaline, it is going to prevent the systemic toxicity, and now this thing can work for like 2 to 3 hours also, right? So that is why we are always adding what? We are always adding what? Adrenaline to this particular thing, है ना? Adrenaline मिला के देते हैं हम लोग. So we have got two group of drugs. We have got esters, we have got amides. We have got esters, we have got amides. So what are these esters? We have got what? We have got cocaine, we have got procaine, we have got chlorprocaine. Everyone is going to have what? Esters are going to have a single I, which is going to be in the cane. Whereas the another one, amides, are going to be your lignocaine double I. Prilocaine will be there, bupivacaine will be there, dibucaine will be there. All of them are going to have what? Double I. And remember, all of them are going to undergo what? All of them are going to undergo hepatic metabolism. All of them are going to undergo what? Hepatic metabolism, right? Whereas the esters are going to undergo what? Pseudocholinesterase, metabolism by pseudocholinesterase, right? But what is the exception? Exception is going to be cocaine. Remember, this cocaine is going to be what? Cocaine is going to be what? It is going to undergo hepatic metabolism. Hepatic metabolism. And remember, this cocaine is something which is going to cause vasoconstriction. ये vessel को constrict कर देगा, nasal vessel को constrict कर देगा. Some people who are snorting the cocaine, they are going to have what? They are going to have what? जो snort करते हैं cocaine को, they will be having nasal septal perforation, right? Those people who are using this cocaine, they can also have jet black color pigmentation of the tongues, right? This is a cocaine which is going to cause what? Hypertension, vasoconstriction, leading to what? Increase in the blood pressure. It is going to increase what? Blood pressure, right? It is going to undergo hepatic metabolism. तो अगर किसी का liver खराब है तो आप क्या नहीं दोगे? आप cocaine नहीं दोगे, आप इनमें से नहीं दोगे. You can use procaine और chlorprocaine, है ना? तो लिवर खराब है तो इनमें से नहीं दोगे, राइट? अगर किसी को सूडोकोलिनेस्टेरेस वाला इश्यू है, सो यू कैन यूज एनीथिंग फ्रॉम द दिस पर्टिकुलर वन, लिग्नोकेन, प्राइलोकेन. In fact, this lignocaine is going to be very commonly used. It is one of the safest anesthesia that we are having, right? Lignocaine आप बहुत commonly use में लेते हो. This is the safest anesthesia that we are having. तो local anesthesia का मतलब समझ में आया. So let's try to understand about different anesthesia, and they are asking very important question. Repeat question multiple times. Repeat question is about the last. What is last? Local anesthesia, systemic toxicity. So let's try to understand what is this cocaine. होता क्या है cocaine? And this cocaine is going to cause what? Vasoconstriction. It is going to cause what? Hypertension. And this hypertension is going to cause what? Nasal septal defect. Oh, sorry, not defect. Septal perforation will be there. And a jet black pigmentation of the tongues can also be there. Right? Shortest acting, if they ask you, your answer will be that will be chlorprocaine. Shortest acting is going to be what? Ester is going to be what? Chlorprocaine is going to be shortest acting. Longest acting is going to be what? Dibucaine. This is going to be amide. Amide में I आता है, याद रखना, double I. Double I will be here. This is going to be what? Amide. Amide will be having I. Right? Safest one is going to be what? Lignocaine. Safest one that we are using is your lignocaine. Okay, lignocaine. And most cardiotoxic is going to be your bupivacaine. Bupivacaine. Remember, this bupivacaine is going to be the most cardiotoxic. CNS में क्या symptoms आते हैं बच्चों? CNS में last अगर किसी को local anesthesia, systemic toxicity हो गया, we are giving this drug on a local anesthesia basis, right? But sometimes if someone is having systemic toxicity of this local anesthesia, this patient will be having what? CNS symptoms will be, patient will be having tinnitus, patient can have perioral numbness will be there. In CVS, you will be having arrhythmias, you will be having cardiac arrest, you will be having arrhythmias, and you will be having what? Cardiac arrest. What is the treatment for this last? कार्डियक अरेस्ट मतलब क्या हो गया? दिल बंद हो गया. दिल बंद हो गया मतलब कहानी खत्म. व्हाट इज द फर्स्ट लाइन यू विल बी डूइंग फॉर द कार्डियक अरेस्ट? राइट, कार्डियक अरेस्ट हो गया अगर किसी को. एंड व्हाट इज द ट्रीटमेंट फॉर दिस पर्टिकुलर थिंग? यू विल बी यूजिंग 20% इंट्रालिपिड इमल्शन. Intralipid emulsion, this is going to be the drug of choice. Okay, this is going to be the drug of choice. Very, very important, multiple times asked. 20% intralipid is going to be the solution. That is what is going to be the drug of choice for local anesthesia, systemic toxicity. What you are adding? You are adding adrenaline to prevent the systemic toxicity, right? To prevent the systemic toxicity, you are going to give what? Adrenaline. Remember, I told you the concept. The concept, you are going to compress the vessel. What is going to happen? They will be having what? No pores. No pores will be there. What is going to happen? Decrease in vascular permeability. This vessel will be compressed. Nothing is going inside. If this vessel is dilated, you will be having what? Some space will be there, and the drug can enter into your systemic circulation. And if it will be reaching to heart, it can cause arrhythmias. It can cause cardiac arrest also. Right? What are the uses of this topical local anesthetics we can use? We can use it topically for the uses of amla. What is amla? Amla is a eutectic mixture of local anesthetics. Amla क्या होता है? Amla is the eutectic mixture of local anesthetics, where we are going to use what? Lignocaine plus prilocaine, where we are going to use what? Lignocaine plus prilocaine in the ratio of 1:1. This is going to be 2.5 to 2.5 ratio. Right, this is going to be amla mixture that we are having. Right, we can use it for the infiltration purpose also. We can deposit around the nerve fiber. We can deposit around the nerve fiber. Right, this is what we are doing in the cases of what? We are doing in the cases of tooth extraction or something. Right, we are doing RCT. We can give what? Infiltration type of anesthesia. Then we have got what? Then we have got regional anesthesia. Then we have got what? Regional anesthesia. In regional anesthesia, what you need to understand, we have got what? We have got two important types of anesthesia. One is going to be spinal anesthesia, another one is going to be epidural anesthesia. So one is going to be spinal one, another one is going to be epidural one. This is going to be spinal and epidural. What are the things you need to look for in this? Some issue, just give me a moment. I'll fix this. Okay, all right. Yes, so we can have two types of things over here. In the central neuraxial blockade, we have got two types of things. Use fine. In the central neuraxial block, in the regional anesthesia, we can have two types of regional anesthesia. One is going to be spinal anesthesia, another one is going to be your epidural anesthesia. In spinal one, what is going to be happening? You are going to put your drugs in the CSF. Right, spinal means you are going to put your drugs in the CSF, and this is going to be a single shot technique, one shot technique. Less toxicity will be there, and it is going to give you fast effect. Effect will be for 1 to 2 hours, and the needles you are going to use is going to be spinal needles. Spinal needles, these are going to be Dura cutting, Quinky, Whitcare, Sprotty needles. These are the different types of needles that we are having. This is going to be spinal anesthesia. अभी समझाता हूँ क्या होता है, right? Central neuraxial blockade means you are going to block in the center, right? What is in the center? You have brain, you have spinal cord. If you are giving a drugs in the spinal cord, you can give epidural anesthesia, you can give spinal anesthesia, you can give caudal anesthesia, right? Spinal, epidural, caudal anesthesia. Spinal anesthesia, you are going to go inside. What is the tract we are going to go inside? I'll just make you understand. Just wait for a minute. The another one we have got is epidural anesthesia. What you are going to have in the drug, you will be putting in the epidural stage, right? And this is going to be a continuous method. Continuous method, more toxicity can be there, slow process will be there, and this is going to work for longer period of time. And this is something we are going to use in the cases of what, if I want to get like we are using for them delivery, after post delivery, if I want to give someone analgesia, right? If I want to give someone analgesia, pain killing for such a long time, I can put this particular thing over there and I can slowly inject my drug, है ना? तो कहाँ से जाना है, कैसे एंट्री लेना है स्पाइनल कोड के अंदर? Let's try to understand. We can use two types of needles. For spinal anesthesia, for epidural anesthesia, we are going to use which needle? We are going to use beta 2He needle. This is the 2He needle. Can you appreciate this 2He needle will be having certain markings over there, right? Here you can appreciate certain markings are going to be present. This markings are going to be present, right? This marking and this wings are going to be present. These are the features of what? These are the features of epidural needle. These are the features of epidural needle. So epidural needles will be having what? Markings will be there, and this wings will be there. So we have got what is the route? We have got the route is going to be what? We are going to enter in the spinal cord through skin. Then we will enter into the subcutaneous fascia, skin. Then you will be having subcutaneous fascia. You have supraspinatus ligament, intraspinatus ligament, ligamentum flavum. Then you have dura mater, arachnoid mater, and subarachnoid. And below subarachnoid you will be having CSF. And below CSF you will be having what? Pia mater. Pia mater. Right? So this is going to be the sequence. This is going to be the sequence we are entering into the body. Let's try to understand in this particular diagram. So we have got skin. After skin you will be having what? You will be having what? Subcutaneous fascia will be there. You will be having subcutaneous fascia will be there. Then you will be having supraspinous ligament, supraspinous ligament. Then you will be having what? Intraspinous ligament, intraspinous ligament. Then you will be having what? This one, ligamentum flavum. Ligamentum flavum will be there. And then you will be entering into three layers. This one is going to be dura mater. Then you have arachnoid. Then you have what? Then you have entered inside. This is going to be what? Pia mater. This is how you will be entering inside, right? So this sequence is important. Skin, subcutaneous fascia, first supraspinatus ligament, then interspinous ligament, then ligamentum flavum, then DAP, dura mater, arachnoid mater, subarachnoid space will be there, and then pia mater will be there. These are going to be the layers. अगर आप दवाई यहाँ छोड़ देते हो about this dural space, this is known as epidural anesthesia. If you are putting your drugs in the epidural space, this is known as epidural anesthesia. This requires some expertise. Loss of resistance should be felt, and this requires some expertise, because this is going to be you just give it without looking at it, right? You cannot understand it, right? So this is going to be what? Epidural anesthesia that we are having. In the spinal one, this is going to be simple one. What is going to happen? As soon as you will enter the subcutaneous space, sorry, subarachnoid space, what is going to happen? You will be having CSF coming out. So you can easily understand this is a spinal anesthesia, right? CSF is coming out. You can inject your drugs now. This is going to be spinal anesthesia. This is going to be spinal anesthesia. Epidural, you will be feeling the loss of resistance, over there, right? So what can be the complications of this spinal and this central neuraxial blockade? Let's try to understand. The most common complication is going to be what? Hypotension. Hypotension is being the most common complication, and what you can do in the cases of hypotension, you can treat this particular patient with phenylephrine. You can treat this particular patient with phenylephrine. You are going to give what? Phenylephrine, which is alpha 1 agonist, which is a alpha 1 agonist, going to cause what? Vasoconstriction. And this is the same phenylephrine you are using in what? You are using for your running nose, right? This is the same phenylephrine. For bradycardia with AV block, you already know the drug of choice we have discussed yesterday. This is going to be what? Atropine beta. Atropine is going to cause what? It is going to increase the heart rate. By increasing SA node, by increasing AV node, it is going to increase the conduction also. And if you are having urine retention, you need to increase what? Which system? Cholinergic system, because cholinergic is going to contract the uterus, contract the bladder also, right? So this is going to be neostigmine, which is going to increase what? Ultimately acetylcholine, and acetylcholine increase means M3 receptor will be activated, and M3 receptor activation will lead to what? Contraction of the urinary bladder. Contraction of the urinary bladder will be there, right? Just a minute. So next thing we have got is about the contraindications. What are the contraindications we are having? The contraindications when we are not going to do, how we are going to get inside? By L3, L4, right? What is the site for lumbar puncture also? This is going to be L3, L4, right? So we can go inside, and we can inject our drug, but when we are not going to go inside in the cases of infection. In the cases of infection, we are not going to go inside, right? We are not going to go inside in the cases of infection. Just a minute. All right. So when you are not going to go inside, all right, Mitchell. Now it's fine, right? So in which cases we are not going to go inside in the cases of infection, when there is any kind of infection at the site of entry. So we are not going to go inside. Second thing, if you are having what? Increase in intracranial tension, already there is increase in intracranial tension, we are not going to touch it, right? This is going to be increase in ICT. These are contraindication. And if the patient is already having some kind of heart disease, we are not going to do what? We're not going to give what kind of anesthesia. We will see another method. We have got a lot of methods for pain killing purpose, or to give anesthesia. We can give IV, or we can give inhalational anesthesia, but not this one, right? This central neuraxial blockade we are going to avoid in this particular case, right? This is going to be the basic funda we are having. All right, so this particular sequence you need to remember by heart, because they will be asking you question. 4 options will be there, right? And one of them is going to be jumbled up, right? So they will be asking you to match the correct following statement, and you need to identify the correct sequence. So remember, this sequence is very, very important. Okay, go through this particular one before the exam also, right? Then we have got what? Labor analgesia. In labor analgesia, we are going to use what? We are going to use epidural catheter. Sometimes we are going to use what, epidural catheter, and the drugs we are going to use are going to be your opioids or sometimes local anesthesia. This is going to be the gold standard that we are having, gold standard we are having, right? So what are the questions we can expect from here? What is the needle shown below in the picture? What is this particular needle, and it is used for which particular purpose? Can you appreciate this needle is having certain markings are there? Certain markings are there. Along with that, you are also having wings over here. This is going to be which needle? This is going to be your 2E needle. 2E needle used for which anesthesia? This is used for epidural anesthesia, beta. Epidural anesthesia. Which local anesthetic agent among the following leads to an increase in blood pressure? कौन सा बीपी बढ़ाता है? Cocaine. Remember, cocaine is going to cause vasoconstriction, leading to what? Increase in BP. So answer in this case is going to be cocaine. Cocaine is going to increase the BP. A patient presented with headache, vomiting, and fever. Meningitis was suspected. Yes, meningitis was suspected. Headache, vomiting, fever. While performing the lumbar puncture, we need to do lumbar puncture. The last structure you will pierce just before entering into the lumbar system. This is a very, very important question that they have asked. So what are the skin layer? What are the layers that you are going to enter? You are going to enter into skin, then subcutaneous fascia, then supraspinatus ligament, then interspinatus ligament, and then ligamentum flavum. Then comes your layers like dura mater, then arachnoid mater, then pia mater, right? Here below the arachnoid, subarachnoid, and between pia, you will be finding what? CSF, right? So you will be having what is going to be the answer in this particular case is going to be what? Arachnoid membrane, right? This is going to be the answer in this particular case. You just go through this particular cycle again and you will be able to remember this, right? Another important question, what would be the most appropriate approach to manage a young male patient who received regional block using 0.25% of bupivacaine for a minor surgical procedure, okay, but experienced sudden unresponsiveness and unrecordable pulse, unresponsiveness after injection? This is going to be what case? Unrecordable BP means what is going to be there? What is going to be there? Heart is unrecordable pulse. Pulse is the representation of your heart, contractility of the heart. This patient is having no pulse. No carotid pulse means what? Cardiac arrest. No carotid pulse मतलब cardiac arrest. और cardiac arrest में अगर बंदा गया, if the patient is in the cardiac arrest, we need to give first thing, this is going to be CPR. All of the options are correct for the CPR. But what about the case? This is a case of local anesthesia systemic toxicity. Local anesthesia systemic toxicity. So drug of choice in this particular case is going to be what? 20% intralipid. 20% intralipid solution. This is going to be the drug of choice, right? What about the sodium bicarbonate? You will be using in TCA toxicity, right? Dobutamine is inotrope of choice in what? In the cardiac failure patient, dobutamine, right? And calcium, you already know about calcium, no need to remember calcium here, right? This is going to be the A is going to be the answer. How do local anesthetics exert their mechanism of action? Try to answer this one. They are going to block which channels? Potassium, calcium, chloride, or something else? Yes, they are going to block sodium channels, open type voltage gated sodium channel. Open type voltage gated sodium channels will be closed, right? Leading to what? Leading to blockage in the transmission of impulses. If there is any blockage in the transmission of impulses, what will happen? You will be having what? You will not be able to understand what is happening, right? So you will be having pain killing property, anesthesia will be there. What is the likely diagnosis for a patient who receives 20% of intralipid injection? So जिसने ये इंजेक्शन लिया उसको क्या हुआ होगा? क्यों लिया होगा इंजेक्शन? एस्पेक्सिया में इंजेक्शन लेते हैं क्या ये वाला 20%? This patient might be having what? Local anesthesia toxicity was there. लास्ट के ऊपर पिछले लास्ट एग्जाम्स में बहुत सारे क्वेश्चन है ना, इनको गलत नहीं करना. During epidural anesthesia, which of the following structures are not penetrated? Simple question. So how we are going to enter? We are going to enter through skin, then supraspinatus ligament, then interspinous ligament, then ligamentum flavum, right? and then you will be having what? Durometer, and above durometer you will be having which space? Epidural space. Below you will be having which space? Epidural space. Okay, this is going to have epidural space, right? So you will be having what? Supraspinatus, interspinatus, ligamentum flavum. These things are going to be above, which is the structure which you are not going to penetrate. Not penetrated is going to be what? This is going to be definitely dura. Okay, you are going to give your drug in the epidural space. This is going to be Duramet, right? The next question we have got is which type of anesthesia is most suitable for pre-eclampsia? Pre-eclampsia अगर किसी पेशेंट को हो रहा है, eclampsia अगर किसी पेशेंट को हो रहा है, which is the drug which is the most suitable type of anesthesia? Is it going to be spinal? No. General anesthesia नहीं देना, पूरे patient is going to be there, right? Caudal block भी नहीं देना. This is definitely going to be gold standard. We have discussed gold standard is always going to be what? Epidural anesthesia. Okay, this is the same repeat question. What is the preferred anesthetic agent for dental anesthesia? What is the preferred anesthesia for dental surgery performed in daycare setting? कौन सा दोगे? आपको डेंटल सर्जरी कराना है, कौन सा एनेस्थीसिया दोगे? General, spinal, epidural, or something else? General anesthesia, spinal anesthesia, epidural anesthesia, or infiltration? For dental surgery, which anesthesia would you like to give here? This is going to be infiltration type of anesthesia. Okay, infiltration, you will be infiltrating the drugs around the lesion, है ना, उसके आसपास आप दवाई डाल दोगे and then you can extract this particular thing out. In epidural anesthesia, which of the following layer is least likely to be punctured during the procedure? Epidural anesthesia में कौन सी layer is going to be least likely to be punctured? Okay, हम लोग एंट्री करेंगे, लिगामेंटम फ्लेवम आएगा, सुप्रास्पाइनेटस आएगा, इंफ्रास्पाइनेटस आएगा. कौन सा नहीं आएगा? एरेक्नोइड नहीं आएगा. वी आर टॉकिंग अबाउट विच एनेस्थीसिया? एपिड्यूरल में एरेक्नोइड कहाँ से आएगा? एपिड्यूरल के बाद में ड्यूरा, देन एरेक्नोइड, देन पायामेट, राइट? सो दिस इज गोइंग टू बी, ए इज गोइंग टू बी द आंसर. वेरी गुड गाइस, राइट? नाउ वी हैव गॉट डीपोलराइजिंग एंड नॉन डीपोलराइजिंग मसल रिलैक्सेंट. इनमें क्या क्या पढ़ना है? लेट्स ट्राई टू अंडरस्टैंड. पहली चीज तो होता क्या है? देखो, मसल की एक प्रॉपर्टी होती है, मसल इज गॉट वन प्रॉपर्टी, इट रिक्वायर ऑप्टिमल स्टिमुलस. उसको 100 चाहिए. अगर आपने 101 दिया, 101 दिया तो नहीं लेगा, 99 दिया तो भी नहीं लेगा. सपोज इफ आई वांट टू कॉन्ट्रैक्ट माय दिस हैंड, I can contract my this hand because I am giving a optimal stimulus. If I give less stimulus, it will not contract. If I give more stimulus, it will not contract. So we have utilized two things over here. We have utilized depolarizing muscle relaxation and non-depolarizing muscle relaxation. कॉन्ट्रैक्शन के लिए क्या काम में आता है बच्चों? एसिटाइल कोलिन. तो एसिटाइल कोलिन का भाई कौन है? सक्सिनाइल कोलिन. ऐसा कैसा ही कुछ दे दो सक्सिनाइल कोलिन, क्या हो जाएगा? डीपोलराइजिंग मसल रिलैक्सेंट. सो बहुत सारा एसिटाइल कोलिन तो बना के दे नहीं सकते. यू हैव मेड व्हाट? सक्सिनाइल कोलिन फ्रॉम आउटसाइड. यू गिव सक्सिनाइल कोलिन टू द पेशेंट. मसल काम करेगा? नहीं करेगा. आपने एक्स्ट्रा स्टिमुलस दे दिया, डीपोलराइज कर दिया मसल को. Non-depolarizing are going to be another class. I'm going to make you understand what are these non-depolarizing. We have got aminosteroids, we have got benzyl isoquinolones, right? So we have got depolarizing. Depolarizing में एक ही बात याद रखनी है, सक्सिनाइल कोलिन. सक्सिनाइल कोलिन की वजह से कौन सा डिजीज हो जाता है? इमरजेंसी डिजीज. दिस इज गोइंग टू बी व्हाट? It is the shortest acting muscle relaxant that we are having. Remember, it is contraindicated in nerve muscle injury. वहाँ काम नहीं कर पाएगा. It is contraindicated in nerve muscle injuries, right? It can cause what? Hyperthermia. It can cause what? Bradycardia, right? It is having fast metabolism. We can use this particular one for the rapid sequence of induction. RSI हम लोग करते हैं. अगर कोई इंट्यूबेट नहीं हो पा रहा है, नॉर्मली कोई पेशेंट नहीं इंट्यूबेट हो पा रहा है, तो उसको क्या करो? सक्सिनाइल कोलिन लगा दो, मसल रिलैक्स हो जाएगा, आप आराम से इंट्यूबेट कर लो. You can use this particular thing for the ECT, electroconvulsive therapy, right? आप करंट देते हो. In fact, now the drug of choice has changed and now the drug of choice is methotrexate, है ना? एनेस्थीसिया वाले कराते हैं, पहले तो वैसे ही लगा देते थे, अभी हम लोगों को चाहिए होता है, right? In the cases of difficult airway also you can apply this particular thing, right? These are the three important functions, right? So these are the depolarizing one. Non-depolarizing में क्या याद रखना है? You have to remember two things. One is going to be aminosteroid, another one is going to be benzyl isoquinolone. Aminosteroid में no याद रखना है. They are going to have what? No. So these are going to be no. These are going to be what? pencuronium, these are going to be vecuronium, rocuronium, these are going to be no. होता क्या था, दिस क्यूरियम कुरारे, दीज आर योर कुरारेस, है ना, ये सारी चीजें कहाँ से है, ये कुरारेस से है ये. फ्रॉम वेयर वी गेट दिस कुरारे, कुरारे वही चीज है जो हम लोग नीडल पे लगाते हैं या फिर हम लोग अपने एरोस पे लगाते हैं. दिस इज ऑल्सो नोन एज एरो पॉइजन. So we are going to apply this and this is going to cause what? This is a non depolarizing muscle relaxant. तो जैसे ही ये एनिमल को लगेगा तो एनिमल के अंदर मसल रिलैक्सेशन हो जाएगा क्या? यस, मसल रिलैक्सेशन हो जाएगा. तो नाउ दिस एनिमल कैन रन? नो, इट कैन नॉट रन. ये लेट जाएगा, जहां तीर लगा वहीं गिर जाएगा, राइट? दिस इज व्हाट इज muscle relaxation. Second thing, it is going to release what? Histamine. And this histamine is going to cause two functions: vasodilatation, bronchoconstriction. And this bronchoconstriction will lead to डेथ ऑफ दैट पर्टिकुलर एनिमल ऑल्सो, है ना. थोड़ा बहुत वो मर जाता है, थोड़ा बहुत आप मार देते हो. दिस इज व्हाट इज हैपनिंग इन द old time. So we have decided to use this curares, right? We have decided to use this curares and we have made two things. We have made aminosteroids, we have made benzyl isoquinolones, right? These benzyl isoquinolones are going to be your cis-atracurium, atracurium, mevacurium. But इनके साथ में एक खास प्रॉब्लम क्या थी कि ये सब क्या रिलीज करते हैं? हिस्टामिन. They are going to release what? Histamine. And histamine is going to be CVS unstable. CVS unstable. It can also lead to what? Bronchospasm. तो हम लोगों ने क्या किया? हम लोगों ने इन्हीं में से कुछ ऐसे बनाए जो हिस्टामिन नहीं रिलीज करते. नो, दे आर गोइंग टू बी अमाइनो. They are going to not release what? No histamine will be released. So they are not going to release any histamine. No histamine release are going to be CVS stable. They are going to be cardiovascular stable. They are going to be utilized in the liver and kidney. All these things. This is going to be agent of choice in the cases of bronchial asthma also. तो हम लोग पेनकुरोनियम, रोकुरोनियम, वेकुरोनियम, इन सब चीज़ों को नॉर्मली यूज में ले सकते हैं, राइट. देन वी हैव गॉट अट्राक्यूरियम एंड सिस अट्राक्यूरियम. ये जो दोनों इधर से आते हैं, ये दोनों कब यूज में लेने बेटा? दे आर गोइंग टू बी हैविंग अ स्पेशल एलिमिनेशन. दे आर हैविंग अ हॉफमैन एलिमिनेशन. A special method of elimination is there. This is known as Hoffman's elimination. Hoffman's elimination. This is going to be a spontaneous elimination. It is due to spontaneous elimination. मतलब इसके लिए आपको लिवर की ज़रूरत नहीं है. अगर आपका लिवर खराब है, आपका किडनी खराब है, you can use which drugs? You can use cis-atracurium. You can use atracurium. Even if you are having kidney failure, even if you are having liver failure. किडनी एंड लिवर फेलियर, अगर ये दोनों खराब हो गए तो भी कौन सा दवाई दे सकते हो मसल रिलैक्सेशन के लिए? दिस इज गोइंग टू बी योर एट्राक्यूरियम, सिस एट्राक्यूरियम. दिस इज हाउ वी आर डिसाइडिंग, है ना. हम लोग जो पीएससी कर रहे थे उसमें हम लोग यही तो डिसाइड कर रहे थे कि कौन से पेशेंट को क्या देना है, किसको कौन सा एनेस्थेटिक एजेंट देना है, आईवी देना है कि इनहेलेशनल देना है कि कुछ और देना है, राइट. दिस इज हाउ वी हैव अंडरस्टूड दिस थिंग्स, राइट. So we have done what? We have done induction in our patient, we have done maintenance in our patient, we have done the reversal in our patient, है ना. हम लोगों ने क्या सीखा फ्रॉम द बिगिनिंग? मैंने बोला था एक पेशेंट आपके पास में आया है बच्चे, कोलेसिस्टाइटिस और कोलेलिथियासिस लेके. वो पेशेंट आपने ओटी तक पहुंचाया. ओटी में योर पेशेंट इज लाइंग डाउन ऑन द बेड. नाउ यू नो what are the anesthetic agent we are having. We have got inhalational agents, we have got what? We have got IV agents. आपको इनहेलेशनल पता है, सारे IV एजेंट्स पता है, राइट. यू नो अबाउट द मसल रिलैक्सेंट, यू नो अबाउट द लोकल एनेस्थीसिया, रीजनल एनेस्थीसिया. सारी ड्रग्स हम लोगों ने पढ़ ली. IV ड्रग्स वी हैव अंडरस्टूड अबाउट द अमाइड्स, एस्टर्स, बेंजाइल आइसोक्विनोलोन्स. वी हैव लर्नड अबाउट द अमाइनोस्टेरॉइड्स. सारा हम लोगों ने पढ़ लिया, राइट. नाउ व्हाट इज गोइंग टू बी देयर? नाउ वी नीड टू रिवर्स आवर पेशेंट. अगर कोई पेशेंट रिवर्स नहीं हो रहा, यू कैन यूज व्हाट? For this particular purpose, muscle relaxation. If someone is not reversing, is not coming back to the movements, right, what we can do, we can give neostigmine plus atropine. This is going to be indirect reversal agent because इसकी वजह से क्या होगा? एसिटाइलकोलिन बढ़ जाएगा और एसिटाइलकोलिन इज रिस्पॉन्सिबल फॉर द मूवमेंट्स, मसल कॉन्ट्रैक्शन स्टार्ट हो जाएंगे. सेकेंड थिंग वी हैव गॉट इज डायरेक्ट इनिबिटर. दिस इज गोइंग टू बी व्हाट? डायरेक्ट रिवर्सल एजेंट. दिस इज गोइंग टू बी योर सुगामा डेक्स. अभी रिसेंट में क्वेश्चन आ सकता है. सुगामा डेक्स इज अ डायरेक्ट रिवर्सल एजेंट दैट वी आर हैविंग फॉर द रोकुरोनियम एंड वेकुरोनियम. And then we have got calabadione. This is going to be a direct agent for all non-depolarizing muscle relaxant. सबके लिए ये एक सिंगल ड्रग काम में आ सकता है, राइट. Now just try to solve these questions. We have got the question, which is the fastest clinically available non-depolarizing muscle relaxant. So non-depolarizing muscle relaxant में बेटा हम लोगों ने दो क्लासेस देखा. मसल रिलैक्सेंट मतलब दो तरीके के हो सकते हैं. वी हैव गॉट व्हाट बेंजाइल आइसोक्विनोलोन्स, इनमें प्रॉब्लम थी, ये हिस्टामिन रिलीज कर रहे थे तो इसकी वजह से प्रॉब्लम हो रही थी. व्हाट आर द एग्जांपल? सिस अट्राक्यूरियम, अट्राक्यूरियम वाज देयर, ये क्यूरियम वाले थे, इनमें हिस्टामिन रिलीज हो रहा था. सेकेंड वन वाज अमाइनो स्टेरॉइड्स, दीज आर गोइंग टू बी व्हाट? क्यूरोनियम, क्यूरोनियम, they are going to be no histamine release, there will be no histamine release, histamine इनमें रिलीज नहीं हो रहा है. these are going to be chromium, right? so chromium हम लोगों को आंसर करने हैं. पहली चीज अट्राक्यूरियम तो वैसे ही आउट हो गया. then what is going to be the chromium which is the fastest? you can remember fastest, rocket जैसा RO, rocket like fastest is going to be what? this is going to be your rocuronium, ये हम लोगों ने पढ़ा था rocuronium, this is going to be the fastest one. Then another question we have got in the image provided below, the patient neuromuscular monitoring we are understanding, right? which of the nerve is most commonly utilized for this particular purpose? याद भी नहीं हो तो इस नर्व को देख लो, देख के पता चल जाएगा कौन सी नर्व को आप स्ट्रेन ऑफ फोर्स स्टिमुलस दे रहे हो, कौन सी नर्व यहाँ पर इन्वॉल्व होगी. दिस पार्ट ऑफ द बॉडी, दिस पार्ट ऑफ द हैंड इज सप्लाइड बाय विच नर्व? ये लास्ट वाली फिंगर्स आर सप्लाइड बाय विच नर्व्स? दिस पार्ट्स. Is it going to be median nerve, ulnar nerve, or radial nerve, or some other nerve? Definitely it is going to be ulnar nerve. And what is the most common response we are using? This is known as strain of four response that we are using, right? It is, and this test is known as neuromuscular monitoring. This is known as neuromuscular monitoring. Another question, a patient who received a supraclavicular block, supraclavicular brachial plexus block with 0.5% of bupivacaine डेवलप्स हाइपोटेंशन. पेशेंट को क्या हुआ? हाइपोटेंशन और अरिथमिया. हाइपोटेंशन और अरिथमिया हो गया पेशेंट को, मतलब क्या हो गया पेशेंट को? आफ्टर यूजिंग दिस 0.5% bupivacaine, bupivacaine is what? It is a local anesthesia and this patient is having systemic toxicity, right? This is a local anesthesia, systemic toxicity. Answer in this case is going to be what? 20% intralipid infusion is the treatment of choice for this particular case, right? अगर ये हाइपोटेंशन अरिथमिया की वजह से अगर ये पेशेंट कार्डियक अरेस्ट में चला जाता, देन यू विल बी डूइंग व्हाट? सीपीआर. कार्डियक अरेस्ट वाले पेशेंट में आप क्या करोगे? पूरा दिल बंद हो गया, पूरा दिल बंद हो गया, आप क्या करोगे? सीपीआर दोगे इस पेशेंट को, राइट? यू विल बी गिविंग व्हाट? सीपीआर टू दिस पेशेंट. Another question, we are having a patient with high bilirubin levels and high serum creatinine. We have got a patient with high bilirubin and high serum creatinine is planned for some kind of surgery. Which is the muscle relaxant that you would like to use in this particular patient? Muscle relaxant of choice in this particular case. This is going to be the shortest acting one that we are going to use is going to be mevaquirium beta. Shortest acting is going to be mevaquirium. Fastest acting is going to be rocuronium. Rocuronium. Now let's summarize whatever we have discussed. Let's try to summarize and then we will discuss about the oxygen delivery system, right? So we have got what? We have got IV agents, right? So in heart disease, what is the IV agent? We are going to use etomidate. This is going to be the drug of choice. Inhalational agent is going to be DES followed by ISO. And muscle relaxant for heart patient is going to be vecuronium. For asthma patient, we are going to use IV agent, that is going to be ketamine because it is a very good bronchodilator. Inhalational agent, you can use halothane, you can also use sevoflurane, we have already discussed, right? And coroniums are going to be good here in the asthma cases. Definitely they don't need what? Histamine. For the shock patient, the drug of choice is going to be what? Shock patient, the drug of choice is going to be what? Ketamine. Ketamine is going to be the one which we are going to use in the shock patient. Shock में क्या use नहीं लेना? We are not going to use what? Propofol. Propofol is the drug of choice everywhere apart from the shock. In shock, we are going to use what? Ketamine. Inhalational agent we can use is desflurane and isoflurane, and this is going to be pancuronium. For daycare surgery, we are going to use what? Propofol followed by desflurane, and here you will be using for daycare mevaquirium is the shortest one. This is what you are going to use. For neurosurgery, you are going to use what? Propofol. It is going to be good one for the head. Isoflurane we can use, and all of them are going to be good. Muscle relaxants are going to be, all of them are going to be good one, right? Then let's talk about the oxygen delivery system. Oxygen delivery system is of two types. We can use low flow oxygen device. हम पढ़ेंगे कब नेजल प्रॉन्ग्स लगाने, कब नेजल कैनुला लगाना है, कब मास्क लगाना है, कब रीब्रीदेबल मास्क लगाना है, कब नॉन रीब्रीदेबल मास्क लगाना है. So this is what we will be understanding over here. So we have got low flow devices, we have got high flow devices. बेटा दो तरीके की devices होती है, low flow and high flow. Low flow devices are going to deliver less amount of oxygen. High flow is going to deliver more amount of oxygen. So low flow, we have got nasal cannula, we have got nasal prongs, we have got face mask, simple face masks, we have got face masks with reservoir. High flow devices are going to be your Venturi mask, your nebulizers, your high flow nasal cannula, we have got ambu bag, right? This is a flow meter that we are having. This is what is going to regulate what? The flow of oxygen, right? ये देखा होगा हॉस्पिटल्स में, यू हैव अंडरस्टूड दिस, राइट? ये कौन से वायर कौन से कलर के साथ में एसोसिएटेड होगा बेटा? ऑक्सीजन डिलीवर करना है, कौन सा कलर होगा? कौन सा कलर होगा पाइपलाइन का? कौन सा कलर होगा? कौन से कलर में एयर ऑक्सीजन विल बी इन विच कलर पाइपलाइन इन डायमीटर इंडेक्स सेफ्टी सिस्टम? इंटरमीडिएट प्रेशर सिस्टम में कौन सा कलर होगा? Here you will be having oxygen is important. This is going to be white color beta, white color, right? So this is having some water. It is utilized for the humidification. दूसरी चीज मैंने आपको बताई थी, ये रिटर्न है FiO2 मतलब फ्रैक्शन ऑफ इंस्पायर्ड ऑक्सीजन, है ना? FiO2 मतलब क्या होता है? फ्रैक्शन ऑफ इंस्पायर्ड ऑक्सीजन. लाइक इन द एनवायरमेंट we are inspiring how much oxygen? Air, we are inspiring 500 ml of air is the tidal volume we are inspiring, right? In this tidal volume there will be what? There will be only 21% oxygen. बाकी environment में 100% oxygen तो है ही नहीं, right? So 100% oxygen नहीं है तो हम लोग कैसे लेंगे? We cannot inhale 100% of oxygen. So we can use this nasal cannula. These are your nasal cannulas, nasal prongs. This is used for the mild hypoxemia. Flow rate will be what? The flow rate will be 2 to 6 liter of oxygen they can deliver per minute. Okay, normal tidal volume is what? Normal tidal volume is what? Tidal volume is 500 ml. Your respiratory rate is around 12, right? So total कितना minute ventilation कितना हो गया? Approximately 6 liter of air it will require, right? Total air that you require is going to be what? 6 liter. Normally you are inspiring what? 6 liter, right? This is going to be minute ventilation that we are having, right? In the FiO2 is it can deliver 0.24 to 0.45. That is going to be 24% to 45% of oxygen can be delivered through this device. Then we have got simple face mask. This is going to be Hudson mask. Here you will be having flow rate of 6 to 10 liters per minute, right? It can deliver 35 to 60% of oxygen, 60% of oxygen, right? 35 to 60% of oxygen. Then we have got rebreathable and non-rebreathable mask, right? Rebreathable can deliver up to 6 to 10 liters per minute. FiO2 you can get what? 0.6 to 0.7% FiO2 you can get, right? That means 60 to 70% of FiO2 you can get, right? Non-rebreathable mask is going to deliver 10 to 15 liters of oxygen per minute. This is 10 to 15 liter of air per minute. This is going to be per minute, and FiO2 is going to be 60 to 80% will be there. 60 to 80% will be there. Enough. Venturi masks are going to be high flow devices. We have the fixed flow will be there. Fixed FiO2 will be there. Based on these things we are having, they are going to be utilized, है ना? इनके अलग अलग flow rate है, अलग अलग flow rate है. Everyone is going to have different FiO2. So we can give 24 to 60% of oxygen through this, है ना? 24 by 100. This is going to be 24 to 60% of oxygen you can deliver. If you want to deliver 100% of oxygen, you need to require what? You need to have what? HFNC, high flow nasal cannula. This can deliver 60 liter of air per minute, right? This is going to be 60 liter, and FiO2 is going to be 0.21 to 1%, है ना? 0.21 to 1. That means it can transfer 100% of oxygen also. And this oxygen will be heated and humidified. They can give you pictures like this. Remember, it is going to be high flow nasal cannula. ये जो लगा हुआ है, this is your HFNC devices, high flow nasal cannula. You can also have bag and valve ventilation. This is a mechanical ventilation. We can connect this to a source. अगर ये बिना सोर्स के है तो एनवायरनमेंट से लेके एयर को डाल देगा, बट अगर ये किसी सोर्स के साथ में जुड़ा हुआ है, ऑक्सीजन इज कमिंग, इट कैन डिलीवर 100% ऑफ ऑक्सीजन टू द पेशेंट, right? These are the devices. How to use, you can understand simply. Mild hypoxemia, you are going to use low flow devices. In the cases of severe ARDS patient, you are going to use for high flow devices. And the severe cases, you are going to use high flow devices, high flow oxygen flow you are going to give to this patient, right? Now just try to solve this question. Identify the equipment that is shown below. What is the equipment we are having? This is your previous year question. This is your previous year question. This is your nothing but your HFNC devices. Just now we have seen this is your high flow nasal cannula beta. high flow nasal cannula. Okay, what is the another one we are having? Identify the mask used in the given picture below that we have used during the time of COVID-19. This is going to be what? This is your non-rebreathable mask. Non-rebreathable mask. Then we have got certain fluids. We have got crystalloids, we have got colloids. Crystalloids are going to be the fluids which are going to be like normal saline. These are going to be what? Normal saline, RL. These are known as crystalloids. What are colloids? Colloids are like your blood, your things like your what is this thing? This is going to be what? This is going to be your albumin that we are going to apply. This is the albumin you will be using in which patient? Albumin you will be using in patient who is having proteinuria, patient might be having liver failure, patient might be having kidney nephrotic syndrome is there, right? Edema will be there in the patient. So what is the replacement ratio? That is very, very important. Suppose if a patient is driving through a bike and lost 3 liter of blood, so how much is the replacement ratio? If you want to administer this particular patient crystalloid, you will be giving 9 liter of crystalloid, right? 9 liter of NS, 9 liter of RL will be given, right? And what kind of cannula would you like to use in this particular case? Road traffic accident, RTA patient with 3 liter of blood loss, right? Colloid we can use. Colloid are going to be the substances which are going to have 1:1 ratio. You can apply like you can give 1 liter blood loss, you can give 1 liter blood directly. These are the colloid we are having, like starch, dextran, or albumin. They are the colloid we are having, right? This is going to be the colloid that we are having, right? What is the cannula? Let's understand about the cannula. You know what kind of solution we are going to use? We are going to use isotonic solution. Isotonic solution means it is going to have same tonicity whenever we want our blood, whenever we want our solution in the blood vessel. जब भी अपन solution को blood vessel में चाहते हैं, whenever we want to increase the BP of the patient, we can use RL, we can use NS. Okay, we can use RL, we can use NS. What is hypertonic solution? Hypertonic solutions are going to be solutions like we have got 3% of NS, right? So whenever you are having what? Whenever you are having surrounding tissue will be having what? Swelling, right? Whenever you are having cell swelling is there. So आप कौन सा solution use में लोगे? Hypertonic. Hypertonic means here you will be having more of sodium and less of water. So what is going to happen? This is blood. This is going to go to the blood. Blood is a connective tissue and it will be having more of sodium. What is going to happen? The sodium is going to attract what? It is going to attract the water from the cells. So it is going to be used in the cases of wherever you are having it raised intracranial tension, right? We are using things like mannitol. This is going to be what? We are using things like hypertonic solutions in the cases of SIADH where you will be having dilutional hyponatremia, right? When you are going to use hypotonic solution, beta, hypotonic means now this solution that you are giving is going to have less of sodium and more of water. Now what is going to happen? This more of water will go to the cells. Why? Because here you will be having more of sodium, right? So this water will be going to the cells. So anytime you want to cause what? Cell edema, where anytime you want to treat what? Cell dehydration, cellular dehydration, what solution you would like to use? You will be using hypotonic solutions here. Hypotonic solutions here, right? This is going to be hypotonic solution in the cases of diarrhea. You are going to use like 5%, D5 you are going to use, dextrose 5%. Then we have got the cannulas. What are the cannulas we are having? You can simply remember the cannula. This is going to be the orange one. Let me just make you understand all the cannulas. This is going to be the orange one that we are having. Orange one. This particular one is going to be which one? This is going to be the gray one. Then we have got what? Then we have got green. Then we have got pink color cannulas, right? Then we have got blue color cannula. Then we have got yellow color cannula and purple color cannula, right? You can also remember this thing with the help of this. Lava is going to be orange, soil is going to be gray, grass is going to be green. Then you have pink flower, pink, right? You can have blue sky, you can have yellow sun, and purple. You can remember the space. The space is going to be purple, right? This is going to be the types of cannula we are having. Or you can also remember the mnemonic that we are having, right? But apart from the mnemonic, you need to remember the flow rate also. What is the flow rate? The maximum flow rate you will be getting is from this particular one, that is going to be 250 to 300 ml per minute. 250 to 300 ml per minute it can deliver. The gray one can deliver less 100. This is going to be 150 to 250 ml. Right, these are used in the cases of trauma. These are used in the cases of trauma. We are going to give large IV, large bore IV cannulas. These are your which gauge? These are your 14 and 16 gauge that we are having, right? This is going to be orange and gray color cannula in road traffic accident patient we are going to give. Then we have got what? Green color cannula. This is going to have flow rate of 100 to 120 ml. So say exobase. And this is going to have you can remember like 55 to 80 ml. This is something you are going to use in all the adult patient. You are going to use this in the adult patient. You can use green color cannula. You can also use pink color cannula. This is a normal cannula that we are using, right? This blue color and this yellow color cannula we are going to use in the pediatric patient. Remember, this blue will be having 20 to 50 ml per minute, right? This is going to be 20 to 50. Here you will be having 15 to 20 ml. 15 to 20 ml you are using this particular in the pediatric age group patient. And the purple one in such patient which are having very premature babies or which are having what? Very old person, right? So premature baby or old person, you are going to use what? You are going to use purple color cannulas, right? You can also remember another mnemonic for this particular one. So this is going to be O great God, please bless your people. Anything you can remember, just remember this particular thing, right? This is going to be the cannula. This is going to be the size. We will start it from the 14, then 16, then 18, then 20, then 22, 24 and 26 gauge. These are going to be the size. These are going to be the size that we are having from the 14 to 26 gauge. The more the bigger the size will be, the more the bigger the gauge will be, it will be having narrower size, right? The less the bigger the gauge will be, like we are having 14 gauge is going to have maximum diameter, right? You can understand this. So now we will be discussing about the most important one-liners which you will be helping me to answer, right? This is the last thing we are discussing here. Which agent we are not going to use in the patient with egg allergies? These are all your previous year question. You can attempt all of them. Just try to answer along with me, right? So in egg allergy patient, which of the following we are not going to use? This is going to be your propofol beta. Propofol, remember EGS, we have understood about the EGS. This is what we are not going to use in the egg allergy patient. Should not be used if open for more than 6 hours. This is also going to be propofol. This is also going to be propofol. Most common agent used in daycare surgery. Daycare surgery agent of choice is definitely going to be your propofol, right? Which of the following is going to cause adrenal suppression? Adrenal suppression is going to be because of, it is because of etomidate, bacha. Etomidate, right? We have discussed about IV agents. In IV agents, we have discussed about the opioids and non-opioids, right? Non-opioids, I have taught you about propofol, etomidate, thiopentone and ketamine. These are the four I have taught you, right? In opioids, we have discussed about morphine, fentanyl, sufentanil, alfentanil, right? Which of the following causes adrenal suppression? Remember, adrenal suppression is going to be seen with the etomidate, and it is the most, another question that we are having, it is the most cardiostable. The cardiostable is going to be what? Etomidate. Most cardiostable is also going to be what? Etomidate. Which of the following is going to cause delirium and hallucinations, beta? Delirium or hallucinations after IV. IV agent going to cause delirium and hallucination. This is going to be what? Answer please. This is going to be your ketamine. This is going to be your ketamine. Which one of the following is going to be most painful on IV injection? This is going to be your propofol. Why it is painful on IV injection? Because it is going to be based on the lipids, right? Lipid will be there, right? Eggs will be there, glycerol will be there, right? Soya bean oil will be there. Best bronchodilator IV. IV best bronchodilator is going to be what? Ketamine. The second gas effect or diffusion hypoxia you will find with the nitric oxide N2O, right? Which of the following is preferred in induction agent in children? This is definitely going to be what? Sevoflurane. It is going to have which kind of smell? Sweet smell will be there. Sweet smell will be there. Sweet smell will be there. It can be induction agent of choice, right? IV inhalational questions last. This is going to be what preferred for induction agents in asthma. Asthma patient ko you can give what? Sevoflurane. You can also give what, bache? Yes, you can also give halothane. Halothane or sevoflurane. This is what you can give, right? The next thing we are having is about the preferred in induction in neuro, cardiac and liver surgeries. This is going to be what? We have discussed. This is going to be isoflurane. Isoflurane. Right? Renal or liver failure may we are going to use what? This is going to be your desflurane. Shortest acting neuromuscular blocker. Shortest acting neuromuscular blocker that we are having. This is going to be what? Neuromuscular blocker. We have seen two types of neuromuscular blocker. We have got depolarizing, we have got non-depolarizing. Here we have discussed about benzyl isoquinolones, and second one is about the aminosteroids, right? Curare, cronium. So what would be your answer? Shortest of all of them is going to be what? Depolarize, or shortest of depolarizing. Only one you remember. This is going to be your succinylcholine, beta. Succinylcholine, right? Shortest acting non-depolarizing, if they ask you, this is going to be which answer? So shortest acting non-depolarizing is going to be what? This is going to be what? Shortest acting non-depolarizing is going to be your mevacurium, bache. Mevacurium, right? Fastest acting non-depolarizing. Fastest one. Fast like a rocket. This is going to be rocuronium, right? And lastly, Hoffman elimination is seen with, I hope you remember this, atracurium and cis-atracurium. That means in the cases of liver failure and kidney failure patient, we can also give this particular drug. This is going to be atracurium and cis-atracurium. With this thing, we are done with the anesthesiology, right? What we have learned in the anesthesiology, okay, what we have learned, what we have discussed in the subject of anesthesiology, we have discussed about the basics from the beginning. We have understood what are the basics we are having. Then we get to know about how the things we are going to do, like pre-anesthetic checkup, what are the orders we are going to give to our patient, right? What are the drugs we are going to give to our patient, right? How we are going to bring our patient to OT, what are the things we will be having in the OT, like we have monitors, we have what? We have monitors, we have other things like what are desired monitors, non-desired monitor, how you are going to connect your patient to the machine. We have got to understand, we have got anesthesia machine, and these are going to be the circuits which are going to connect your patient with the machine, right? And ultimately you have understood about the drugs, what are the drugs you will be using in this particular case, what are the drugs you will be using for a general anesthesia, regional anesthesia and local anesthesia. Drugs we have discussed, and now you give the drugs to the patient, and now this patient will be operated by the surgeons, right? Now this person will be operated by the surgeons, and then you will do the reversal. This is what we are doing in the anesthesiology, right? So the last quote that we are having, this is going to be your stop doubting yourself, work hard and make it happen, right? This is going to be the thing we are having, right? These are my Instagram, Telegram. I would be putting this PDF right now. I will be sending the PDF, physio PDF also I will share. Okay, if you find any difficulties, please do reach out to me again. Okay, no issues with that, nothing. You can ask me. Okay, you can ask me all the doubts if you are having, right? Keep studying, keep learning, and see you in the next class. I think tomorrow or day after tomorrow we are having the next class, so we will be meeting in that, right? Okay, take care, Vicha.